Hi, I'm Naidu from Great Online Training. Are you looking for career in medical coding? You want to know what is medical coding and roles and responsibilities of medical coder, job opportunities in medical coding, career growth in medical coding, and what are the salary packages of medical coder, how to apply for a medical coding jobs, and what type of training do you need to become a medical coder. So let's get started with this particular video. I'm going to explain in detail in this. Our comprehensive medical coding training course is designed to equip students with necessary skills and acknowledge to pursue a successful career in medical coding. This course aims to provide students with understanding of medical terminologies like anatomy and physiology, as well as different coding systems used in healthcare industry, including ICD, 10CM, CPT, and HSPCS. Our expert instructor will provide hands-on training on practical exercises and real case studies to ensure thorough understanding of medical coding principles and practices. So here our course objective mainly understanding the fundamentals of medical coding, developing and accurate coding skills to various medical specialties, gain proficiency in ICD 10CM, CPT and HSPC coding systems, interpret medical documentation and assign appropriate codes, applying a coding guidelines and regulations, preparing for professional coding certification exam. Let's talk about our course structure. The training course will consist of live interactive sessions, practical exercises, coding practices, and periodic assessments to evaluate the progress. We offer the course in two modules. 45 days basic medical coding training is one module. Another one is 90 days medical coding. We offer the course with a different batches and we accommodate various schedules. Each batch will consist of limited number of students to ensure personalized attention to effective learning. If you are interested on live training with Nikita, so please log on to our website greatonlinetraining.com and enroll yourself for a free demo session. Please attend the demo session, see how our training is. If you are liking, then you can proceed further. If you don't like it, that's fine. So at least try our demo session before you enroll. If you are interested in this video, please hit like and subscribe to our channel and click on the bell icon for latest updates in our channel. So let's get started.
Hello everyone, how are you all? I hope you are doing well. I'd like to welcome you all for great online training, Day 1 Medical Coding Introduction. Okay. Before starting, I'd like to introduce myself. Myself Nikita. I'm medical coding trainer in Great Online Training. I'm a CPC certified medical coding trainer with around 6 years of medical coding experience. Okay, fine then. We'll move forward and see what are the topics we're going to cover in this class. Right? So we'll see what is medical coding, the roles and responsibilities of medical coder, the job opportunities in medical coding, career growth in medical coding. We'll see how much salary package you can expect as a medical coder. Also we'll see what types of training do you need to become a specialized in medical coding, and lastly question and answers. Okay, so the first point, what is medical coding? This is very common question most of the students ask to me. What do you know about medical coding? Anyone? Anything do you know about medical coding? Please feel free to share. One, it's okay. So, by the definition, medical coding is the process of converting descriptions of medical diagnosis, procedures, and other services into standardized, numeric, alphanumeric codes, numeric or alphanumeric codes, and these codes are universally accepted. Means these medical codes are same all over the world. Okay, this is the definition of medical coding. I'll explain you in the simple manner. It is medical coding is the process of taking patients' healthcare information, which can be any diagnosis, any symptom or illness from patient's report. Okay, or any medical procedure patient undergone, or any medical necessity, or medical equipment, or any other medical services the patient took, that we have to take from the physician or patient's report. Okay, and then we have to convert that information into medical code, that is called medical coding. Okay, and these are universal alpha or alphanumeric codes. We have to assign these codes to the medical diagnosis, procedures and services, right? We have to assign these medical codes to the medical diagnosis, procedure and services the patient undergone. Okay, so this is the transformation of complex medical report. Okay, complex medical reports into the simple medical codes which are accepted worldwide. All the medical codes are same in. Now we'll see what is revenue cycle management. Okay, revenue cycle management, also known as RCM. So what is the importance of this cycle, or why do you need to understand this cycle? The reason is medical coding is one of the steps involved in revenue cycle management. In simple language, revenue cycle management is nothing but, as the name suggests, it is cycle of management of revenue. Whose revenue? As this medical coding is it's happen in US healthcare industry, so management of US healthcare organizations revenue is called revenue cycle management. See, each year healthcare provider perform millions of procedures, services on patient, right? From simple checkups to complex surgeries. And this is the process of revenue collection for those services given by healthcare organization. Okay, so revenue cycle management is the process of collection of revenue for healthcare organization, right? This is the diagrammatic representation of revenue cycle management. Basically, this is the cycle between patient, provider and payer. Patient, provider and payer. Now first let me make you understand what is patient, what is provider and what is payer. Okay, so the provider means any doctor, whoever is going to treat the patient. Okay, provider is any doctor whoever is going to treat the patient, whether it can be his MBBS, MD, DO. Okay, or whether he's a radiologist, pathologist, anesthesiologist, whoever it can be, a provider. Okay, and provider is the blanket term used to describe anybody who provides medical care and certified to give medical care. Okay, who is provider means the one who is certified to give medical care, right? Now we'll see who is the patient. Patient is the one who receives medical care, who is suffering from any health issue, any diseases. Okay, who will going to receive medical care, we can call them as patient. Okay, then the payer is the insurance provider, right? Payer is the insurance provider. So let me help you figure out how healthcare works in India versus how healthcare works in US. Okay, Once you understand difference, you will get clear idea about what we do, right? So in India, most of us, we are not covered under insurance. Even if we are covered under insurance, we what happen is, you need to get admitted in hospital, right? To avail the insurance benefits, we need to get admitted in the hospital at least for 24 hours, right? Otherwise you will not going to receive any insurance benefits. And most of the outpatient services are not covered much in India, right? But in US that is not the case. In US almost everyone, even including children, they are all covered under some form of insurance. Why is it like this? Because cost of care, the level of care in India is very high. The cost of care in US is way too high. All the process are very costly in US as compared to that of in India. So there almost everyone is covered under some form of insurance. Either it can be government insurance or it can be private insurance. So what will be the patient doing all his or her life? They will pay some amount as a premium to the insurance company. Okay, they will pay some amount of insurance as a premium to the insurance company, and that is where payer comes in picture. Okay, so now we learn three pieces. The patient means the one who will going to receive the service from provider. Okay, the provider means the doctor, whoever it can be. It can be MBBS, MD, DO, anyone. Okay, who is certified to give medical care. And the payer is insurance company. Now we'll see how RCM cycle happens in between these three peoples. Where do medical coder comes in picture? Okay, you can see from this diagram, this cycle starts with appointment scheduling, then insurance verification, then in this third step, medical billing and medical coding happens. Okay, then the claim submission, then AR and denial management, and lastly reporting. Okay, but in the actually this revenue cycle management consists so many steps, but to make it simple, I have included few steps here. Okay, now we'll try to learn this cycle in simple manner. Okay, so now when you have any health issue, what happen in India, you will call your doctor, right? You'll call your doctor for appointment, or else you just walk into the doctor's clinic or hospital, right? Which is outpatient visit, where you pay him then and there, right? He will give you your report and prescription. He will write your vital signs, symptoms, reason for encounter, what was your chip complaint, diagnosis, and all, right? And finally he will wrote treatment and drugs you received or you have to take. Okay, he will hand over your report to you, and you will pay him then and there. So the cycle ends here in India, correct? In India, you pay your doctor then and there only, right? When you are not going to get your insurance benefit, means you are going to the doctor for simple checkups, like if you have fever or cough and cold, like that, which is outpatient visit. You see your doctor and come back to your home without any hospital. Means you are not going to admit in the hospital. At that time you pay your doctor then and there and come to your home. So That's how cycle ends here in India. Okay, so the provider getting paid on the same day. Okay, but in US this is not the case, right? In US, healthcare works in different manner. Their process is entirely different from our process. So what happened in US, even if it is a small outpatient encounter, means even if you have small means cold and cough normal, or some pain, back pain or something, right? First you need to schedule your appointment. Then the healthcare staff check your insurance eligibility and verify your insurance for insurance benefits and all. Okay, then you go to the doctor. Okay, and then the doctor check you. Okay, he did checkups, treatment. He'll ask you your medical history. He'll ask you about your current complaints. Okay, or what issues, what health issues you are facing. Sorry. So he'll going to ask you, and he'll give you treatment accordingly. Okay, and at this time the conversation between doctor and the patient is being recorded, either by audio either by audio recorded or entire video is recorded, and these recording are going to send to the medical transcriptor. Okay, medical transcriptor to translate that audio or video recording into word format. Okay, the medical transcriptor translate that video or audio recording into word format, and now medical coder comes in picture. Medical coder translate those complex reports. What I'm so sorry. Medical coder collect information, important important information from that reports, like diagnosis, the procedure, the services patient received, and he or she will convert those complex information to the simple medical course according to guidelines and policies. Okay, this this course consists certain bill amount or certain charges on it. Okay, so medical biller prepare medical bill and submit the claim, and that's how insurance company is going to understand how much amount they need to pay to the doctor, right? Likewise, in US, doctor or provider receive their payment for their service or care. Did you understand? Hello? Understand this revenue cycle management? It is okay.
Yes, ma'am.
Yeah, it is okay if you doesn't understand much, because we're going to explain this in each and every step in further sessions, right? Now we'll move ahead to the roles of medical coders. Okay, as of the main this medical coder play crucial role in healthcare industry. Okay, how medical coder play crucial role by translating complex medical information into standardized numeric or alphanumeric codes, right? They assign numeric or alphanumeric code to the diagnosis, procedures, and services based on medical records. These codes are used for various purposes, including billing, reimbursement, research, and healthcare data analysis. Okay. So the main role of medical coder is to ensure that he or she will going choose proper diagnosis and procedure from the patient's report, and assign the correct medical code following guidelines and policies of medical coding. Okay, so that healthcare provider receive appropriate payment for their services, and maintaining the integrity of patient's record. Okay, so now we'll see the responsibilities of a medical coder. The main responsibility is to review and verify documentation of diagnosis, procedures, and treatment results. Means when you get as a medical coder, you get any report, you know how to collect the proper information, because you can see the medical reports are sometimes in India will get medical reports of 1 to 2 pages, right? But in US they report each and everything, means your medical history, your chip complaint, your previous diagnosis, your if you have any procedure. Okay, if patient physician perform any procedure on you previously or in the current scenario, that is also mentioned in that report. But as a medical coder, it is your responsibility to choose the correct diagnosis for that current encounter. Okay, to choose correct procedure and treatment for that particular encounter, and then you have to assign the proper diagnostic and procedure that code to the that diagnostic and procedural information, right? So medical coder is responsible for coding and extracting patients encounters, and they need to make sure that codes are assigned and sequenced correctly following the guidelines and policies, right? So these are roles and responsibilities of medical coder. Now we'll see what are the different job opportunities in this medical coding. The main part of this industry, this US healthcare industry, is you can enter into this industry as soon as you completed your graduation, because minimum educational qualification requirement is graduation. Whether you are from science background or commerce background or arts, anyone can enter into this industry, because there are many roles present in this, or many job opportunities in this US healthcare industry. But if you want to be a medical coder, most of the companies prefer candidates from science background, because as a medical coder you sorry, you need knowledge about human anatomy, medical terminologies, right? But even if you are not from science background, you can join this industry. But one thing is important, that you have to be ready to learn about human anatomy and medical terminologies, and it will going to difficult for the commerce or arts, means non-science background students, right? That's why most of the companies prefer science graduated candidates only. So once you have graduated and earn your certification, you can start applying for medical coder jobs at different locations like hospitals, doctor offices, and other healthcare facilities, correct? And other option is work from home, or you can work remotely for directly for US companies. Now we'll see role wise what are the different job opportunities in this field. First one is obvious, medical coder, who is responsible for extracting correct diagnosis and diagnostic procedural information from the patient's record, and assign proper diagnosis and procedure code to that uh, to that medical information. Okay, following the guidelines and regulations. Next role can be coding auditor. Next role is coding auditor, or you can say as a QA, quality analyst. As name suggests, quality analyst. He is responsible, he or she, the quality or analyst responsible for conducting audits on coded medical records to verify accuracy and compliance with coding standards. Right? So, to become a coding auditor, you need at least few years of medical coding experience. You can start your career as a coding auditor. If you want to be in this field, if you want to become a coding auditor, first you have to start your job as a medical coder, because uh, as an auditor you have to mm, conduct audits on the coded charts by medical coders. Also, coding auditors offer feedback and education to coders for enhancing their accuracy. Okay, that's why QA requires at least few years of medical coding experience. Next one can be medical coding manager or supervisor, or you can say TL or team leader. Okay, who manages a team of coders, supervises coding processes, and ensure the achievements of departmental goals. For this role, also you need few years of experience as a medical coder. Okay, this medical coding manager also collaborates with healthcare professionals to improve coding and documentation practices. Next one is clinical documentation specialist, who collaborates closely with healthcare providers to guarantee accuracy and comprehensive documentation in medical records. So the clinical documentation specialists serve as liaison between clinical language and coding requirements. Basically, clinical documentation specialist is responsible for what you can say documentation. Okay. Next role can be compliance specialist, who ensures that coding practices align with healthcare regulations and guidelines. And next role is medical coding instructor, educator, or you can call it as a medical coding trainer, who trains individuals aspiring to enter the field of medical coding. Okay, who give education to such peoples about medical coding, to also maintain an updated curriculum reflecting latest coding guidelines and industry developments. Okay, again, to become a medical coding trainer, first you need few years of medical coding experience, right? Next role can be health information manager or director, who oversees the entire health information management department of medical coding and ensures confidentiality and security of patients' health information. Okay. The next one is remote coding opportunities. Many coding positions offer flexibility of remote working, right? Since this corona thing happens, the companies, most of the companies start providing remote working or work from home opportunities, or you can become a freelance or contract coder. Okay, so that you will get more flexibility while working, right? Now we'll see career growth in medical coding. As I told you, to go on higher position, you need few years of experience. Mostly to grow up your career in medical coding. When you start your career, you get hired as a junior medical coder, or as a medical coding trainee, where if you hired as a medical coding trainee, uh, they will give you the patient, the company will going to give you a few months of training, and then they will join you as a junior medical coder after completion of your training. But at that time, few companies ask you for money, or few companies give you that training free of cost. Okay, but there are very less companies who provide training nowadays. Okay, when I joined this industry, I got trained from my company itself, because at that time there are very less resources of medical coding training. So company itself provide training, and then uh, confirm us as a junior medical coder after completion of their exam. Okay, so the first step is either medical coding trainee or junior medical coder. If you already nowadays, there are many options of medical coding training. We also provide medical coding training. Okay, so if you took training from companies like us and already trained in medical coding, then you can join that company as a junior medical coder, or directly the second step, which is senior medical coder. Because you already know about medical coding, you already completed your medical coding training, right? You are certified, correct? So if you are, yeah, that is also one point. You can get either just a medical coding training or medical coding certification training also, and complete your certification before joining this field, so that you directly come to the step 2, senior medical coder. Okay, you can become a certified senior medical coder if you pass medical coding certification exams. Okay, what are those certifications, what kinds of training you need to become a coder, that we'll discuss in further slides. So the first step is junior medical coder, next step means second step is senior medical coder, and third step is you can become a quality assurance or QA. As I have told you before also, to become a medical coding QA, you need at least few years of experience as a medical coder. And after that, depending on your quality, your productivity, your knowledge, you will be promoted as a QA, where you have your responsibility is to conduct audits of coded charts by medical code, and if necessary, give feedback to them to improve their quality. Okay, because quality is very important in medical coding, because if you uh, put or select wrong medical code, the entire cycle will collapse, and the result of that, the provider will not going to receive their payment on time. It will be delayed, because that report then have to goes through different steps, right? So quality in this medical coding is very important part, right? So the next step after QA, you can become a team leader if you have team leading capacity of handling team. If you're senior manager and others saw capacity in you, that you can lead the team, they can promote you as a team leader. Okay, then you can become assistant manager, then manager, and senior manager also, as you gain more and more experience. Next, we'll see what qualities you need to become a successful medical coder. Okay. To become a successful medical coder, first you need proper knowledge or good knowledge about medical terminologies, human anatomy, physiology, human diseases, pharmacology, right? Because ultimately you have to read the report of the patient and select proper diagnosis, and after that you have to select proper code for that diagnosis or that procedure. So the knowledge of medical terminology, human anatomy, physiology, diseases, signs, symptoms, pharmacology is very important to become a medical coder. That's why most of the companies prefer only science graduate. But if you are from different graduation background, you can start your and you want to become a medical coder, you have to prove your knowledge, and for that you can go through different coding certification. If you are if you clear that certification, no one is going to stop you, correct? Because all they need is knowledge of the human anatomy, physiology and all, correct? Next is you must know how to read medical records. You must be aware about regulations, rules and regulations of US healthcare industry. You must know about the process of physician query. If any discrepancy or missing information in the patient health record, you need to query the physician. So you need to know about that process. Other qualities are or skills you required are, you should be detail oriented, you should be a critical thinker, you must possess good computer skills. As you have to work on the computer, you must be aware about different key shortcuts and all, right? How to use different softwares. You need good analytical skills, good communication skill and all. So these all the different qualities you required to become a successful medical coder, right? Next, the main part, the salary expectation. Am I right? Because everyone needs salary. So when you start this career as a medical coder, whether if you start your career as a fresher, just after completion of your graduation, you want to start your career, you can join as a fresher, non-certified. But there are very less opportunities present nowadays. As I told you, nowadays there are many medical coding training programs are going on. Medical coding training institutes are started. Most of the companies prefer certified or trained medical coder. Okay. So my suggestion for you, if you want to be in this field, don't make a hurry. First, get trained in medical coding, okay, or try to complete your medical coding certification before starting your job. The reason is here. You can see here, because if you join this industry as a fresher, non-certified, you'll get salary between 10,000 to 20,000 only. You will not get more than that. Okay. But see here the difference, directly 10,000 increment, correct? Even though you are a fresher, but you are certified, you will get salary ranges between 20,000 to 30,000. Good, right? To start your career. If you get 20 to 30,000 salary at the starting of your career, this much you can get in your future, correct? Again, where as you gain more and more experience, you can get more salary. up to 4 years of experience, you can expect up to 50 to 60,000 also. It depends on your experience, credentials, geographic location, and work settings, right? Credentials means how many certification you have earned, because each and every certification have means companies provide you extra certification allowance. Okay, so if you have many certification, you will get that much off. What I can tell you, you will get that much of certification allowance, right? Again, it depends on geographic location. Mostly, the company is based in south area. They will provide you more salary than as of now from Mumbai and Pune. Okay, again, it depends on work setting. If you work in night shift, you will get night allowance, right? So the salary again depend on the experience, your experience, credential, geographic location, and work setting. But this much is starting salary, 10 to 20,000. But if you are certified, you can expect 20 to 30,000. As certified coders command higher salary due to their specialized knowledge and skills. Correct? So now we'll see what types of training do you need to become a medical coder. First one is educational requirement. It is important to complete your graduation, because minimum graduation is required for most of the positions. Okay. Then post graduation is not mandatory, but if you complete any healthcare information management program, or any, as I told you, medical coding training program, or any related field, can provide valuable knowledge and enhance your job prospects. Like if you have any healthcare related information, sorry, education, like nursing or uh, b pharmacy and all, then it will be good, but not mandatory. Next is specialized medical coding training. Like I have told you, enroll in dedicated medical coding training program available through vocational schools, community colleges, or online institutions. Okay, you can go through those or complete those medical coding training programs, so that it will be easy for you to clear the interview rounds, because while interview, most of the companies prefer to take your aptitude test to check your knowledge. Okay, and then they proceed with other rounds, right? So comprehensive training covers essential topics like anatomy, medical terminology, healthcare procedures, and key coding systems, including ICD-10 CM, CPT, and HCBCS level 2 course also. We'll also going to see what are these course in further sessions. Okay. Next one is professional certifications. These are the certifications I have told you before. Sorry. Attend professional certification is highly recommended and may be prerequisite for employment. As I told you, nowadays there are many medical coding training institutes are started. Most of the companies only prefer even the candidate is fresher, they require certified candidates. Non-certified candidates are not in demand. Okay, so it is very important, if you want to be a medical coder, you, my request or my advice for you to complete your training and go for this certification. The certifications include certified medical coder, which is also known as CPC, offered by American Academy of Professional Coders, also known as APC. Second certification is Certified Coding Specialist, also known as CCS, which is provided by AHIMA, means American Health Information Management Association. Okay, or you can go for Certified Coding Associate, which is also known as CCA. This is also offered by AHIMA. And these three, any one of these three, you can complete before joining any organization. Okay, so you will command more salary. Right. Next is practical experience. Gain hands-on experience through internships, externships, or entry-level positions in healthcare settings. Practical application of coding knowledge is real-world scenario is invaluable. And lastly, soft skill development. Obviously, you must possess good analytical thinking, effective communication skills, attention to details. Okay, you must consist essential soft skill, right? So these skills are crucial for accurately interpreting medical records and translating them into codes. So that's all for today. If you have any question, feel free to ask me. And if you find this session interesting, I request you all to go on this site we have given below, which is www.greatonlinetraining.com, and register yourself for our medical coding training program and start your career in medical coding. Any question? Okay, then we'll meet tomorrow again on the same time. Okay, if you have any question, you can ask me. I'll try to
Okay.
give you answer. Okay, thank you for your attention. Have a great day. Welcome to Great Online Training. This is day 2, first step in medical coding. Okay, and I'm Nikita, a CPC certified medical coding trainer in Great Online Training. As you can see, today we're going to discuss about first step in medical coding, right? So in this session, we're going to discuss about if you choose medical coding as your career. Okay, so what kind of codes, what kind of different codes you have to use in medical coding, what is structure of those codes, that we're going to discuss in this session. In our previous session, I just give you introduction about medical coding, right? About what is medical coding, what is revenue cycle management, what are the different career opportunities in medical coding, how to apply for a job, and what types of certifications, qualifications required for medical coding, salary expectations, everything we discussed in our previous session, right? But then too, if you have any doubt about medical coding, if you have any question, feel free to ask me. Okay, today we're going to discuss about the first step in medical coding. So we'll see what are the topics we're going to cover in this class. We'll see again, I know what is medical coding, because you have you must have good knowledge about what is medical coding, what is RCM. That I will going to discuss in more detail in this session. Okay, what are the different steps involved in RCM, then what is ICD course, what is CPT course, what is HCPCS course, okay, what is modifiers, and lastly we'll see few examples of medical coding. Okay, and see how to find out the course, right? So I'm starting with what is medical coding. As you know, medical coding is the process of converting descriptions of medical diagnosis, procedures, and other services into standardized numeric or alphanumeric codes. Right? Means roles and responsibilities of medical coder is to convert the diagnostic and procedural and services provided by to the patient, convert this all this information into medical codes is called medical coding, right? Now we'll discuss more about revenue cycle management. Revenue cycle management is nothing but RCM. If you want to be in this field, if you want to start career in this field, you must have knowledge about, at least basic knowledge about revenue cycle management. Okay, because when you will going for interview, the interviewer surely going to ask you at least one question about this cycle. Okay, or at least he'll going to ask you what is meaning of RCM. So you must be able to discuss or give answer about this, right? That's why I have again included this point in this session. So this is the diagrammatic representation of revenue cycle management, which starts with appointment scheduling, then insurance verification, then medical billing, medical coding, then claim submission, then AR and denial management, and lastly reporting. Okay, that you know as of now. But today we're going to discuss more about each and every step. Okay. So basically, revenue cycle management is the process used by healthcare system in the US and all over the world to track the revenue from patients from their initial appointment or encounter with the healthcare system to their final payment. So basically, revenue cycle management is a cycle between patient, provider, and payer. So provider means any doctor, whoever is going to treat the patient, whether he is MD, MBBS, DO, anyone. Okay, who is certified to provide medical care to the patient. And then patient is the one who is going to receive the medical care, who is suffering from any disease or having any symptoms or illness, right? Then the what we can say payer is insurance provider. Okay, because uh, obviously patient is throughout their life, patient will going to pay certain amount as what can say as a premium to insurance provider, right? That's why here payer is the insurance provider. Okay, to make you understand is better, uh, I'll explain you in simple way how healthcare system works in India versus how healthcare system work in US. Okay, in India, most of us we are not covered under any insurance. Okay, few of us are covered under insurance. Either it will be provided by our company or that will be private insurance. Okay, but to avail that insurance benefit, we need to get admitted into the hospital. Okay, that insurance in India mostly applicable for inpatients only. Inpatient means one who is get admitted for at least 24 hours in the hospital to get service, medical service from the hospital at least for 24 hours. Then and then only you are eligible to get insurance, what you can say, benefits, right? And most of the outpatient services, like if you just have any back pain or something and you are going to doctor prescribe you some medicine and you came back to your home at the same time, same day, that service will not going to cover by insurance company. You pay the doctor then and there only. So in case of outpatient in India, doctor get paid on the same day, right? But in US, the condition is different. The healthcare system goes in different manner. In US, almost everyone, even including children, they are all covered under same form of or some form of insurance, right? Why is it so? Because cost of care, cost of the procedure, services, level of care in US is very high than India. So there almost everyone is covered under some form of insurance. Either it can be private insurance or it can be government insurance. What kind of insurance are there they using? That we'll going to discuss in next sessions. Okay, so what will be the patient doing all his or her life? They will be paying some amount as a premium to insurance company. That's the reason why here payer is insurance provider. Okay, now I hope you have clear idea about who is payer, who is provider, and who is patient, correct? Now we'll try to learn in this session. Just a minute. Okay. Now we'll see how RCM cycle happen in between three people. Okay. Where do medical coder comes in picture and what are different steps involved in this RCM cycle. Okay. Yeah, that is what we will try to learn in this session. So now when you have any health issue, what happen in India? As I discussed earlier, in India, you will call your doctor and schedule for appointment, right? Or you just walk in into the doctor's clinic or hospital, which is an outpatient visit, right? Where you paid him there only, okay, on the same day. But in US, that is not the case. Their process is entirely different from our process. So what happened in US? Even if it is a small outpatient encounter, patient need to schedule their appointment, and then their healthcare staff will check their insurance eligibility. Then actual encounter happen, then the conversation between doctor and patient is being recorded, and then that recording is sent to medical transcriptor. Then medical transcriptor convert that recording into word format and uh, prepare medical report, and then medical coder convert that medical report into codes. Medical coder choose the proper diagnosis procedure from that report and choose correct medical code for that particular diagnosis and procedure, and then send that codes to the medical biller team, right? Because those medical codes consist some charges or bill amount on it. So medical biller prepare medical bill and submit the claim, and that's how insurance company is going to understand how much amount they need to pay to the doctor, right? Likewise, in US, doctor or provider receive their payment for the service or care, correct? Now we'll see what are the different steps involved in RCM. The first step is patient registration. When patient call for appointment, the healthcare staff collect patient's demographic information like patient's name, patient's sex, patient's address, their date of service, their date of birth, everything, including insurance information. Okay, so this is the first step in revenue cycle management. Then insurance verification. Then the medical billing team verifies. Sorry for disturbance. Okay. Okay. There. Now, the second step is insurance verification, where medical billing team verifies the patient's insurance strictly end to end. Means they check for insurance eligibility, what are the benefits patient is eligible for, and all. Okay. Then third step is encounter, where patient consults healthcare provider. The details of condition and service performed is recorded either by audio or video. Correct? So this is about encounter. Next step is medical transcription, where that recorded audio or video is transferred into a medical transcript. Okay. The process of transferring voice recorded or video recorded medical reports by healthcare providers is termed as medical transcription. This is the definition of medical transcriptor. What is role of medical transcriptor? He convert that audio or video recorded medical information into health record or health report. Okay, he prepare health report in word format and send that report to medical coder. So the next step is medical coding, where medical coder transform that patient's condition, medical services, medical prescription into universally accepted alphanumeric codes, medical codes. Okay, that is called medical coding. So the next step is charge entry. Charge entry is the process by which charges of medical services are submitted to the appropriate payers for billing. Means medical biller team is going to submit the charges to the appropriate payer, means insurance provider. Okay. So the next step is the accounts receivable follow. In this process, this is process in the medical billing, which is responsible for looking after denied or rejected claims and refiling them with correct diagnosis or procedure codes. Actually, what is meaning of denied or rejected claim means? Denied means the claim is going to denied by insurance provider. The denied claims has to go through whole RCM cycle, and lastly it will be denied by insurance provider due to some discrepancy or some error. Mostly it is related to coding. Okay, so it is medical coder's job, it is medical coder's responsibility to choose correct diagnosis and procedure code, append correct modifier on that code if necessary, and submit the claim, right? So that less denied claims are generated. Okay. Next is rejected claims are those which are rejected in some step, in any step of the revenue cycle management, and get back to the another step, another previous step. Okay, so that we can correct that claim and refile again. Okay, but denial step, denial claim has to go through all the revenue cycle, correct, and get denied after going to the insurance provider. So this is also you can play role, or you can say this is also one kind of job in this US healthcare industry. Okay, where medical coder works as a denial coder. Okay, they work on denied claims only. Their job is to see what is the error, what is the reason for denial. Okay, so as you can see here, The next step is denial management. The denial coder has to work on denial claims and identify and resolve problems that lead to claim denial. Okay. And lastly, patient's follow-up and payment. The last step in the process is getting paid by insurer and the patient. Okay, this is all about revenue cycle management. I have explained you in very basic manner. Okay, I hope you understand. If you have any doubt, feel free to ask me. Can you go forward? Okay. Okay. So again, next is the medical coding. Now we're going to discuss more about medical coding and what kind of codes we're going to use in medical coding. Their structure, where can we find its code, who is going to update and maintain those codes. Okay, that we're going to discuss in this slide. So what is medical coding? Again, medical coding happens every time you see a healthcare provider. Okay. The healthcare provider review your complaint, medical history, makes an expert assessment of what's wrong and how to treat you, and documents or record your visit. Then the medical coders translate that documentation into standardized codes. Okay. Now, where there is the use of this codes, why we are converting these things into medical coding, right? You might have thinking why there is use of this code, why to convert these codes, means this information into codes, correct? The reason behind it, the insurance provider is mostly not from science background, so he'll not going to understand any medical term or a procedure or any disease. He or she doesn't have any knowledge about these medical terms, right? So to make them understand exactly how much amount they have to pay to the doctor, we help them. Okay, so basically as a medical coder, you get chance to work for us healthcare industry. You get chance to work for us insurance provider. Isn't it exciting? This is very good opportunity for you, and even you can join this field, this medical coding field, just after completion of your graduation. But my suggestion is, before joining, try to complete your medical coding certification, okay, or at least medical coding training program, so that it will increase your chances of getting highest paid job, like I told you in previous session, correct? Okay, then we'll see uh, what are the different kinds of code we're going to use. These codes are means medical coding. We are using medical codes to code the report. These codes tells the payer what is patient's diagnosis, what are the treatment, services, supplies provided to the patient, again, any unusual circumstances or medical condition that affected those treatments or services. Okay. Uh, again, so this all information the payer get understand using by seeing those medical codes. Okay. So medical coding's primary use is to ensure medical billing and insurance carriers pay and process claims correctly, right? But these codes are also valuable for research purposes and basic medical record keeping for patients. Okay, because mostly patients' information is kept digitally. So we can track patients' information, medical record uh, digitally, right? Also, these codes are being used for research purposes. And this medical coding standardizes the language and presentation of all these elements so they can be more easily understand, tracked, and modified. And this common language mandated by the Health Information Portability and Accountability Act, which is also known as HIPAA. If you want to start career in medical coding, please note down the points which I will going to tell you. This is important, that is important, because I have gone through many interview rounds. Okay, so I have a good idea about what exactly interviewer going to ask you in your interview, whether you are a fresher or experienced, anyone. So this is also the main point. The interviewer going to ask you what is HIPAA. Okay, at least they will ask you what is full form of HIPAA, right? So you must have understanding of it. So please note down it. HIPAA is Health Information Portability and Accountability Act, which allows hospitals, providers, and payers to communicate easily and consistently. Okay, so there are three types of codes inside medical coding. First one is ICD codes, right? ICD is nothing but International Classification of Diseases. Okay, ICD is International Classification of Diseases. As its name suggests, it is used for this course, or this course set is used for diseases, to code diseases and medical conditions. Okay, any condition like symptoms, illness, or any disease, disorder, or cause of death, we can code from these code sets. Okay, which are known as ICD codes. Then next one is CPT codes. CPT is nothing but current procedural terminology, which describes medical procedures and services. Okay, we use this codes to code physician services, surgical or diagnostic procedures or tests into alpha or mostly numeric codes. Okay, and lastly, third type of codes or code set we use is HCPCS codes, also known as HICPIC codes, right? This code means HCPCS means Healthcare Common Procedure Coding System. Healthcare Common Procedure Coding System is nothing but HCPCS or HICPIC codes. This code set describes non-physician services like means if wheelchair is used for the patient. Mostly these services are used for inpatients, right? Like ambulance, if you use if any patient use ambulance or any syringe or saline, anything which needs non-physician services, means nurses provide the care. Nurses use these supplies to provide you care. Okay, so those supplies which are used for patient's care. Okay, whatever supplies is required for patient care when patient is in the hospital, all those products and supplies we code with HCPCS. Clear this thing? Is it clear? We're going to discuss this all the code sets in further sessions. Okay, so we will start with International Classification of Diseases, which is nothing but ICD codes. Okay, ICD codes are a set of designations used by healthcare staff to communicate diseases, symptoms, abnormal findings, and other elements of a patient's diagnosis in a way that is universally accepted by those in the medical or insurance fields. Okay, so the codes used for coding diagnosis and symptoms, abnormal findings are same worldwide. Okay, and those are called as ICD codes. The ICD is maintained by World Health Organization. This is also important point. ICD is maintained by World Health Organization, WHO. WHO maintain ICD codes. Okay, WHO is responsible for maintenance and updating the ICD codes and use across the globe with some country specific modification. Okay, the 10th and the most recent edition is known as ICD-10, which we are using currently. Okay, ICD-10-CM, International Classification of Disease, 10th Clinical Modification. CM means clinical modification. And as it is 10th clinical modification, it is named as ICD-10-CM. When I started my medical coding journey, at the starting we were using ICD-9 course. At that time we were using ICD-9 course. Now it is ICD-10 course. Okay, those ICD-9 course which were we using are of 3 to 5 character codes, which are numeric codes with few exceptions. Then transition happen and then ICD-9 replaced by ICD-10 course in around I think in 2015. So in 2015 it changed to ICD-10-CM course. Okay, though these codes have 3 to 7 characters which are alphanumeric, where every code begins with an alpha character which is indicative of chapter, okay, to which code is classified, and then second and third character are numbers. Okay, first character is alphabetic character which is representative of chapter, and second and third character are numeric. Again, 4th, 5th, 6th and 7th can be number or letter. That is this is the structure of ICD-10-CM code. We're going to see that also. So the ICD codes will be updated every year via ICD-10-CM or PCS coordination and maintenance committee. Okay, so these codes are updated, ICD codes are updated each year, every year in October month. Remember this. This is also important point. ICD codes are updated each year by October month. Okay, from the reports of the October date of service, 1st October, you have to use the updated ICD-10 codes. Okay, because if you enter the previous or non-updated code, this obviously the system will not accept that code. Okay, so now ICD has two types. In the ICD also there are two types. ICD-10 ICD International Classification of Disease 10th Clinical Modification, known as ICD-10-C, which include diagnosis codes for reason for encounter. Okay, means any symptom, any illness, abnormal finding, or any disease, which is the reason for encounter. Okay, or impression, you can say, which is confirmed diagnosis. Okay, and the nature of these codes are 3 to 7 alpha and numeric codes or digits. Sorry. And this second type of ICD is ICD-10 procedure coding system. This is known as ICD-10 PCS codes. These codes include procedure codes for inpatient treatments and services. And the nature of these codes are 7 alphanumeric codes. Okay, 7 digit. You might have confused right now. Am I right? Because in the previous slide, I have told you CPT and HCPCS codes are used for procedures, right? But don't get confused. I will going to discuss more and explain you where we have to use what kind of codes. Okay, don't worry about it. This is just basic knowledge. This ICD-10 procedure coding system we use only for coding inpatient treatment and services, not for outpatient. Okay. I have told you that there are different kinds of specialties in medical coding. Like as we have many kinds of patient categories of patient like outpatient, inpatient, and different kind of services they are getting. The coding system also different, means speciality is also different. Okay, so when you are going for medical coding, when you are going to work in medical coding, you are working in any one specialty. Either you can be outpatient coder, you can be inpatient coder, you can be ENM coder, or as I told you, denial coder, or you can be anesthesia coder, surgery coder, or interventional radiology coder, or just radiology, pathology, and so on. There are many specialties present in medical coding, and depend on your specialty, salary also changes, salary package. Nowadays mostly inpatient coder commands higher salary because they have to code, they have to choose more diagnosis from the patient's report. Okay, they have to assign many codes for one patient or one encounter, right? Obviously, as he is admitted, inpatient admitted in the hospital, he will going to receive most of the care. Okay, that's why he and for their care, most of the supplies are also being in use, and you have to code all those services, all those diagnoses and all. That's why inpatient coder command higher salary than others. Okay, so don't worry about it if you don't understand difference between ICD-10, PCS and CPT code. Don't get confused. Okay, we'll see one example. See here, one patient having coronary artery disease, which is nothing but CAD. Okay, it is the diagnosis, and to cure CAD, angioplastic procedure is performed. Okay, this is obviously if angioplasty is performed on any patient, that patient is inpatient. Okay, he or she is admitted in the hospital. So you have to use the ICD-10 PCS codes for uh, coding this the angioplasty procedure, right? So code used for CAD is I25.10, okay, which is from ICD-10 CN, which is code set for used for diagnosis coding, right? Whereas code used for angioplasty is 047K042, which is description of this code is dilation of right femoral artery with drug eluting intraluminal device open approach. See how difficult it is. So generally ICD-10 PCS coding is uh, somewhat different, and way too much different but difficult than normal CPT coding. That's the reason why inpatient coder, or also known as IPDRG coders, command higher salary. Okay. Now we'll see. I hope you have now clear idea, or at least basic idea about what is ICD and what is the structure of ICD. I hope. Okay. Now we'll start with current procedural terminology, which is nothing but CPT codes. CPT codes consist a wide range of services performed by physicians, such as surgeries, tests, and evaluations. Okay. CPT was adopted as a part of Centers of Medicare and Medicare Services. Medicare Center for Medicare and Medicaid Services, also known as CMS. Please note down this part. CPT is maintained by CMS. CMS is Centers for Medicare and Medicaid Services. And it's a healthcare common procedure coding system, also known as HCPCS or HCP. This HCPCS code set is divided into two principal subsystems. Okay, so basically the CPT is one part or one set which is included in HCPCS coding system. Okay, so the level 1 of HCPCS is comprised the CPT codes, which we are used for physicians services or surgeries performed by physicians, surgeries which are diagnostic or any service, surgical services, any. Okay, test and evaluation, those we have to code using CPT, and level 2 codes are HCPCS codes, which are used for non-physician services like ambulance service, wheelchair, syringes, and all. Okay, so level 1 codes are also known as CPT, and level 2 codes are also known as HCPCS. Okay, the CPT codes are also known as level 1 codes. Okay, this is also main important point. You may get question on it that what types of code are or what is the another name of level 1 code, or what is the another name of CPT code, either way. Okay, so level 1 codes are nothing but CPT codes. Okay, and these are maintained by American Medical Association. Okay, AMA, American Medical Association. CPT codes are maintained by American Medical Association, and these are 5-digit numeric codes that are assigned for the following services and procedures. So these are the classifications of or chapter wise, you can say, classification of these codes. Okay, for evaluation and management, we have codes which are started with 99 series, 992012 to 99499. These codes are also known as 99 series. Okay, then anesthesia codes which are started with 00100 to 01999. Okay, then surgery codes which are started with this is the vast section of the CPT course. Okay, because it again depends or divided according to your body system. Okay, that's why it has wide range of codes which starts with 100212 16990. Okay, then radiology codes which are used for X-ray, CT, MRI, ultrasound, and all. These codes are comes under 7001027 499. Okay, which also known as 7000 series. Then pathology and laboratory codes which are 80048289356. Okay, and lastly medicine codes which are starts with 90281 to 99199. Okay, so these are different code sets used in CPT. Okay, you can find this course in CPT book, which is maintained by American Medical Association. So these are a few examples of CPT. And 71045, which is code used for radiological examination, which is nothing but X-ray, chest, single view. You can see here slightly difference in between in last digit, the fifth digit. Right, 7104 is common in this all these three. What can I say? These three CPTs. But just as the views changes, the last character is also changing. Right, 71045 is for single view chest X-ray. 71046 is for two view chest X-ray, whereas 71047 is for three view chest X-ray. Right, so you have to properly assign the code. You have to choose your code properly. Then another example is CT thorax without contrast is coded with 71250. CT thorax with contrast 71260. CT thorax with or without contrast is coded as 71270. Okay, again 90716, which is for administration of varicella or chickenpox vaccine. So this kind of codes comes under CPT, okay, which are used for outpatient procedure coding, okay, and ICD-10 PCS codes, which are also used for procedure coding, but those code set are used for inpatient coding. Okay, now we'll see what are the HCPCS codes. HCPCS is nothing but healthcare common procedure coding. Healthcare common procedure coding, also known as HCPCS or HICPIC, or they also known as level 2 codes. Level 1 codes are CPT codes, whereas level 2 codes are HCPCS codes. And these HCPCS codes are alphanumeric medical procedure codes, which are non-physician services. Okay, these codes are used for non-physician services. Supplies is provided to the patient. Okay, used for, as I told you now, used for non-physician services such as ambulance services and prosthetic devices and all. They represent items, supplies, and non-physician services not covered by CPT codes, which are level 1 codes. The codes which are not included, or the services not covered by CPT codes, are included in HCPCS codes. Okay. Level 2 codes are composed of a single letter in the range A to V, followed by 4 digits. Okay. Then level 2 codes are maintained by US Centers for Medicare and Medicaid Services. Again, these HCPCS codes are maintained by CMS. Please note it down. HCPCS codes are maintained by CMS. We'll see one example. As I told you, it composed of single letter in the range of A to V, followed by 4 characters. Like in this example, A0021. This code is used for ambulance service outside the state per mile transport. Okay, so this code is for ambulance service. Then J0290, which is used for injection ampicillin sodium 500 mg. Okay, so this is all about healthcare common procedure coding system. Okay. Now we'll see exact difference between. I know you have confused now between all these courses, but I try to make it easier for you. See here, ICD-10 CM, which is International Classification of Disease, okay, which describes diagnosis and medical conditions. Okay, ICD-10 CM describes diagnosis. Okay, ICD-10 PCS, which are used for procedure coding system, describes inpatient procedure. Inpatient is more important in this description. Okay, because ICD-10 PCS codes are used only for inpatient procedure services. These courses are not going to use in outpatient coding. Okay, if you want to go for inpatient coding, if you want to start your career in inpatient coding, IPDRG, then and then only you'll get education about this courses. Okay, for that you need to get separate training. Okay, because in normal medical coding training, you will not going any information or more information about or training about this ICD-10 PCS course, because these course sets are used only in IPDRG coding. Okay, but CPT course, ICD course, HCPCS course, these are common courses which are used in most of the medical coding specialties. Okay, that's why when you attend any basic medical coding training, at that time you'll get knowledge only of ICD-10 ICD-10 CM course, CPT course, and HCPCS course. Okay, so now again, ICD-10 CM course are for diagnosis, ICD-10 PCS course are for inpatient procedure, and CPT course, which are also known as level 1 course, are used for outpatient procedures and services. Okay, and HCPCS course are also known as level 2 course, and they describe non-physician services and supplies is provided to the patient. Also, ICD-10 CM course maintained by, you can note down whole information on this slide. Okay, because this is very much important information. Okay, ICD-10 CM course are maintained by World Health Organization, WHO. Again, ICD-10 PCS course are also maintained by WHO. CPT course are maintained by American Medical Association, and HCPCS course are maintained by Centers for Medicare and Medicaid Services, CMS. Can we move forward? Hello?
Ma'am,
Can we move forward? All right. So the next point is modifiers. Modifier in medical coding, modifier is two characters. Two characters. Either it can be numbers or two letters. Okay. These modifiers are appended to a CPT or HCPCS course. These are not going to open. We no need to, or we can't use these modifiers on diagnosis coding. Means ICD course. Okay, we have to use or append this course on CPT or HCPCS course only. Okay, why we have to append this modifier, in which cases, in which scenario, and what are the structure, what kind of modifiers are there, that everything we'll going to discuss in further sessions. Okay, I will give you proper information and one dedicated session for this modifier. Okay, don't worry about it if you don't understand anything during this session. Just try to understand the basic things, basic use of this modifier, basic what can I say, basic definition of these modifiers. Okay, so the modifier provides additional information about the medical procedure, service, or supply involved without changing the meaning of the code. Okay, medical coders use modifier to tell the story of a particular encounter. In other words, I'm sorry, just a minute. Okay. So, in other words, many medical and surgical procedures and services are complex, and modifiers indicate a service did not occur exactly as described by its CPT or HCPCS code descriptor. Okay, because each and every code has its own descriptor. Okay, and we have to match that descriptor with our patient's condition. Okay, which is mentioned, whatever is mentioned is in patient's report, we have to match that condition in CPT or HCPCS codes descriptor. But the situation did not change the code that applies. Okay, because if something happened during any medical procedure and patient has to terminate that procedure before completion. Okay, or sometimes physician has to repeat the procedure. Okay, provide same service more than once in the same encounter. Like in this scenario, we have to append modifier to that particular CPT code, because if we enter any CPT more than once on the same patient, same date of service, same encounter, okay, the system will show error. Okay, for that reason we have to append modifier. If you append modifier on that CPT, the system will not going to show you error. Okay, so modifiers explain why the physician or other qualified healthcare professional provide that service or procedure. Right, when to use modifier, I'll give you some examples. To provide additional information about services that were provided unusually. Okay, or to denote when not all the services in the bundle are not performed. Okay, or more than one provider perform the service or procedure. Okay, at that time also, obviously if two or three surgeons performing the same surgery, you have to explain that in coding manner, right? Because everyone needs their payment, correct? For that reason, you have to code that the same CPT 3 times. But if you enter the same CPT 3 times, the system will going to show you error as duplicate CPT, correct? But if you append the proper modifier for more than one physician, okay, the system will not going to show you any error. Then again, if procedure was bilateral, then also you have to append the code. If sometimes what happens, few procedures have bilateral code also. Okay, but few procedures are unilateral codes. Okay, so in that case you have to use code for bilateral procedure. Okay, 50 modifier is used for bilateral procedure. If you append 50 modifier on any CPT, the medical biller going to understand, okay, this CPT is performed twice or performed on both the lateral, left and right side. Okay, so this is the use of modifier. We're going to discuss more deeply. Don't worry about it. These are few examples of modifiers. CPT modifiers are generally 2-digit scores. Okay, like 53 modifier, which is used for discontinuous procedure. Discontinuous procedure means physician is performing procedure, but any health issue is happen, means either sometimes patient's BP goes increase or down. At that time physician has to terminate that procedure. Okay, in that cases we have to open 53 modifier, right? Whereas 76 modifier, which is used for repeat procedure performed by same physician on same date of service. Okay, if any cases physician has to repeat the procedure on the same patient, same date of service, like if any, like you can say, if one patient has 2 lesions on the abdomen, okay, and code for abdominal procedure on abdominal lesion is same, and what you will going to do, you will append, you will give that CPT code twice, right? But to not get error, you have to append 76 modifier on the second CPT, right? So that the system and ultimately the medical biller also understand the reason behind assigning that same CPT code twice. Okay. Now, HCPCS means level 2 code modifiers are alphanumeric codes. CPT modifiers are generally 2-digit codes, whereas HCPCS or level 2 modifiers are alphanumeric codes, or they have 2 letters only. Like E1 is used for upper left eyelid. Okay, if any service provided for upper left eyelid or any supply provided for left eyelid, then to mention that we have to use even code. Even sorry modifier. Okay, TC modifier, which is nothing but technical component. Technical component means if suppose I am having pain in my chest, okay, so I'll go to the doctor, one physician, but he ordered chest x-ray to find out the reason behind it, reason of that chest pain. He need to see my chest x-ray, but he doesn't have x-ray machine, so he refer me to another physician or another hospital for just chest x-ray. I'll do chest x-ray and took that report and get back to that previous physician and show him that report, chest x-ray report, and then uh, that first physician interpret that chest x-ray. Okay, here you can see the 2 physicians provide services to me, right? One is just interpreting that and order and then interpret that chest x-ray, and one physician, or you can say radiologist, perform that actual x-ray, and both need their payment, right? And for that reason you need to assign the CPT code. Suppose it is what I can say, single view chest x-ray 71010, you have to use 71010 2 times on the same patient, right? But to make medical biller understand how much amount they have to pay to the physician, how much amount they have to pay to the radiologist, we have to append TC modifier on one CPT. Okay, so that is how we will going to use modifier. I hope this is clear to you. Now we'll see few examples and see how we can search ICDs. Okay, and for that you need to go to icd10data.com. If it is possible for you right now to go on icd10data.com, please go on it. Otherwise, I'll also share with you. You can see my screen here. Okay, this is icd10data.com. You can see somewhat like this. Okay, we'll see the first we'll see we'll find out the code for chest pain. Okay, here again. Wait. Okay, now we have to find code for chest pain, right? So we'll have to go on. First we need to go into the pain session. Okay, codes for pain category. Pain starts with P, so we have to click here on P. Okay, and we have to type it down. Pain. You can see here they highlight all the pains in the yellow color. Okay, we need this one because we have only chest pain. There is nothing. If it is painful chest, we have to open on pain only. Okay, so I'll click on this pain. Now here these codes are depend on different sites. Okay, our site is chest pain. For that I press Ctrl F and find chest. Okay, this is the shortcut. We might have aware about it. Ctrl F to find out anything from the document. Okay, so I got the chest here in front of this chest. We'll see one code R07.9, but you can see here there are so many codes present under this chest. Okay, anterior wall, atypical, ischemic, musculoskeletal. Do we know anything about it? We have to find only chest pain. We don't know any specification of this pain, so we can't append on this codes. Okay, we have to choose this code only. Okay, I'll click here and see here it says chest pain unspecified because we don't have any specification, right? So we have to append on this unspecified code, which is nothing but R07.9. We'll see is it correct or not. Correct, R07.9. Next one is abdominal colic. Wait. To search another code, again we have to go on this. Here in index you can see ICD-10 CM index, external cause index, table of drugs, table of neoplasm. Okay, but we have to use ICD-10 CM index only. Okay, and what is our condition now? Colic. We can't go by abdomen. We can start with abdomen. We have to start with the condition, okay, or the symptom particular. So we go into C terms, and here we have to find for colic. Okay, see here how many colics are there. They get highlighted in yellow. Okay, so we have to go for this one, colic. I click here and I reached See, now we'll go by site. Our site is abdomen. Okay, so colic, abdominal colic. I'll choose this code. See, colic. And here also, if you go down, you can see applicable to colic not otherwise specified. Okay, or you can see here approximate synonyms: abdominal colic, colic child. Again, codes are depend on patient's age and everything. Everything we will going to discuss more. We're going to learn more about this in further sessions. Okay, don't worry if you doesn't understand. So right now this is our code R10.83. We'll see is it correct or not. R10.83. Right. Next one we'll have to see gallstones. Okay. Again we have to go on to the index gallstone. Here we have only one word gallstone, so we have to go by G only and type it here gallstone. Okay, so now see here gallstone doesn't give me any code. Now what to do? But he guided me that see also calculus, look for calculus, and then in the calculus see here there is comma between calculus and gallbladder. It means you have to first go for calculus and then under calculus you have to go on to this site, means gallbladder. If you click on this blue term, directly it will lead you to the calculus gallbladder. See here, you are under calculus term. It is, you can say it as a shortcut. Okay, if you click on this blue color term, it will directly lead you to that term. As here calculus and we are under, it is highlighted here in yellow color, calculus gallbladder. Okay, you have to carefully look for these lines. Okay, on the first line there is a gallbladder, so we have to choose this code. And if there is any condition with gallbladder like cholecystitis is present, or if you know that this gallbladder with is chronic or something, then you have to choose accordingly. But right now we have to find code for gallstone. Okay, so we'll click here and see calculus of gallbladder without cholecystitis, without obstruction. Right, when you doesn't have any specification about the specific information about that condition in patient's report, you have to assign unspecified code. Okay, here you have to go down. If you go down, you can see approximate synonyms are biliary calculus, cholecystitis, or gallstone, or gallbladder stones, like this. Okay, so our code is correct, which is nothing but K80.20. See, is it correct or not? K80.20. So the next we'll see is Crohn's disease. Crohn's disease of small intestine with fistula. See here. Here we need to find more specific code. Okay, because we have information, more information. So we have to go by these specifications. What is that? Crohn's disease. So we have to first go on to disease. Okay, because disease is the condition. Okay, all the diseases are get highlighted here, but we have to go for this one. only disease. Okay, when I go on to the disease, first I have to find whether it is what is that disease? Crohn's disease, right? Okay, so we'll see is it Crohn is present here or not. Okay, it is there. So Crohn's disease is present here, but it tell us that C enteritis regional. So we have to go like this. We have to click here enteritis regional. See here it leads us on here. The main term is enteritis and the subsection under the enteritis is regional. Directly lead us on this code. But again, see here, we have further specification. Crohn's disease of small intestine. The part is small intestine and plus with fistula, right? So we have to see whether we have the specific code. Small intestine, where is the small intestine? We have to search for it. And now you have to search it in this second line. Okay, you have to go by this second line. See here, the small intestine. Okay, we got here the small intestine here, right? Duodenum, ileum, jejunum, everything. Here is also one code given K50.00, but again we have further specification small intestine with fistula. So we can't append on this K50.00 code. If we assign this code, it will be wrong because we have more specification and we have more specific code for this condition. So now we are on the second line. Okay, then again under the small intestine we have to go with, and on this third line, okay, in third line we'll find fistula. So we have to choose this code. This is our code, which is nothing but K50.013. We'll see this code. See here, you can see the same description. Crohn's disease of small intestine with fistula, right? If you go down, it shows the path how we reach to this code. First we go on enteritis, then regional, then into regional we'll find small intestine, then with complication fistula. Okay, K50.013, correct code. Now last example is pressure ulcer of right hip stage 3. Okay, pressure ulcer right hip stage 3. Again we have to go on and this index. Okay, now our term is ulcer, right? We have to go on ulcer. Okay, we have to click on this ulcer, and here we need to find for hip. Control F, hip. See, we have stage also, right? We have specific stage, which is stage 3. Okay. So we have to look for hip, right? Oh, we have, see here. Now we are under ulcer, and the second row it is stage 3. Okay. or you can directly go by stage 3 stages. Okay, stage 2, stage 3. Under the stage 3, you will find this hip. Okay, see here, pressure ulcer of hip. Now the first code is pressure ulcer of unspecified hip. Then look for this triangle shape symbol, red color. First one is for unspecified hip. Second one is for pressure ulcer of right hip. Our hip is right, correct? Right hip. We need to search for right hip stage 3. So right hip stage 3. Pressure ulcer of right hip stage 3, L89.213. You see, correct? So this is how you have to search for ICDs. I hope it is interesting. You enjoy finding out this medical codes. How to find out the medical code is most enjoying part to find out this course. Are you enjoying? Okay, so now we'll see one more example, as you can see in actually report. Okay, in the report, I'm sorry, you can find indication. Okay, I'm sorry for disturbance. So in report, there is an indication. Indication states about patient's problem. Okay, what illness, what symptoms patient facing. Okay, so here a 40-year-old male with rectal pain, rectal bleeding, and some left-sided lower abdominal pain. This is the indication of this patient. Okay, or reason why this patient came into the hospital. Okay, I have highlighted these terms, the main terms which are diagnosis, procedure, again what is the impression, what are the main terms we have to find the code for. That those I have highlighted. And like the same manner, you have to also highlight the terms if you are going for any medical coding certification exam. Okay, so that you can easily find out your code. You no need to read your report again and again. Okay, so here on our patient, doctor perform procedure which is known as colonoscopy. Then next, so we have to code or search code for procedure colonoscopy. Okay, that is clear. Then the description of the procedure, where they describe everything, what kind of instrument they use, and what are the findings they find out while the procedure, everything. Then post-op diagnosis or impression. These are the confirmed diagnosis. These are the result of that procedure, outcome you can say. That is confirmed diagnosis, which is given by the physician, also known as impression. So it states first diagnosis is moderate size internal hemorrhoids, and second is mild diverticulosis. So this is the reason behind this patient's rectal pain, rectal bleeding, and abdominal pain. Okay, see here patient having left-sided lower abdominal pain. Again, if any cases, if you have to assign this code, okay, to left-sided lower abdominal pain, you have to go by pain, then you have to search for abdomen, then under the abdomen you have to search for left sided, or sorry, left lower sided. Okay, so you can assign proper specific code. Now we'll see what are the codes. So CPT code for this colonoscopy is 45378. Okay, that you will find on in the CPT book itself, or if you are in the medical coding field, if you when you start your medical coding job, the either client or your company will provide you the software to find CPT codes. Okay, now we'll find out ICD-10 codes, internal hemorrhoid. Okay, we'll just find out code for internal hemorrhoids. We have to go by the term hemorrhoid. Sorry. Okay, here is the term hemorrhoid. Here also we have internal. We have to find for internal. Okay, so this is our code. Is it correct? Let us check. K64.8. Is it correct? What is the description? We'll again have to check. See here. So many synonyms are there. Bleeding internal hemorrhoid, bleeding internal hemorrhoids. Whether it will be one or two, you have to assign the same code. Okay, so we can assign this code for these many terms. Okay, now we'll go for another one. Next one is diverticulosis of large intestine with bleeding, because patient also having bleeding, right? We have to go by diverticulosis now. Again, index, then find D, then type it here, diverticulosis. See here, diverticulitis is also there, diverticulum is also there, diverticulosis is also there. Diverticulosis, diverticulum, diverticular all comes under same category, but diverticulitis is different condition. So be careful while choosing your code. Okay, again here diverticulitis with bleeding. Okay, diverticulitis of large intestine without perforation or abscess with bleeding, K57.31. Is it correct or not? We'll check. Yes, it is correct, K57.31. Okay, so this is how you have to find out different kinds of ICDs. Okay, CPT, how to find out CPT code, that I can't show you right now, but I just show you how to find out ICD codes. Okay, and I hope you enjoy finding this ICD codes, and also I hope you now have at least basic idea about medical coding, what kinds of code we are using in medical coding, and what are the different structure, their maintenance committees of those codes. Okay, and at least you have now a few knowledge about how to find out different ICDs. Okay, we'll discuss it more in detail in our further session, each and every topic. Don't worry about it. Okay, so lastly, thank you for your attention. Welcome to Great Online Training. It's a day 3, Human Anatomy and Physiology. myself Nikita. I am CPC certified medical coding trainer in Great Online Training. As you can see my screen, today we're going to discuss about human anatomy and physiology. You might have thinking that we already know human anatomy and physiology. Why it is necessary to again study the human anatomy and physiology, right? You might have thinking, but as a medical coder, you must have knowledge of anatomy because anatomy knowledge is very crucial part in medical coding. And as we are a human being, we have tendency to forget some things, right? In daily routine also we forget some things, where I keep that particular object or someone's name also we going to forget if we uh, not using that the same item or same name in daily manner, right? Likewise, uh, it is possibilities are there that you might have forget some terms or some body parts or working of some body part, right? That's why it is need to study human anatomy again. Okay, just a minute. Now we'll see what are the different topics we're going to cover in this class. So today we'll see first introduction. What are the importance of human anatomy in related to medical coding? Okay. Then we'll go by different body systems like circulatory system, then respiratory system, then digestive system, nervous system, endocrine system. We'll also see reproductive system, integumentary system, musculoskeletal system. Then we'll also see universal terms to describe the body parts placements. Okay. Then body cavities. Then we'll see quadrants and regions of the abdomen. Okay. And lastly, question and answer. Okay. So let's start with the introduction to the human anatomy. Okay. Why human anatomy is, or why to study human anatomy to be in this field, in US healthcare field, and work as a, if you work as a, if you want to work as a medical coder, why human anatomy knowledge is mandatory. Okay, because uh, medical coders knowledge for medical coders knowledge of anatomy is crucial in assigning codes for procedures and diagnosis, right? Medical coders must understand body structure and organs to assign codes accurately. You can assign codes accurately only when you have correct knowledge of human anatomy, right? So knowing basic human anatomy is a fundamental part of being a successful medical coder. Knowledge of basic medical terminology and human anatomy helps you assign a more accurate diagnosis and procedure codes, because procedure codes are more specific to certain parts of the body in many cases. Okay, so if you have proper human anatomy knowledge, if you know which organ found in or which bone or which muscle found in which part of body, okay, or organ, then you can assign or I can say you can search the medical code very accurately and quickly. Okay. Again, medical coders need to know the names of body parts, organ, and system to assign the correct code. For example, uh, a medical coder must know difference between various bones in the body to assign the fracture code. Okay, if you know about each and every bones in your body, which bone located in which area, then and then only you can assign correct fracture code easily, very easily and fast, because as a medical coder you have your quality should be at least 95%. Okay, and your productivity is at least 100% or above than that. Okay, so to be a productive, you must possess good human anatomy knowledge to find your medical course quickly, okay, and accurately also. Again, the medical coder must also understand relationship between organs and system to assign course accurately. For example, understanding the relationship between heart and lung is crucial in assigning course for heart and lung conditions, because uh, most of the codes are correlated with each other, or you can see combination codes are present in most of the ICD or disease codes. Okay, like diabetes is related with CKD, chronic kidney disease, or hypertension and diabetes is related with each other. So you can find combination code. So if you have proper knowledge of anatomy, diseases, then and then only you can assign proper code easily and quickly, right? Because medical coding, most of the people says that medical coding is like a different language. I also agree with it. Medical coding is like a different language, because we know what doctor know, right? And that too without going into medical school. Medical coder know what doctor is saying. We have to read, as a medical coder, we have to read and understand the health report of the patient. If we don't understand any part of the report, that or some part of the report or any term mentioned in the report, then it is potential that we choose wrong medical code. So that's why understanding your body, your anatomy, your physiology, different body systems, different medical terminologies is important. It will all goes together. These all understanding, this all is key for being successful medical coder. Okay, you can't neglect anatomy, terminology, and directly start studying medical coding, because if you didn't study anatomy, how will you going to understand coding, right? So the anatomy of the human body is made up of a number of different body systems that work together to perform more complex bodily functions, and you need knowledge of all of those. Okay, so now we'll start with circulatory system. Okay, here circulatory system is means our heart is the main part or main organ of circulatory system. Okay, our heart is situated in the middle of chest cavity, which is also known as mediastinum. Okay, and it is enclosed in pericardium. You must you may I suggest you to note down these things, because if you are going for medical coding interview or even for medical coding certification test exams, okay, there you will expect this kind of questions, these simple questions, straight having straightforward answer, but you must have knowledge about it, so that you these medical coding exams are open book exams. You will find everything in your book, medical coding book. You will find everything about diseases in ICD book, plus you will find codes also, obviously. But then too, if you already know about diseases and all this human anatomy, you will not going to it will not going to waste your time in searching that term into the book, right? Because ultimately you have to cover your paper, complete your paper within a time. Okay, so please note down the points which I am going to tell you. This is important, that is important. Okay, because I have gone through many interviews, because I think that even though you didn't need any job, even though if you don't want to change your job, okay, then also you have to go through interviews. If you get chance to get interviewed by anyone, go through it, so that it will build your confidence, right? You will get to understand how much knowledge you have, what are the new things you need to learn, okay, and how interviewer going to ask you questions, okay. And this circulatory system is more important. Working of the heart is very important, because uh, i have I remember that when I gone for went for my interview at the first time at my first job, when I'm fresher in this field, I don't know anything about medical coding, and I go for interview. At that time, that interviewer asked me, tell me the function of circulatory system, okay. And even after a few years of medical coding experience, the another interviewer also asked me to explain any one system, any one body system. So again, I tell them about circulatory system only, because circulatory system is easiest system to explain. That's my opinion. So be ready for this. Okay. So about circulatory system, there are two parts of this system. The cardiovascular system, it is composed of heart, blood vessels, and blood. Whereas second system is the lymphatic system. It is made up of lymph node, lymphatic vessels. Lymphatic vessels are those vessels which carry lymph fluid. Then the thymus and the spleen, and as well as other parts. Thymus is the gland located in the chest that helps produce T cells, which are a type of WBCs, okay, white blood cells. Now we'll see functions of circulatory system. Circulatory system provides a means of transportation of nutrients, water, oxygen, hormones, and body salts. Body salts to the cell. This everything means nutrient, water, oxygen, hormones, and body salts to the body cells, and take away waste from the body cells. Okay. It also serves as protective role by dispatching specialized defensive cells through the lymphatic system. Okay. Now the main part, which is very important. Please make a note of it. Working of heart. Okay. Where is the heart situated? Heart situated in mediastinum cavity. Okay. And enclosed in pericardium. Okay. So our heart is consisting or divided into four chambers. Upper chambers are called atrium. So we have right atrium and left atrium. And lower chambers are called ventricles. So we have right ventricle and left ventricle. Again, these chambers are separated. This right atrium and right ventricles are separated by, what is this wall? This is called tricuspid wall. Okay, this is tricuspid wall, whereas left side of the heart means left atrium and left ventricles. These are separated by bicuspid wall, or it also known as mitral wall. Please make a note of it. Mitral wall is also known as bicuspid wall. Okay, not the tricuspid wall. Okay, mitral wall means bicuspid wall. So, superior vena cava collects deoxygenated blood from upper part of the body, whereas inferior vena cava collect deoxygenated blood from lower part of the body. Okay, then from left atrium it goes into the right ventricle via tricuspid valve. Okay, and then the right ventricle pumps that deoxygenated blood collected from all over the body to the lungs via pulmonary artery. Pulmonary artery is the only one artery in our body which carries deoxygenated blood. Please make note, pulmonary artery is the only one artery which carry deoxygenated blood. Other arteries carry oxygenated blood. Okay, this is an exception. Then that blood goes into the lung, and where uh, oxygenated blood from lungs via pulmonary veins, the oxygenated blood come back into the left atrium. Okay, and again here pulmonary veins which carry oxygenated blood. This is also one exception of vein. Pulmonary vein is the only one vein which carry oxygenated blood. Other veins carry deoxygenated blood. Please make note. Okay, so pulmonary vein gives oxygenated blood to left atrium. Then via bicuspid or mitral wall, it goes into the left ventricle, and where left ventricle pump this oxygenated blood for all pump the blood, oxygenated blood to all over the body via aorta. Okay, this aorta. Aorta is the largest artery in our body. This is important point. Aorta is the largest artery in our body, which carry oxygenated blood from heart to all over the body. Okay, so this is the function of our heart. There are two types of circulation. Okay, pulmonary circulation and systemic circulation. Pulmonary, as name suggests, pulmonary means related to lungs. Okay, so pulmonary circulation begins with the right side of the heart sending blood to the lungs to absorb oxygen and to release carbon dioxide. Okay, CO2. Then the systemic circulation means the systemic circulation carries blood from the heart to the cells of the body, where nutrients and waste exchange takes place. Okay, this is clear. Please make sure that you will going to learn more about this circulatory system and the working and how circulation happens in, or how circulation takes place in heart before you going for any medical coding interview. Okay, now we'll move toward our next system, which is respiratory system. So respiratory system's main organ is obviously lungs. Okay, lungs have two lobes, right lobe and left lobe. Right side, on the right side, lung have three lobes. Okay, right superior lobe, right middle lobe, and right inferior lobe. Whereas left side have only two lobes, left superior lobe and left inferior lobe. Okay, then the larynx, then trachea. Trachea is also known as windpipe because it carries wind. We have breathe in and breathe out. Okay, then the diaphragm present between lungs and abdomen. Okay, then these branches are called as bronchi. Okay, so main function of respiratory system. The respiratory system provides oxygen to all cells of the body by performing gas exchange between air and blood gases. Correct? It is made up of nose, trachea, lungs, and bronchi. Bronchi is the main passage of trachea that leads to the lungs, okay, as well as other parts. So now we'll see different functions of respiratory system. As besides helping you in inhale or breathe in and exhale, or you can say breathe out, respiratory system has many other functions also, like it allows you to talk and to smell. It warms air to match your body temperature and moisturizes it to the humidity level your body needs. Also, it delivers oxygen to the cells in your body. It removes waste gases, including carbon dioxide, from the body when you exhale, and also protect your airways from harmful substances and irritants. Right? Now we'll see working of respiratory system. So here you can see the bronchioles are ended up with this sac-like structure which is known as alveolar sac. So when we breathe in, the air goes into the alveolar sac, right? Every few seconds, with each inhalation, air fills in alveoli. It is structural and functional unit of the respiratory system. What is that? Alveoli. Make a note. Okay. Alveoli is structural and functional unit of the respiratory system. In the process called diffusion, oxygen moves from alveoli to the blood through the alveolar wall via small capillaries. Okay. The oxygen is in the air which filled in alveolar sac, right? So via alveolar wall, it goes into the bloodstream. Okay, you can see here in this diagram, oxygen is going into the blood, while carbon dioxide is exchanged, going again into the carbon dioxide going in and oxygen going out from the alveoli. Okay, and this process is called diffusion. So what is diffusion? Oxygen moves from alveoli to the blood through alveolar wall. It's called diffusion. Okay, this oxygen rich blood then flows back to the heart, which pumps it through the arteries to oxygen hungry tissues throughout the body. The carbon dioxide made by the cells as they do their work moves out of the cell into the plasma of the blood, and the blood rich in carbon dioxide then returns back to the heart via the veins. Okay, and from the heart the blood is pumped to the lungs, where carbon dioxide passes into the alveoli to be exhaled. This is clear. So this is about the functioning of function and working of respiratory system and different parts. Okay, now we'll move ahead towards our third body system, which is nothing but digestive system. Digestive system, there are different parts or organs involved in digestive system, like our mouth, liver, stomach, pancreas, gallbladder, duodenum, jejunum. These are the parts of small intestine. Large intestine is there. Again, anal canal is there. Rectum, appendix, everything comes under digestive system. The digestive system converts food into nutrients that the body can use. Right? This is the main function of digestive system. To convert food into nutrients that body can use. The GI tract consists of oral cavity, pharynx, esophagus, stomach, small intestine, large intestine, and anal canal. Mostly these are hollow organs because these carry food. Okay. So the GI tract consists oral cavity, pharynx. This is also one question you may expect. GI tract consists oral cavity, pharynx, esophagus, stomach, small intestine, large intestine, and anal canal. Whereas the accessory organs include the teeth, tongue, glandular organs such as salivary glands, liver, gallbladder, and pancreas. Okay, because they assist in digestion. They secrete some hormones, they secrete some enzymes and help in digestion. Okay, now we'll see how digestive system works. Working of different part of the or organ of the digestive system. First come is mouth. Okay, mouth breaks up the food particles and also assist in producing spoken languages. Okay, then the salivary gland secretes saliva, which moistens and lubricates food, which also consists amylase enzyme, which digests polysaccharides. Okay, then comes pharynx. Okay, here this is the pharynx. Pharynx help in swallowing. Then comes in esophagus, who helps in transport of food. Then the stomach. Then food goes into the stomach, whose job is to store and churn food, which also consists pepsin enzyme, which digest protein. Then HCl activates enzymes. Then breaks up the food, kills germs, and it also has mucus which protects stomach wall, limited absorption. Okay, then we have liver here. Liver breakdowns and build up many biological molecules. Okay, and stores vitamins and iron. Liver also destroys old blood cells and poisons. Okay, and make bile to aid in digestion. Next one is, this is green organ, is gallbladder. Gallbladder helps in stores and concentrates bile. Okay, then comes in is pancreas. Okay, pancreas secretes hormones which regulates blood glucose level. Okay, bicarbonates neutralizes stomach acid. Trypsin and chymotrypsin digest proteins. Amylase digest polysaccharides, and lipase digest lipid. Lipase digest lipids. Okay. Then comes small intestine. Here, the pink one. Okay. Small intestine completes the digestion process. Okay. The mucus in the small intestine protects gut wall. In small intestine, absorption of nutrients and water is also get absorbed in small intestine. Then peptidase digest protein. Then sucrase digests sugars. Amylase digests polysaccharides. Okay. Then food goes into the large intestine. Okay. Yeah. Then large intestine reabsorbs some remaining water, okay, and ions, and also forms and stores feces. Then rectum stores and expels feces, okay, and the anus is the opening for elimination of feces. Okay, so that's all about digestive system. This is clear. Okay, so we'll move forward. on our next system, which is nervous system. Okay, the brain, cervical nerves, thoracic nerves, all the nerves in our body. Just a minute. Sorry. The nervous system consists brain, cervical nerves, thoracic nerves, lumbar nerves, sacral nerves, sciatic nerves, peripheral leg nerves. All the nerves present in our body make nervous system. Okay. So the nervous system is a complex network of nerves and nerve cells. Nerve cells are also known as neurons that carry signals or messages to and from the brain and spinal cord to different part of the body. Okay, the job is to carry the signals or messages from brain and spinal cord to the different parts of the body. Correct? It is made up of central nervous system and peripheral nervous system. The central nervous system, also known as CNS, central nervous system, CNS, is made up of brain and spinal cord. Okay, the brain controls most of the body functions, including awareness, movements, sensation, thoughts, speech, and memory. Okay, so this is about central nervous system. Whereas the second nervous system is peripheral nervous system, also known as PNS. Peripheral nervous system, PNS, is the part of the nervous system outside of the central nervous system. Okay, it is made up of nerves and ganglia that send signal to and receive signal from the central nervous system. The nerves present outside of the central nervous system or comes under peripheral nervous system, whose job is to send the signals to and receive signals from the central nervous system. This is clear? Okay, now we'll see what are the functions of nervous systems. Okay, so the central nervous system, CNS, consists of brain and spinal cord. Okay, brain and spinal cord makes central nervous system, which is responsible for sensory activities, storing memories and emotions. Right, then comes peripheral nervous system. Okay, PNS, which consists cranial and spinal nerves. Okay, which brings messages to and from the central nervous system to the rest of the body. Then the peripheral nervous system again divided into two parts: somatic nervous system and autonomic nervous system. Okay, somatic nervous system is responsible for voluntary movements, voluntary muscle movements, whereas autonomic nervous system is responsible for involuntary actions such as heartbeat, pupil dilation, etc. Involuntary and voluntary, what is difference between involuntary and voluntary? So voluntary actions are those actions which are under, you can control under conscious mind. Okay, when you are conscious you can control those actions. Okay, but involuntary actions are those actions that are not under conscious controls. All right, so next, this autonomic nervous system again divided into sympathetic nervous system and parasympathetic nervous system. Okay, sympathetic nervous systems responsible for fight or fight response, whereas parasympathetic nervous system responsible for rest and relax actions like digestion and other things. Okay, this is clear. Now next system is endocrine system. Endocrine system is made up of hormone secreting organs. Okay, those are like hypothalamus, pituitary gland, parathyroid gland, thyroid gland, thymus, adrenal gland, pancreas, If you are male, you have testes. If you are female, you have ovaries. So these all are hormone secreting glands, okay, and parts of endocrine system. Okay, the hormones created and released by the glands in your body's endocrine system, who control nearly all the processes in your body. These chemicals help coordinate your body's function, from metabolism to growth and development, emotion, mood, sexual functions, and even sleep. Right? If you have hormonal balance, you are not able to sleep. You can see most of the old peoples have complaints that they are not able to sleep, right? Because they have hormonal balance. Okay, so balance in hormones is very important in our body. Many glands make the endocrine system, like the hypothalamus, pituitary gland, and pineal glands are present in here in brain. Hypothalamus, pituitary gland, and pineal gland are present in brain. Okay, then parathyroid gland present in your neck neck region. Okay, then thymus is between your lungs here. Okay, then the adrenal glands are present on the top of your kidneys here, the yellow one. These are called adrenal glands. Okay, then the pancreas is behind your stomach. It's present behind your stomach. And if you are a woman, you have ovaries, and if you are male, you have testes. Those are present in pelvic region, right? So these are different organs of endocrine system. Now we'll see their functions. Okay, gland and their functions. The adrenal gland, these are attached to kidney surface on the top of the kidneys. Okay, their position is on the top of the kidney. Keep it in mind that adrenal glands are present on the top of the kidney. You may have question on this also. Their hormones control growth, sugar metabolism, kidney function, and stress. Okay, then hypothalamus. Hypothalamus found at the base of the brain, the main controlling gland. It is called as main controlling gland. Okay, hypothalamus controls all the other glands. Its hormones, the hormones secreted by hypothalamus control most of the body functions and all other glands. Okay, then pituitary gland found at the base of the brain. Okay, and hormones, secrete hormones that controls growth, reproduction, lactation, and stress. Then we have ovaries to produce female hormones, estrogen and progesterone. Then we have testes, which are help to produce male hormones, testosterone. Then thyroid gland, which control metabolism and growth. Then parathyroid gland, which are located near thyroid gland in the neck, which control calcium and phosphorus deposition. Okay, then we have pancreas. The pancreas located in a fold of a duodenum behind the stomach, which produces insulin to control sugar metabolism. Okay, if you have any problem with pancreas, you may have sugar, means this is related to sugar metabolism. Okay, or related to insulin. Then we have placenta also. Placenta also secretes some hormones. After birth, membrane that covers the fetus is called placenta, which maintains pregnancy and produce female hormones. Okay, so these are different glands and their function. There are all many other glands also present. So please make sure you're going to study all the glands and their function before going for medical coding interview or going for any medical coding related exam. Okay. Now, next one is the reproductive system. The we have two types of reproductive system. If you are a female, you have vagina, uterus, fallopian tubes, ovaries, cervix, like this. But if you are a male, you have penis, testes, vas deferens, seminal vesicle, like that. Okay, or prostate gland. The reproductive system enables the production of offspring. Okay, this is the main function of reproductive system that enables production of offspring. The male reproductive system is made up of testes, scrotum, penis, vas deferens, which is known as the passageway for sperms, and prostate gland. Then the female reproductive system is made up of the ovaries, fallopian tube, uterus, and vagina. The mammary glands are considered accessory organs. Okay. Now we'll see what are the functions of different reproductive systems. Female reproductive system perform the following functions, like they produce eggs necessary for reproduction called ova. Ovum is the singular for one egg and ova is for many eggs. Okay, or oocytes. Okay, female reproductive system incubate and nourish a fertilized egg until it is fully developed. They also produce female sex hormones that maintain the reproductive cycle. Okay. Now we'll see functions of male reproductive system. Male reproductive system produces and maintain and transports sperms. Sperm is the male reproductive cell and protective fluid also, which is known as semen. Then it is also responsible for discharges sperm within the female reproductive tract during intercourse, and also produces and secretes male hormones responsible for maintaining male reproductive systems like testosterone. Okay. Then the next system is integumentary system. Integumentary system means it is made up of skin. Okay. The skin is the largest organ of the body. Please make a note of it. Skin is the largest organ of the body. Okay. The integumentary system includes epidermis, dermis, hypodermis. Hypodermis is also known as subcutaneous tissue, and other associated glands, hair, and nails. Here you can see in this diagram, it is made up of, our skin is made up of epidermis. This is the outermost layer of the skin, which is protective in nature. If anything happen with our skin, first it has to deal with epidermis. Okay. Then we have dermis below this epidermis. Okay, which consists lots of glands. You can see hair follicle is also grown from dermis only. Sweat glands. Okay, blood vessels, sebaceous glands. Okay, all the glands are present in dermis. Okay, which is middle layer of the skin. Then we have hypodermis, which is also known as subcutaneous tissue. It is the innermost layer of the skin, which connects skin to the other body organs or muscles. Okay. So now we'll see functions of integumentary system. So its main function is protection. The skin and hair provides a barrier against harmful substances, UV light or UV radiation from the sun. Okay, and from the temperature extremes. Okay. Then second function is sensation. The skin contains nerve endings that detect touch, pressure, pain, heat, and cold. Okay. Then temperature regulation. The skin can sweat and widen blood vessels to regulate body temperature. Then next one is excretion. The skin eliminates some waste through sweat, right? Then vitamin D production. Skin helps in vitamin D production also. When skin exposed to UV light from the the skin produces vitamin D, which is important for bone health. Okay, if you have any bone related disease, means if you have some pain in joint or in any bone area, doctor may suggest you to check your calcium level, and with calcium level they also suggest you to do vitamin D deficiency test, because vitamin D is very important in absorption of calcium. If you though Even though your body have enough calcium, even though you are taking enough calcium in your body, if you have vitamin D deficiency, there is no use of that calcium, because vitamin D is very important to absorb that calcium. Okay, now we'll move towards our next system, that is the musculoskeletal system. Obviously, as name suggests, musculoskeletal system. So it is made up of skeletal system and muscular system. Okay, so skeletal system main function is to protect the body and body organs, right? To protect body organs and give body its shape and form. It is the main function of skeletal system. It is made up of bones, joints, ligaments, tendons, and cartilage. Ligaments are the fibers that connects bone to another bone. Okay, ligaments are the fibers that connect bone to another bone. Bone to bone connected with ligaments. Whereas tendons are the fibers that connect muscles to bones. Okay, muscle to bones are connected with tendons. Please make a note. You may get confused between these two. Okay, because what happened during interview, even though if you know each and everything at the time of interview, you will not going to recollect it. It happens many times, right? So please make a note of each and every point which are important, so that you can go through it while you are interview, okay, and not get confused. Then there are total 270 bones are present when we born, or you can say 270 bones are present in newborn. Okay, but in adults only 206 bones are present. Why is it so? Can anyone tell me? Anyone? Where are the other bone gone then? All right. Those bones, many bones get fused while we grow. Okay. So in adults, we have only 206 bones. But when we born, we have 270 bones. Okay. Please make note. Newborn baby have 270 bones, while adults have 206 bones. Okay. Then we have, this is about skeletal system. Then the next system is muscular system, which enables the body to move. Okay, it is made up of muscles, tendons, ligaments, and cartilage. Okay, tendons are connection between muscles and bones. Okay, whereas ligaments are connection between bones to bones. Okay, Now see what are the different types of muscles and joints present in bodies, our human body. Okay, so we have three types of muscles: cardiac muscle, skeletal muscle, and smooth muscles. Okay, these are divided on the basis of their structure. Okay, so the skeletal muscles are voluntary in function. These are mostly present in our limbs and all over the body. Okay, but voluntary means they contract and relax under conscious control. As I said earlier, voluntary means they contract and relax under conscious control. Okay, you can control them, their movement. The skeletal muscles are voluntary in function, but cardiac muscle and smooth muscles, these are not under conscious control. So these are called as involuntary muscles. What are those? Cardiac and smooth muscle. Okay. So this is, we have these three types of muscles. Now we'll see what are the different types of joints we have in our body. First one is fixed joints. Okay. Fixed joints do not allow any movement. The joints between the bones of our skull are example of fixed joints. Fixed joints are fixed. They are not allow any movement. Okay. The bones present in skull are called, joints present in skull are called fixed joints. Okay. Sorry. Next one are slightly movable joints, which allows very little movement. Okay, very little movement, like joints present in between our vertebra. Okay. Then we have freely movable joints, which can move quite freely and allow a variety of movements. Examples include bone joint, knee joint, foot joint, ankle joint, and our shoulder joint. Okay, these are examples of freely movable joint. So we have three types of joints: fixed joints, which are not allowed any movement; slightly movable joint, which allows little movement; and freely movable joints, which can move quite freely. Okay, and allow variety of movements. So this is all about different types of body systems. Okay, I know this is not enough knowledge regarding medical coding. You need more knowledge, more and more knowledge about human anatomy. But it is not possible for anyone to cover uh, that entire chapter in few sessions, right? Obviously, because you you have took too many years to learn human anatomy, right? So again, go back and check your 11 12 books for human anatomy and go through it. Okay, make each and note of important notes. Okay, so that is about different body system. Now we'll move ahead towards universal terms to describe the body part placements. Okay. So these are different body planes, which is sagittal plane, coronal plane, transverse plane. Okay, what are those planes are going to discuss. Planes of the body are anatomical concepts often used by health professionals to describe how your body moves during exercise or other activities. Okay, it is depend on your body movement. There are three types of plane of body. First one is coronal or frontal plane. Then second one is sagittal or longitudinal plane. Here, sagittal plane, this one. Okay. The coronal plane is here, and the transverse plane is here. Okay, transverse plane is also known as axial plane. Coronal plane separates front and anterior back of the body. Front means anterior and back means posterior. Okay, so here the coronal plane, which separates our body into front and back. Okay, means anterior and posterior. Whereas sagittal means this one, which separates the left and right side of the body. Okay, then third one is transverse plane, which is also known as axial plane, which separates upper and lower halls of the body. Upper means superior, while lower is inferior. Okay, so first plane is coronal plane. It is often referred as frontal plane. Okay, often referred as frontal plane. Please make a note. Coronal plane is also referred as frontal plane. Okay, as it divides the body into front means anterior and back means posterior section. Okay, posterior and anterior sections. Okay, the movements that occur in the coronal plane are lateral or side to side movements. Okay, this includes abduction. Abduction means moving your limbs laterally away from the middle line of the body. Okay, moving your limbs laterally away from the middle line of your body. If you raise your hands in sleeping line, like, okay, that is called abduction. For example, lifting your legs to the side or lifting your hands to the side. And then second is adduction. Adduction means moving your limbs medially towards the midline of the body. For example, lowering your arms down to the side of your body. Okay, if you if you lift your hands to the side, it is called abduction. Whereas if you lowering your arms down, it is called adduction. Please don't get confused between these terms. Okay. Next plane is sagittal plane, which divide our body left and right. Okay. Sagittal plane also known as longitudinal plane. Okay, which divides body into left and right walls. Okay, or you can say left and right side. Movements that occur in the sagittal plane or longitudinal plane are involve forward and backward movements. Okay, our day-to-day activities usually occur in this plane since we usually move by swinging or our arms and legs in front of us. Right? So sagittal plane divides us in left and right side. Then third is transverse plane. It is also known as axial plane. Okay. Axial plane divides body into upper means superior and lower means inferior walls. Okay. Superior and inferior walls. Then the movements that occur in this plane involve rotation or horizontal movements. Okay. So this is all about the different planes of the body. Now now these are the few terms which you have to keep it in mind. Okay, it is very easy to understand because I kept it in differentiate manner. Okay, I have differentiated them so that it will easy to digest. Anterior means situated before or at the front of, whereas posterior means situated after or at the back of. Medial means pertaining to middle or near to the middle of the body, whereas lateral means far from center of the body, part away from middle. Okay, then superficial means on the surface, not too deep. Okay, on the surface means superficial, deep means away from the surface or further into the body. Superior, cranial, or cephalic means above, over, top of. Okay, whereas inferior means caudal, podalic, or towards the feet. Proximal means towards the beginning, the nearer of two items. Distal means more distant, far from the origin. Inversion means to turn inward, to turn upside down, to reverse in position or order. And eversion means to turn outward. Okay. Ipsilateral means on the same side, and contralateral means on the other side. Ipsi means same, contra means different or other. Okay. Supine means with back or dorsal side downwards. Okay. Prone means lying face downward. Means if you sleep on your stomach, laying your face down, it is called prone position. Whereas if you sleep on your back, okay, then that position is called supine. It is most important question. Huh? This question I got in during my CPC exam also, and one of my interviewer also asked me this question when I am fresher also, and when I give an interview as a experience also. So this is important, very much important. Supine means when you sleep on your back, whereas prone means when you sleep on your stomach or laying face downwards. Then dorsal means relating to back or posterior, whereas ventral means relating to front or anterior. These are a few terms related to medical coding which you need to know. Now we'll see different body cavities. Okay. Our body is made up of different cavities. Okay. Different body cavities. So dorsal body cavity consists cranial cavity here and ventral cavity, made up of these two are comes under dorsal body cavity, whereas we also have thoracic cavity, abdominal cavity, pelvic cavity. Okay, the human body is divided into number of body cavities, which are fluid filled spaces in the body that hold and protects internal organ. Okay, these are fluid filled spaces in the body that hold and protects internal organs. The two largest human body cavities are ventral cavity and dorsal cavity. Dorsal cavity and these three cavities are comes under ventral cavities. Okay, these two body cavities are subdivided into smaller body cavities, like dorsal body cavity divided into cranial cavity and ventral cavity, whereas ventral cavity is divided into thoracic cavity, abdominal cavity, and pelvic cavity. Okay, first one is ventral cavity. It is at the anterior or front of the trunk. Okay, the organs contained within this body cavity include lungs, heart, stomach, intestines, and reproductive organs. Okay, and it is subdivided into thoracic, abdomen, or you can and pelvic, or you can say abdominopelvic cavities. The next one is dorsal cavity. It is at the posterior or back of the body, including both the head and the back of the trunk, means spinal cavity. Okay, the dorsal cavity is subdivided into cranial and spinal cavity. Okay, so these are few again these are the organs included in each cavity. Cranial cavity consists brain and pituitary gland, whereas ventral cavity consists spinal cord. Thoracic cavity consists lungs, thymus, then heart, which is situated in mediastinal cavity. Then abdominal cavity, which consists stomach, liver, pancreas, gallbladder, spleen, large and small intestine. Okay, and lastly pelvic cavity, which consists urinary system and reproductive system. Clear? This is clear about body cavities. I hope you are understanding this.
Yes, ma'am.
Okay. Now we'll see different quadrants of the abdomen. Okay. So as you know, this is our abdomen. It consists liver, gallbladder, large intestine, small intestine, stomach, pancreas, rectum, anal canal, everything. Okay. But to make it easier, our medical system divided it this our abdomen in four quadrants. Okay, like right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant into four quadrant. Quadrant wise, if you see, our abdomen is divided into four quadrant: right upper, right lower, left upper, and left lower quadrant. And you have to keep it in mind that what are the organs comes under which quadrants. Okay, because if you remember yesterday we in our previous session we have one report, right? In that report, that patient has some specific pain, I think left lower quadrant pain, right? And we have specific code for that pain. Okay, so you have to be able to connect the connection between that pain and related disease. Okay, that's why you need to understand what are the different organs present in which quadrant. Okay, so right upper quadrant consists most of the part of the liver. Gallbladder comes under right upper quadrant only. Then duodenum means some part of small intestine. Okay, then duodenal junction, then ascending colon means some part of you can say large intestine. Okay, then most of the part of stomach, pancreas, left colic flexure, then transverse colon, jejunum. This comes under left upper quadrant. Okay, whereas left lower quadrant consists descending colon, sigmoid colon, rectum, anal canal. And right lower quadrant consists appendix. Appendix is main part because most of the people have problems related to appendix. So if you have right lower quadrant pain, then it is possibilities are there that you may have something related with appendix or cecum or ileum. Okay, and again few part of rectum and anal canal. This is clear. Now we'll see regions of the abdomen. If you divide your abdomen into regions, we have 9 different regions. First one is this is here, right hypochondriac region. Then this side left hypochondriac region. Okay, then in the middle, upper middle, we have epigastric region. I'm sorry. Then we have in the middle right lumbar region. Then exactly in the middle umbilical region. Then in the middle left side we have left lumbar region. Then in the lower side we have right iliac region. Then hypogastric region, then left iliac region. Okay, and these are the different organs come under these regions. Right hypochondriac consists liver, gallbladder, right kidney, and small intestine. Epigastric region consists stomach, liver, pancreas, duodenum, spleen, adrenal gland. Left hypochondriac region consists spleen, colon, left kidney, pancreas. Okay. Then left lumbar region consists gallbladder, liver, and right colon. Whereas umbilical region consists umbilical or navel region, then parts of some small intestine, duodenum. Okay. Then left lumbar region consists descending colon and left kidney. Then seventh is right iliac region, which consists appendix or cecum, appendix and cecum. Sorry. Then we have hypogastric region, which consists urinary bladder, sigmoid colon, female reproductive organs or male reproductive organs. Okay. Then we have left iliac region, which consists descending colon and sigmoid colons. Okay. So if you divide your abdomen as in different region, we get 9 regions. And if you divide your abdomen in quadrants, we have 4 quadrants. Okay. Please make note of it. It is also very important. So that's all about human anatomy. Now we'll move towards our question part. Okay. I expect answer from you. So unmute your mic and give me answer, please. It is okay if you give wrong answer. Don't worry about it. Ready? Hello? Hello? Yes. So the first question is, how many bones does an adult human skeleton have? Who is going to answer? Your options are 205, 207, 209 or 206. Which is correct one?
206, ma'am.
Yes, correct. Okay. Then so the correct answer is option D, 206. Okay. Please make note of it. This is very important question. And in newborn we have two. How many? Anyone? Adult have 206 bones, whereas newborn have
270, ma'am.
very good 270 bones. So the next question is second question. Which of the following structures keep blood flowing unidirectionally in humans? The options are bronchiole, neurons, septum, or valves. Who is going to answer? Yes?
Valves, ma'am.
What?
Option D.
Yes, you are right. Correct. Option D is valves. Just a minute. I'm sorry. So, valves are the structure which keeps blood flowing unidirectionally in humans. Okay. Next question is, which of the following type of cartilage? I'm sorry. Which of the following type of cartilage is present at the joint of long bones in humans? Fibrous, hyaline, elastic, or calcified? We're going to answer. It's okay if you give wrong answer.
Ma'am, option B.
Hyaline, right? So hyaline is correct answer. Hyaline cartilage is present at the joints of long bones in humans. Okay, so the next question is, which of the following hormones help in secretion of HCl from stomach? Gastrin, secretin, pepsin, or renin?
Gastrin, ma'am.
Very good. So the option is A, gastrin. Gastrin hormones helps in secretion of HCl from stomach. And the last question is, which of the following is in innermost layer of the human eye? Retina, choroid, sclera, or cornea?
Ma'am, option D. Cornea.
Mm-hmm. No? Anyone?
Retina, ma'am.
What? Come again?
Option A. Retina, ma'am.
Yes, correct. So, retina is the innermost layer of human eye. That is correct. Very, very good, girls. Very nice. So, this is the end of this session. These are the answers. Okay. So, again, thank you for your attention and thank you for attending this session and making this session very interactive and giving answer to my questions. Okay. I hope you enjoying learning this medical coding, right? If you have any doubts, you can ask me anytime. Okay. And if you find this session, this medical coding session interesting, and if you want to learn more about medical coding, if you want to enroll in our medical coding training sessions, you can go through this link we have given below, which is nothing but www.greatonlinetraining.com, and register yourself. Okay. So again, thank you. Bye bye. Take care. So, hello everyone. How are you? Hello. I hope you
Fine, ma'am.
are okay. Good. So, welcome to Great Online Training. Myself, Nikita. I am CPC certified medical coding trainer in Great Online Training. This is all about, these sessions are all about medical coding, and this is day 4. And today we're going to learn about medical terminology. Before starting, I'd like to hear from you. What do you know about terminology or medical terminology, or why it is important to learn medical terminology? Please tell me whatever you think. Hello. Fine. So the terminology,
Yes, ma'am.
yeah. Please go ahead.
No idea, ma'am, about that.
But why there is need to learn medical terminology? What do you think about it? See, terminology means study of specialized concepts and their linguistic destination or terms, right? So, medical terminology means study of words and languages used specifically in medical or health field. So why there is need to learn? Why can't directly we go and study medical coding? Fine, it's okay. We'll see it. Before that, we'll see what are the different topics we're going to cover in this class. So we'll see objectives. That's the question I ask you. Okay. Then we'll see introduction. Then basic word parts. Okay. Then we'll see medical root words, medical prefixes, suffixes. Then we'll see some word analysis, medical terms, medical abbreviations and acronyms. Okay. So first, let us start with objectives. Okay. For learning, if you want to be a professional medical coder and meet your productivity goals, remember I told you these medical coding jobs are uh, focus on your productivity. These jobs are productivity based. Okay, and with productivity you have to give your quality at least 95% quality also. So to meet your productivity goals and quality goals, you need to know medical terminologies, right? If you want to work with medical or healthcare professionals, nurses, you must have understanding about different medical terminology, anatomy, synonyms, different types of prefixes, suffixes. Then and then only you can do your coding job perfectly. Am I right? So, learning more about medical care and treatment is the main objective of learning medical terminologies, right? Then we can also find our mistakes more easily, working quickly and accurately, and hit our daily productivity target and quality benchmark also. Sorry. Then ensuring accurate coding and billing. If you know about most of the medical terminology, if you have good knowledge of medical terminology, anatomy and all, then and then only you can choose correct diagnosis also, and choose correct code, right? And lastly, enabling healthcare service providers to receive payments on time. Obviously, if you, as a medical coder, do your job properly, if you maintain your 95% quality, then there will be no rejections happen, or less rejections happen, and less denial claims happen, and so that the service provider get their payment on time. Correct? That's why we have to learn medical terminologies. We can't go directly and start learning medical coding, because if you do so, you'll not going to understand many terms involved in medical terminology. Okay, now we'll see introduction. What is medical terminology? What are the different uh, components of medical terminology? Medical terminology is a language used in healthcare to describe anatomy, structures, condition, diagnosis, procedure, treatments, and much more. Okay, it is nothing but medical language which are used in healthcare. Medical terms usually use a combination of prefixes, root words, and suffixes to define the meaning. Okay, the word of medical terminology is quite vast. So we organize them by category to make it a little easier to digest. The categories are like medical root word, medical prefixes, medical suffixes, medical terms, medical abbreviations, and acronyms. Right? And I want to clear one thing, that we are going to cover this all these topics in this session, but it is not possible for anyone to cover all the medical terminologies in 1 hour session. Okay, So it is ongoing process of learning medical terminology. You have to learn more and more about it. Here in this session, I will give you few examples, few important or daily use medical terminologies examples, but eventually you have to go through and study your own style, study in your own style in this medical terminologies. Okay, and ultimately when you start working in as a medical coder, you're going to learn new medical terminologies, right? So my just suggestion is simply go through Google or any medical related book or medical dictionary where you can find medical terminologies, and if possible took printout of it and daily read few medical terminologies, read few prefixes, suffixes. Okay, so that uh, you'll go through it and you know most of the medical terminologies, right? I'll going to give you many examples which are commonly used. Okay, let's start with the basic word parts. Okay, you might have thinking that we can use Google for medical terminology to find meaning of any word if we didn't understand the meaning of it, right? Am I right? Yes, that we can do, but ultimately you can't search for each and every term on Google, because it will take much time to search each and every term. And while working as a medical coder, you can't waste your time, because medical coding jobs are productivity based. You must complete your daily target. If you go and look up for many terms each and every time, it will slow down your productivity. Correct? So that's the reason why you need to know at least basic medical terminologies which are commonly used in health report. Okay? So the foundation of medical terminology is rooted in learning the four basic word parts. Okay, which are prefixes, root words, suffixes, and combination or combining forms. The most medical words have a beginning, middle, and an end. Okay, the beginning is the prefix, whereas the middle is the root word, and the end is the suffix. Beginning is called prefix, middle is called root word, and end is called suffix. Right? The combining vowel, those are mostly used combining vowels are O or I, etc. It is used between two word roots or between a word root and a suffix to ease the pronunciation. Okay, the vowel combining vowels mostly use combining vowels are O or I. These are either present between two root words or between one root word and suffix to ease the pronunciation, so that you pronounce that medical terminology easily. For example, you can see this word earthopathy. Here, earth is one word, whereas O is combining vowel. Again, pathy is another word. Okay, if there is no O, how will you going to pronounce this word? Orthopathy. Sounds weird, right? So orthopathy, you can pronounce it easily because of this combining vowel O. Again, here you can see hepatic word. Here hepat is one word, main or root word, whereas IC is at the end, which is suffix. Okay, but IC is begin with vowel I. That's why here there is no requirement of any other vowel, because I is already there in IC suffix. Okay. Then the understanding terminology involves breaking words down into their separate components of prefixes, suffix, and root word, and possesses a good working knowledge of those words. If you don't know about any, or if you come across any new word or new medical terminology, then what you have to do, you have to know how to break up those words in prefix, suffix, and root word. Okay. And also you have good working knowledge of those parts. You must understand their, you must have knowledge about their meaning also. Then and then only you can understand the meaning of that whole medical term. You can see one example: hypothermia. Here hypo is prefix, therm is root word, whereas ia is suffix. If you don't know, if you even don't know meaning of this word, this medical term hypothermia, after you break this term into hypo, therm, and ia, you can easily understand the meaning, because hypo is below normal, and therm means heat, whereas ia means condition. So the meaning of this term is the condition where in which body temperature goes below normal range. Correct? So likewise, you have to break your medical term. Now we'll see root words. Root means subject, the main subject of that word. Okay, the main part or foundation of a word is called root word. All words have at least one root word. Correct? Because that is the main subject. Without root word, there is no any medical terminology. A word root may be used alone or combined with other elements to form a complete word. The word root usually refers to a body part. Some root words are derived from Latin or Greek language. Okay, that's the reason why you have to understand the meaning of those words. You have to go through different medical terminologies. Okay, because also if you are going to take taking this medical coding certification exams for medical coding, they will not allow you any medical dictionary or use of Google, even though these exams are open book exams, right? So to be able to pass this examination, you must possess good working knowledge of medical terminology, which are present in those 150 questions. Because this mostly this certification exam, I have given CPC certification exam, so I know that CPC certification exam consists 150 questions, which we have to complete within 4 hours. Though it is open book exam, you have to manage your time to complete your paper. Okay, because if you have good working knowledge of this medical terminology, anatomy, then and then you can cover your paper, because most of the question they ask are based on medical terminology only. Means they included medical terminologies in question. Okay, so that they test your medical terminology knowledge in order to lead you to the right medical code. Okay, so Now we'll see one example. Again, hyperthyroidism. Okay, if you break down this word into hyperthyroid and ism, here you can see thyroid is the root word. Okay, thyroid means thyroid gland. Then hyper is prefix. Okay, and the meaning of hyper is higher than normal. Hypo means lower than normal, whereas hyper means higher than normal. Okay, and ism is suffix which is used for condition. Okay, so the meaning of hyperthyroidism is thyroid gland makes more thyroid hormones. Okay, now we'll see combining forms. A combining form is simply a root that includes one or more vowels tracked onto the end of it to make a root suffix combination pronunciable. Okay, so the combining form is simply a root that include one or more vowel at the end of it to make root suffix combination pronunciable. Okay, for example, psychology. The main root is in psychology, the main root is psych, means mind, and the suffix is logi, means study of. Okay, but if here this o is not present, okay, this vowel o is not present, then this word will be psychology. Doesn't flow as well as psychology, right? Thus, we insert the O to create a more English sounding word, right? This is the use of combining form or use of vowel to make it more easy to pronounce. So, as the example shown, the combining form concept is all about vowels, consonants, and pronunciation. Okay. Now we'll see few examples of root words. These are few root words used for organs, different organs. Like here, we'll use safe word for head. Okay, whereas unsafe is used for brain. Okay, inside the head, what present? Brain. So unsafe. Okay, then ocul or oculo. You can see O is written inside the bracket because it is used in few terms. Okay, few terms consist only ocule, so a few terms consist oculo also. So ocule means eye, cardi or cardio means heart. Again, gastro or gastro means stomach, whereas rhino means nose. Hepat or hepato means liver, whereas colo means large intestine. Like this, there are so many root words present in this medical word. Okay. Now we'll see few root words for heart and blood vessels, which are commonly used. At least you have to by heart these few root words which are commonly used. Okay. So the him or himo or sangu is used for blood. Aort is used for aorta. Then carda or cardio means heart. Artery or arterio means arteries. Angio or ng means blood vessels. Then ven or veno or pleb or plebo means veins. Now we'll see few important root words regarding head. Head means ceph, whereas brain means enceph. Okay. Rhino means nose. Tympan or meringo used for eardrum. Okay. Odont or dento is used for tooth. Lingu is used for tongue. Okay. Then otto is used for ear, whereas ophthalm or oculo is used for eyes. These are few root words for digestive organs. Hepat or hepato means liver. Cholecyst means gallbladder. Then colo means large intestine, whereas ilio means small intestine. Gastro means stomach. Esoph or esopha means esophagus. These are few root words which are important in digestive system. Now we'll see root words for bone and muscle area. Okay. Myo means muscles. Okay. Myo means muscles. Whereas oste or osteo means bones. Dorsa is used for back. Cost or costo is used for rib. Scapule is used for shoulder, whereas brachy or brachio means arms. Carp or carpo means wrist. Again, these are few more root words. Root word, we'll see few examples also using this root word. Where it goes, just a minute. Okay, so abdomino means, meaning of the abdomino is abdomen. So abdominalgia means abdominal pain. Arterio means artery. So arteriosclerosis means hardening of arteries, because sclerosis means hardening. So hardening of arteries is called arteriosclerosis.
Okay.
Sorry? Hello? Any doubt?
No, ma'am.
Okay. Then cardio means heart. So cardiomegaly is nothing but enlarged heart or enlargement of heart, because megaly meaning enlarge. Okay. So next is derma or dermo or dermat or dermato mean skin. So dermatitis means irritation of skin, because itis is irritation. Okay. Then encephal or encephalo means related to brain, right? If it is cephal, it is related to head. Remember this. Okay. Encephalitis is the example of encephal word, root word. So encephalitis is nothing but inflammation of the brain, because itis means inflammation. Gastro means related to stomach or digestive. Okay, so gastritis means again inflammation. Itis is inflammation. So inflammation of stomach is gastritis. Hemat or hemato means blood, related to blood. So hematemesis means vomiting of blood, because emesis means vomiting. So vomiting of blood is called hematemesis. Again, myo means muscle. So myocarditis means inflammation of heart muscles. Okay. Myocarditis. Here you can see two root words. My means muscles and card means heart. That is why myocarditis means inflammation of heart muscle. Okay, then osteo means related to bone. So osteoblastoma means nothing but benign bone forming neoplasm. Okay, oto means related to ear. So otomycosis means infection of outer ear. Okay, then pulmon or pulmono means related to lungs. So pneumonia is nothing but infection that affects lungs. The next one is rhino, meaning related to nose. So rhinorrhea means runny nose. This is common symptom, right? So runny nose is also known as rhinorrhea. Do you know about it? Okay. Even if you don't know right now, you get understand. Runny nose is also known as rhinorrhea. Okay. So sclerosis is the next word. Sclerosis is nothing but hardening or heart. So scleroderma means hardening of skin, because derma means skin. So scleroderma means hardening of skin. Next is therm or thermo, means indicates heat. So thermoplegia means heat stroke. Okay. So that was a few examples of root words. Apart from that, there are too many root words present in this medical sector. You have to ultimately go through daily. You have to go through few root words. Okay. Next, we'll see prefixes. Prefixes or prefix is descriptive part of the medical term. Okay. A prefix word, a prefix is a word element attached to the beginning of a word or word root. Okay. It is attached at the beginning of the word or word root. Adding or changing a prefix changes meaning of the word. If you change prefix, it will changes meaning of the word. The prefix usually indicates a number, time, position, or direction. Like just we see one example, hyperthyroidism or hypothyroidism. Here, hypo are prefixes. Okay, so if you add hyper in the word thyroidism, it is what does it mean? Increased thyroid. Okay, whereas hypo means decrease or low level. So it will change. If you change the prefix, it will change meaning of the medical term, right? Many of the same prefixes found in medical terminology and are also found in English language. Okay. Now we'll see few examples of prefixes. Alphabetically, we're going to see few examples. A or N means without or lacking. So anemia is nothing but blood does not have enough RBCs. If you have less RBCs or not enough having RBCs in your blood, it will call as anemia. Okay. Andro means related to male. So androgen is male sex organ. Okay. Then anti means against. Okay. So antibiotics means the medicines that fight bacterial infection. It's called antibiotics, because biotics meaning bacteria or bacterial infection. Then next word is auto. Auto means self. So autonomy means nothing but self-governed. Then bio means life. So biology means study of life, because logy is study of something. It's called logy. So biology means study of life. Then next word is chem or chemo. So chemistry, chemo means or chem means chemistry. So chemotherapy is the one drug treatment that uses powerful chemicals. It's called chemotherapy. Okay. Next one is contra. Contra means against. So contraception means device or technique that prevents conception. Okay. Then next one is cyte or cyto, meaning cell. Okay. Cell is known as cyto. So cytotoxic means a substance or process can damage cells. Okay. Cytology also. Cytology means study of cells, called cytology. Likewise. These are few more examples. This means difficult or abnormal. So dyspnea means abnormal breathing because pnea means breathing. Then EU means good or well. So eupnea means healthy breathing. Dyspnea is abnormal breathing, whereas eupnea means healthy breathing. Then next word is fiber or fibro. This is mean fiber or fibrous tissue. So example of it is fibrosis, meaning thickening or scarring of tissue. Then gluco or glyco means related to glucose or sugar. So glycogen means stored form of simple sugar. Then gyne or gyno or gynec is related to female. So gynecology is study and treatment of the diseases of women. Right? Then hydro means water. So hydrocephalus means fluid or CSF builds up within the brain. Okay. Then IDO means self or one's own. Idiopathic means a disease of its own. Then lyse or lysis means breakdown or destruction. Example is lysis. The breaking down of the membrane of the cell is called lysis because lyse is breakdown. Next, mal. Mal means bad or abnormal. Okay. This means also abnormal and mal is also abnormal. So mal means abnormal. An example of mal is malformed, means badly shaped. Next one is mic or mico. So mic or myco, meaning fungus. So mycotoma means I'm so sorry. Mycetoma means disease caused by bacteria or fungi. Then necro means death. The necrosis means death of body tissue is called necrosis. Neo means new. So neonate meaning a newborn child. Then next one is pan or pant or panto means all or everywhere. So pancytopenia means having low level of red blood cells, white blood cells and platelets. Okay. Then next one is means against or backward. So rejuvenation means make fresh or new again. So these are few examples of prefixes. Okay. You can go through search on Google and you will going to find more prefixes also. If you need my help, if you need any suggestion from me, I am there to help you. Okay. Now we'll see suffixes. So suffix is meaning. Suffix represent meaning of that word. Okay. A suffix is a word element placed at the end of a word or word root that changes the meaning of the word. Again, either you change prefix or you change suffix, the meaning of the word is going to change. Okay, changing the suffix change the meaning of the word. In medical terminology, a suffix usually indicates a procedure, condition, disease, or part of speech. Okay, many suffixes are derived from Greek or Latin words. Mostly this you can see in this medical terminologies, most of the words are derived from Greek or Latin words. That's the reason why you have to go through different medical terminology, right? So three important suffixes are commonly used are algia or logi and itis. Okay, algia means pain. Okay, logi means to study of, and itis means inflammation. Okay, so these three suffixes occur in many medical terms. For example, when you learn a new root such as the neuro or neuro, which means nerve, you will know meaning of neuralgia, neurology, and neuritis. So directly you will going to understand three new medical terms if you know the meaning of this algia, logi, and itis, because these are commonly used suffixes. Okay, so neuralgia means pain in a nerve. Neurology means the study of nervous system. Also, the specialty dealing with diagnosis and treatment of nervous system disorders. And neuritis means inflammation. So neuritis means inflammation of a nerve. So remember these three suffixes. These are very much important suffixes. Okay. Now we'll see few examples of suffixes alphabetically. If there is a suffix AC, AC meaning pertaining to. For the example, cardiac. Cardi means heart, related to heart. So cardiac means related to heart. Then brachial means related to arm. So antebrachial means related to forearm. Okay. Then cyte or cytic means related to cell. So thrombocyte means blood cells. Okay. Then dynia means pain or swelling. So thrombocyte, means pain in the chest. Then EL or EL means pertaining to. Esophageal means esophageal is the example meaning related to esophagus. Then ectomy. This is also commonly used suffix ectomy. Ectomy means cutting out or excision. Okay, cutting out means or excision means ectomy. Okay, excision and ectomy both having e into it. So you can remember it like this, because you will find most of the term with these suffixes. Okay, ectomy means cutting out or excision. Means for example, the hysterectomy means excision of uterus. Then emesis means vomiting. So cholemesis means presence of bile in vomitus. Hematemesis means presence of blood in. The next one is ization. Ization means result or condition or state. So catheterization means being fitted with a catheter. It's called catheterization. Then ism means condition. So hypothyroidism is the condition when lower level of thyroid hormones present in your body. Ites or itis means inflammation. arthritis. Example is arthritis, means inflammation of joint, because earth means joint. Ortho means bone, where earth means joints. Please remember these differences. Okay, because these are the points where you can do mistake or you can jumble. Earth means joint, ortho means bone. Okay, and itis is just as I say, itis is commonly used suffix in many terms. Okay, so itis means nothing but inflammation. It means it means quality or state. So immunity meaning the quality or state of being immune is called immunity. Ium, ium means structure or tissue. So epithelium means layer of the cell that line hollow organs and glands. Okay, it's called epithelium. Then lysis or lytic means breakdown or destruction or dissolving. So osteolytic means condition where bone tissue is destroyed. Here you can see earth means joint and oste means bone. Okay, so please remember these terms. Osteolytic means condition where bone tissue is destroyed. Then Malacia means softening, not Malaysia, right? It's Malacia, Malaysia. So it is softening. So osteomalacia means soft bone disease. Okay, then megaly means enlargement. So hepatomegaly means enlargement of liver. Next is OMA. OMA, O-M-A, OMA means tumor, related to tumor. So sarcoma means cancer of muscle or connective tissues. Okay, it's called sarcoma. Then otic, otic, O-T-I-C, otic, meaning relating to the ear. So diotic means affecting or pertaining to both ears, because di means both or two, right? So diotic means pertaining to both ears. Next is OS, OUS means pertaining to. Example is filamentous, means bearing or covered with thread-like structure is called filamentous. The next word is pathy. Pathy means disease. So nephropathy means disease of kidney. The next one is penia. Penia means deficiency or lack of. So leukopenia means a decrease in number of leukocytes in the body. It's called leukopenia. Then phagia or phagy means eating or swallowing. Example is dysphagia. Dysphagia is difficulty in swallowing. Okay, because phagia means swallowing and this means difficulty. So dysphagia is difficulty in swallowing. This is how you have to break down the medical term and uh, learn their meaning. Okay. Then next word is or next suffix is fascia. That is phagia. First one is phagia. P-H-A-G-I. P-H-A-G-I means swallowing. Okay, or eating. Whereas P-H-A-S-I-A means P-H-A-S-I-A meaning speech or related to speech. I'm sorry. Aphasia. Aphasia is an example of phasia. So, phasia is nothing but difficulty in speaking. Okay. Then plasia. Plasia means related to growth. So, hyperplasia means enlargement of bodily organ or part. It's called hyperplasia. Now we'll see how we can do word analysis. Just give me 1 minute. So now we'll do and we see how we can do word analysis if you don't know meaning of that word. Okay. First example is leukocytopenia. Okay. We'll have to divide this word like this. The word root one is, here we have two root words. First one is leuc, which is meaning white. Leuc means white. And the second root word is cyte, means cell. So leukocyte means white cell. That is confirmed. Okay. Then here combining vowel is O. That's the reason why leukocyto. Okay. Then we have suffix, which is nothing but penia. Penia means decrease. Decrease in amount. Okay. So here we break down this term as leuc O, cyte O, penia. So the meaning of this leukocytopenia term is decrease in number of white cell. Easy? Like this, you have to break down the word or the medical term into different parts, different word parts like prefix, suffix, root word, combining vowel, and then you will easily understand meaning of that medical term. Okay. Now it's your turn. I'll give you one this medical term. You will going to tell me. I want answer from you. Try it. It is okay if you are wrong. Don't worry. Just try to tell me. How will you going to analyze this word? How will you going to break this word? Hello?
Yes, ma'am.
Yeah, try it. This is very easy word, and right now we go through this both words. Try to break this medical term.
Claire is the prefix, ma'am,
Mm-hmm. Correct?
and derma is the suffix.
Okay. And what is the meaning of this word? Rather than just breaking, you need their meaning of those words. Sclare meaning, or at least you can say what is meaning of dharma.
Skin diseases.
Right, correct. So dharma is skin, related to skin. Skin, and sclare means hardening. Okay, and here combining vowel is O. That's the reason why we can pronounce it properly, scleroderma, right? So here root word is sclare. Okay, sclare means hardening, and combining vowel is O, whereas suffix is derma, means skin. Okay, so the term we divided as scleroderma. Okay, so the meaning of this medical term is hardening of the skin. Okay, next word is electrocardiogram.
Belongs to the heart, ma'am.
Yes, correct. Because of which word?
Cardio.
Correct. Then, how many vowels present in this term? First, look out for vowels so that you will going to easily break down this term. The common vowel which will use for medical using medical terminology.
Oh.
That is O, right? So we have only two O here. Electrocardiogram. We have two vowels. So our word is divided as electrocardiogram. Here, first root word is elect, means related to electric, whereas the second word is cardi. As you say, cardi means heart. And next, lastly, suffix is gram. Gram means a written record. So the term divided as electrocardiogram. So the meaning of this electrocardiogram word is, or medical term is, record of heart's electric activity is called electrocardiogram. Okay, this is how you have to analyze the word so that it is easy to understand meaning of that medical term. Understand? Try practicing
Yes,
and
ma'am.
try to go through different medical terminologies so that it will be easy for you. Okay, and try to first look for combining vowel. Okay, so this is all about how we have to do word analysis. The key to learning medical terminology is to learn prefix, suffix, and root words, again, abbreviations. And when you learn these, you combine them together to figure out all of the different terms. Knowing the prefix, suffix will really gonna help you to make strong foundation that you can pretty much piece your any term together. Okay, if you have good knowledge of medical terminology or prefixes, suffixes, root words, different abbreviations, human anatomy, you can divide any word, any medical term easily. Okay, now we'll see few medical terms which are commonly used in healthcare system. Okay, what is medical terms? These are the words that are frequently used among practitioners or nurses, or you can say doctors. Okay. So ultimately, a doctor are using means you have to go through these terms while you are reading the patient's health report. Correct? That is why you need to learn the medical terms. The commonly used medical terms are acute. Acute means signifies a condition that begins abruptly and it is sometimes severe, but the duration is short. It's called acute. Okay, means any condition begins abruptly, or it is sometimes severe also, and duration is short. That condition is called acute condition. Then benign. Benign means non-cancerous. If the tumor or that tumor is non-cancerous, doctor will say benign tumor. Okay, meaning of it is that tumor is non-cancerous. Then next word is biopsy. There are many words start with A, or medical term starts with A. Here I can't, I'm not able to collect all of them. Okay, I just give one example. Okay, you have to go through Google and different medical books to learn these things. Okay, then biopsy. Biopsy means a small sample of tissue that's taken for testing. Okay, generally in case of cancer, of if or if doctor doubts that any case is cancer related, they will suggest for biopsy, where a small sample of tissue taken from your skin for testing. Okay, then next one is chronic. Chronic signifies a recurring persistent condition like heart diseases. Okay, chronic conditions are recurring and persistent conditions, right? Then next one is defibrillator. Defibrillator, it is an apparatus used to control heart fibrillation by application of an electric current to the chest wall or heart. Mostly we have seen this type of this defibrillator in TV, mostly in movies or in serials, right? That instrument is called defibrillator. Then edema. Edema is swelling caused by fluid accumulation. Okay, if fluid caused due to fluid accumulation, it is called edema. So edema is not edema and soft tissue swelling is are both are different terms. Okay, and we have different codes for those conditions. Okay, we have different code for edema, we have different code for soft tissue swelling. Okay, so keep it in mind that this thing, edema is caused by fluid accumulation. It is type of swelling, but it is caused by fluid accumulation, right? Then embolism means an arterial blockage, often caused by blood clot. It's called embolism. Okay, then fatigue is a feeling of weariness, tiredness, or lack of energy. It's called fatigue. Then we have inpatient. Inpatient means a patient who requires hospitalization or who is admitted in the hospital for at least 24 hours a day. That patient is called inpatient. Okay, then we have intravenous. Intravenous indicates medication or fluid that's delivered by vein. Then we have malignant, which indicates presence of cancerous cells. Malignant means presence of cancerous cell, whereas benign means non-cancerous. If the cancer is or if the tumor is benign, that tumor is non-cancerous. If the tumor is malignant, that means that consists cancerous cells. Okay, then Medicare means refers to a government health insurance plan for adults older than 65 or individuals with a disability. Okay, whereas Medicaid, it is another type of government health insurance that helps low or limited income families with the cost of health insurance. Okay, we're going to discuss about this Medicare and Medicaid insurance in further sessions also, because this whole US healthcare system goes around these terms only, because we are working for Medicare and Medicaid patient. That's why you need more understanding about these terms. Okay. Then outpatient. Outpatient is a patient who receives care without being admitted to a hospital. Okay. Then Relapse. Relapse means return of disease or symptoms after a patient has recovered. That is called relapse. So these are some medical terms which are commonly used. Okay. Now we'll see some medical abbreviations and acronyms. What is meaning of abbreviations and acronyms? Can you tell me? Hello?
Headings, ma'am.
Yeah, acronyms and abbreviations means shorthand version of common medical terminologies. Okay, or you can say short forms like this. These are few examples of abbreviations commonly used in medical coding. So ALS means advanced life support. It's called ALS. Then BMI. BMI means body mass index. Then we have BP. BP means blood pressure. Then CRF. CRF means chronic renal failure. Or we have also CKD, chronic kidney disease. Okay. Then DM means diabetes mellitus. Then ED or ER meaning emergency department or emergency room. It's called ED or ER. The coder who is working in means coded chats from emergency department are called ED coder. Okay. Then EKG. EKG means electrocardiogram. Then we have HR. HR means heart rate. Then ICCU. ICCU is nothing but intensive coronary care unit. Intensive coronary care unit means ICCU, whereas ICU means intensive care unit. Right? LBW. LBW means low birth rate. It's called LBW. MVA means motor vehicle accident, or we also have MVC. MVC means motor vehicle crash. Okay. Then we have NICU. NICU means neonatal intensive care unit. It's called NICU. Then we have pre-op. Pre-op means pre-operative. So these are few abbreviations used in medical terminologies. Okay. So I want to do one request to you. Please go if you want to be a medical coder, if you want to be in this field, US healthcare field, and work as a medical coder, please go through these different medical terminologies by using Google or any medical related books or dictionary. Okay, if you need my help, if you need my suggestion, which site is good for referring these terminologies and all, I am there to help you. Ask me, I will tell you. Okay, but go through it and try to recollect it. Okay, try to bring take out the printout of those pages so that you can go through them daily. Okay, so lastly, thank you for your attention and making this session very interactive. Okay, if you find this session my teaching interesting, if you want to learn more about medical coding, if you want to join our medical coding course, then please go to the given link below, which is www.greatonlinetraining.com, and register yourself. Bye bye, take care. So hello everyone, welcome to Great Online Training. Myself, Nikita. I am a CPC certified medical coding trainer in Great Online Training. This is day 5. Today we're going to discuss about business of medicine. What do you think? What will we going to discuss in this session? What do you think? What is meaning of business of medicine? Anyone? All right. Business of medicine is nothing but you can say it is the administrative side of medicine or healthcare industry. Okay. Here we're going to discuss about future scope or career opportunities in medical coding. If you see medical coding as your professional career, then what are the different possibilities? Okay. Then we'll see different kinds of payers, different kinds of providers, okay, and other rules and regulation regarding coding, okay, different kinds of insurance provider that we're going to discuss in this session, okay. So we'll see what are the different topics we'll go into covered in this class. Today we'll see coding as a profession. Then we'll see hierarchy of providers. Then the different types of payers. Then we'll understand RBRBS. Then medical necessity. Then the advance beneficiary notice. It is also known as ABN. Then the need for privacy and security. Then we'll see covered entities of HIPAA. Remember, I told you about HIPAA regulation that we'll going to discuss in today's session. Then high tech and its impact on HIPAA. Then we'll see fraud and abuse and their examples. And lastly, we'll see some acronyms. Okay. So first, coding as a profession. As of now, I hope you get better understanding of what is medical coding and what are the different career opportunities in medical coding. So, can you please, can someone tell me what is medical coding? Anyone? Anything you learn from previous sessions? What is medical coding? Okay, fine. I'll explain you again. Medical coding is a process of taking patients' health information, which can be any diagnosis, symptom, illness, anything, or abnormal finding from patient's report, or any medical procedure, whether it can be diagnostic or surgical procedure, any procedure details patient undergone, or any medical necessity, medical equipment, or any other medical services the patient took that we have to uh, took from physician, or we can say we have to extract that information from patient's healthcare report, and then we have to as a medical coder we have to convert that information into medical codes which are accepted worldwide, okay, and which are numeric or alphanumeric codes, okay. So this process of conversion of medical or healthcare information into medical codes is called medical coding, right? Medical coding is technical and rapidly changing field that offers practitioners a variety of career opportunities, like we discussed in previous sessions also, right? If you choose US healthcare is your profession, or if you have decided to work in US healthcare field, then you have many options, right? You can work as a medical coder, you can work as a medical biller, you can work as a medical transcriptor, or AR caller, denial coder, or any compliance manager, or different position. There are many positions available in this field. But if you choose medical coding, particularly medical coding as your profession, then also you have variety of career opportunities. For instance, skilled medical coders may become consultant, remote medical coder, or medical coding trainer, or you can say medical coding educator, or medical coding auditors, right? Also, you can become a TL and manager as you gain more and more experience, right? Coding as a profession has evolved over the past several decades and will continue to do so as the business of medicine embraces new technologies, new code sets, and payment methodologies. Okay, and I think medical coding is very good opportunity for those who are just completing or about to complete their graduation, because this is the only one field where you can directly start your job as soon as you completed your graduation, right? So this is the main or advantage of this profession. Okay, and soon after your completion of your graduation, you get chance to work with doctors. You get chance to work for doctors, and those doctors who's working in US. So I think this is very good opportunity, right? Now we'll see coding as a profession. Okay, each time an individual receives healthcare service, a record is maintained of resulting observations, medical or surgical interventions, diagnostic tests and studies, and treatment outcomes. Okay, coding is a process of translating this written or dictated medical record into series of numeric and alphanumeric codes. Right? There are separate code sets to describe diagnosis, medical and surgical services or procedures, and supplies. We discussed this in previous sessions also in first step in medical coding, right? What are those? For inpatient coding, which focuses on physician services and care provided while patient is being admitted in the hospital, right? Inpatient coders will focus on learning ICD-10 PCS and ICD-10 CM codes. ICD-10 PCS codes are used for inpatient procedure coding, while ICD-10 CM codes are used for diagnostic coding. Where ICD-10 codes are common for whether it is inpatient or outpatient, any patient. Okay, ICD-10 codes are common for all types of patients because these are disease codes. Okay, disease symptoms, illness, abnormal finding codes. Okay, just difference is ICD-10 PCS code are used for procedure coding on inpatient. Okay, so if you want to become a inpatient medical coder, you have to take to training for IPDRG. Okay, where you get trained with ICD-10 PCS and ICD-10 CM course. Okay. Otherwise, if you take only medical coding training, you will get trained on ICD-10 CM, which are used for diagnostic coding, then CPT code and HCPCS code. Okay. So again, inpatient coders also will assign medical severity diagnosis related groups, MSDRGs, also known as MSDRGs. So again, if you want to choose IPDRG as your coding specialty and you are going for IPDRG training, then there you will get trained with MSDRG, ICD-10 PCS and ICD-10 CM course. Okay. Then outpatient coding focuses on outpatient coding focuses on physician professional services and outpatient facility coding. Okay. Outpatient coders will focus on learning CPT, HCPCS level 2 and ICD-10 ICD-10 CM course. Okay. Generally, in medical coding training, you will get trained on CPT, HCPCS level 2 course and ICD-10 CM course. Okay. CPT course are also known as, can anyone tell me? CPT course are also known as, try to give answer. It's okay if you are wrong. Just give me answer. Anyone?
And proceeds the terminology and the definition.
No. I'm asking HCPCS are level 2 course. CPT course are also known as, these are level 1 course. Okay. HCPCS are level 2 course, whether CPT course are level 1 course. So they also known as level 1 course. Okay. Fine. Then regardless of the setting, means any specialty you choose, code updates and insurance payment policies may change as often as quarterly. Okay. That's the reason coders require continual education to stay abreast of these changes. Okay. So you have to be continue learning. Your learning process should be continuous to get updated in this field, because ICD-10 codes are get updated every year in October, whereas CPT, HPCS codes are updated quarterly. Okay. Now we'll see the hierarchy of providers. Now you tell me, who is provider? Earlier we discussed about RCM cycle, revenue cycle management, right? That time I told you we discuss about provider, patient and payer. So who is the provider?
To prepare a standardized bill for services given to a patient.
Correct. So a provider is any doctor, whether a physician or non-physician, anyone, whether it is MD or DO, anyone can be a provider who is certified to give medical care to the patient, right? Whether it can be MD, DO or radiologist, anesthesiologist, pathologist, anyone can be a provider. Or again, mid-level providers are also there, which include practitioners or nurses, right? So we'll see hierarchy of providers. A variety of medical providers, provider staff, physician offices and hospitals, including physicians and non-physician providers. Non-physician providers also known as NPPS. Okay, NPPs. NPP, not NPPS, NPPs. Non-physician providers, such as physician assistant and nurse practitioners. NPPs are often reimbursed at a lower rate than physicians and require physicians' oversight. Correct? Different providers have different levels of education, and each state has scope of practice guidelines for various provider levels. If provider is physician, if he's MD, medical doctor, or if he's DO, then they complete their study like 4 years college, 4 years of medical school, then 3 to 5 years of residency. Residency means training in specialty of practice. Okay. Then if they have mid level of providers, they include physician assistant, PA, also known as PA, then nurse practitioner, also known as NP, and both PA and NP both called as physician extenders. Okay, these are licensed to practice medicine with physician supervision. Okay, and provider, obviously provider is highly skilled, highly educated. The physician, which is MD or DO, is highly qualified, and they have higher skill sets. That's why they reimbursed at higher rate than the NPPs or physician extenders. Okay, because of their education. So this is the hierarchy of providers. Now we'll see the different types of payers. Payer means who is payer?
The amount to be paid to the provider.
Uh, Sorry, come again.
To determine the amount to be paid to the provider.
No. Payer is the one who is going to pay to the doctor. Right? This is not related to amount. I'm asking you who is payer. Okay? It can be patient itself or insurance provider. Okay? Who will going to pay to the doctor. Although some patients will pay in full for their own medical expenses, most patients will have some type of insurance coverage. What happened in India, we have few of us have insurance, right? We have covered under insurance, but to avail those insurance benefits, we need to get admitted into the hospital, right? For at least 24 hours. Then and then only we are eligible to get those insurance benefits, right? But in US, what happened, their cost of living, their cost of service, their cost of procedures, their quality of procedure is way too high than India. That's the reason why they they have buy insurance, or they pay some amount as a premium to the insurance company, right? And most of the people in US will covered under some form of insurance, either private insurance or government insurance. Okay, and that's the reason why there in US, they, even though that is small outpatient visit, that is also covered under those insurance. Okay, which is not happen in India. In India, we are our small outpatient visit is not covered under insurance, right? Only if we get admitted into the hospital for at least 24 hours, we'll get insurance benefit. But in US, even though you go for normal fever or cough and cold, then also insurance company will going to pay on the behalf of you. Okay, so there are two primary types of insurance or insurers: commercial and government. First, we'll see commercial insurers. These are private payers that may offer both group and individual plans. The contracts they provide vary but may include hospitalization, basic, and major medical coverage. For example, Blue Cross Blue Shield organizations are private payers who usually operate in the state in which they are based. Okay, Blue Cross Blue Shield is most of the private insurance. Okay, now we'll see government insurance. There are two types of government insurer, Medicare and Medicare. Medicare and Medicaid. Okay, first we'll see Medicare. Medicare is a federal health insurer program administered by Centers for Medicare and Medicaid Services, also known as CMS, Centers for Medicare and Medicaid Services, that provides coverage for people over the age of 65 years or blind or disabled individuals and people with permanent kidney failure or end-stage renal disease. End-stage renal disease also known as ESRD. Okay. So please make sure that if you want to make your career in medical coding, please be aware of this Medicare and Medicaid, difference between Medicare and Medicaid. Okay, because surely your interviewer going to ask you this question: what is difference between Medicare and Medicaid? Okay, so Medicare is a federal health insurer program which provide coverage for people over age of 65 years. Okay, or blind or disabled people or people with permanent kidney failure or ESRD. Okay, there are the Medicare program is made up of four parts. There are four parts of Medicare. Okay, first one is Medicare Part A. Medicare Part A covers inpatient hospital care as well as care provided in skilled nursing facilities, hospice care, and home health care. Okay, healthcare Part A covers inpatient hospital care. Okay, then next one is Medicare Part B. Medicare Part B covers medically necessary physician services, outpatient care, and other medical services, outpatient care, and other medical services not covered under Medicare Part A. So you can see here. Here, Medicare have made up of four parts. Okay. Part A, which cover inpatient hospital care. Part B, which covers outpatient care. Okay. So here, outpatient care is also included in Medicare. Then third one is Medicare Part C, also called Medicare Advantage, because it combines benefits of Part A and Part B and sometimes Part D also. Okay, so Part C, Medicare Part C is combination of other three parts. Okay, Part A, Part B, and sometimes Part D also. So if patient wants to get benefits of both the parts, means inpatient care also and outpatient care also, they have to choose Medicare Part C. Sorry. Then fourth one is Medicare Part D, which is related to prescription drug program available to all Medicare beneficiaries. Okay, these are related to drugs. Okay, so again, Medicare Part A covers inpatient hospital care, Medicare Part B covers outpatient care, Medicare Part C covers benefits of other three. Okay, and Medicare Part D covers drug prescription. Okay. This is the differentiation between 4 of them. Part A, hospital coverage. Inpatient care in hospital, including critical access and long-term care hospitals. Then Part B covers doctor's services and outpatient care when medically necessary. Then Part C covers, it is also known as Medicare Advantage Plan, includes all of Part A plus Part B as well as extra benefits like Part D also sometimes. And next Part D is prescription drug coverage, available in standalone plans or as part of Medicare Advantage. Okay, so please note of this. Part A covers inpatient care, Part B covers outpatient care, Part C cover benefits of Part A plus B and sometimes Part D also, and Part D covers drug prescription. Understand? Any doubt?
Hello.
Okay. So now we'll see another type of insurer, government insurance, which is Medicaid. Okay, Medicaid. This is health. This is a health insurance assistance program for some low-income people, supported by federal and state governments. Okay, this Medicaid program is for low-income people. Medicare is for above 65-year-old or physically blind or disabled people, right? But Medicaid is for low income people, and this is sponsored by federal and state governments. It is administered on a state by state basis, but state programs must adhere to certain federal guidelines. Okay, state by state, their rules get changed. Okay, state funded insurance programs providing coverage for children up to 21 years of age may include children's medical services, children's indigent disability services, and children with special healthcare need and others. Okay, now we'll see difference between Medicare and Medicaid. Please make a note of it because this is most important part in medical coding. You surely get a question on this point. So, Medicare and Medicaid. Governance, Federal Health Insurance Program. Medicare is Federal Health Insurance Program strictly governed by federal government. Okay, whereas Medicaid is joint federal and state program but governed by state governments. Okay, eligibility criteria for Medicare 65-year or older, or the older than 65 years. Okay, under 65 with certain disabilities, blindness or any other disabilities. Okay, if below 65-year old, then any age and who have end stage renal disease or any other diseases, life threatening diseases. Okay, then Medicaid eligibility criteria is individual and families with limited income and resources are covered under Medicaid. Then coverage includes for Medicare inpatient care, skilled nursing facility, these are covered under Part A. Then outpatient and some preventive care covered under Part B, and prescription drugs covered under Part D. Okay, and Part C include all of these three. Okay, whereas coverage include for Medicaid is inpatient care, skilled nursing facility, outpatient care in federally qualified health centers and rural health clinics. Okay, then costs for Medicare cost depend on the coverage. Means which part you are choosing for your coverage, it depends on that, how much it will cost for you. Then Medicaid cost depends on the individual's income and the rules, policies and procedures in the given state. Each state has their own Medicaid rules. Okay, so this is difference between Medicare and Medicaid. The major difference is, at least you have to remind that Medicare is for 65-year or older than that people, or if under 65-year age, then with certain disabilities or life threatening diseases like ESRD. Okay, and Medicaid is for low income family. That's the difference between Medicare and Medicaid. Now we'll see what is RBRVS. Okay, this is Medicare payment for physician services are standardized using a resource-based relative value scale. Resource-based relative value scale, which is nothing but RBRVS. This scale is used for determining the payment for Medicare. Okay, Medicare physicians. Okay, the resource costs are divided into three components: physician work, practice expenses, and professional liability insurance. Okay, you might have thinking, what is the importance of learning all these terms? But if you are going for in daily medical coding, you may not need to use this all of this. But if you want to go for medical coding interview, or most important, if you want to go for medical coding certification exams, then you're going to get at least 5 marks question on this topic, on this chapter, which is business of medicine. Okay, and these questions are straightforward question. You will get answered directly on in your book if you know it properly. Okay, so that's the reason why this is the important chapter. Okay, so RBRVS are depend on physician's work, practice expense, and resource based professional liability insurance, also known as PLI. Physician work is measured by the time it takes to perform the service, the technical skill, and physical efforts, the required mental effort and judgment, and stress due to potential risk to the patient. Okay, means complicated surgery, if surgery is complicated, the value is more, right? Physician have need more technical skill. Physician has to do more physical efforts, mental efforts, judgment. Stress is also more. If it is threatened to that surgery will going to threaten to patient's life, like. Then second is practice expenses. Practice expense relative value are resource based and differ by site of service. For example, the expense of providing a service in hospital may be different than the expense of providing same service in a physician's office. Okay, if service is provided in a physician's office, the expense may differ than service provided in hospital. Correct? And then third one is the resource based professional liability insurance, PLI. This component accounts for 4% of total relative value of each service. Okay. You no need to by heart this all this term. You just have to remember the full form of RBRVS. Okay, other things you will going to get in the book. Then we'll see what is medical necessity. So the medical necessity refers to whether a procedure or service is considered appropriate in a given circumstances. Okay, medical necessity refers to whether a procedure or service is considered appropriate in a given circumstances or not. Okay. Generally, a medically necessary service or procedure is the least radical service or procedure that allows for effective treatment of the patient's complaint or condition. Okay, medical necessary services or procedure are important services which allows for effective treatment for patient's complaint. When a physician provides services to a Medicare beneficiary, he or she should bill only those services that meet the Medicare standard of reasonable and necessary for the diagnosis and treatment of a patient. Okay. There are two types of coverage determinations within Medicare, national and local. Okay, two types of medical coverage determinations which are national and local. First one is national coverage determinations, NCD, also known as NCD, national coverage determinations. These are applicable nationwide in the US to specify the Medicare coverage of certain services. All Medicare contractors have to follow the NCDs. Okay, means if a physician performs some procedure, okay, the diagnosis should be covered under that procedure. Okay, that is called medical necessity. That can be national or local. Okay, second one is local coverage determinations, also known as LCD, local coverage determination. These are made based on medical necessity and are released by Medicare contractors. LCDs are applicable only to the contractor's region, as these are local coverage determinations. Okay, these are applicable only to the contractor's region. Okay, in cases where an item or service is not covered by NCD, the local contractor has to take responsibility for the decision for its coverage. Okay, if any service or procedure or any item provided to the patient is not covered by NCD, national coverage determination, then local contractor, it's the responsibility of local contractor for the decision of its coverage. Okay, non-Medicare or you can say commercial payers may develop their own medical policies. Okay, the advance beneficiary notice, also known as ABN, advance beneficiary notice. An ABN is a written notice from Medicare given to you before receiving certain items or services, notifying you that Medicare may deny payment for that specific procedure or treatment. Okay, this is you can say written notice from Medicare given you before receiving any item or service, anything. Okay, to notify you that Medicare may deny payment for that specific procedure or treatment. Okay, the ABN lists the item or services that your doctor or healthcare provider expects Medicare will not pay for. Okay, along with an estimation of the cost for that item or services and the reason why Medicare may not pay. Okay. ABN lists the items or services that your doctor or healthcare provider expects Medicare will not pay for, along with estimate of cost. Okay, cost for items and services and reason why Medicare may deny your payment. Okay, this is called ABA, which is nothing but written notice from Medicare given you before receiving any item or services to notify you that Medicare may deny payment for that particular service or treatment. The need for privacy and security. HIPAA. Remember HIPAA? HIPAA means nothing but Health Insurance Portability and Accountability Act. Health Insurance Portability and Accountability Act. HIPAA. HIPAA protocols regulate the information and transmission of patient health records data. This system requires healthcare providers to implement data security measures so they fulfill the regulations from the government, prevent any kind of theft of any information stored on healthcare record and guarantee patients' privacy. Okay. HIPAA coding is one such regulation of the HIPAA system that is designed to instruct medical coders on how to follow fair and honest data usage when of coding and how to keep patients' health record safe and secure. Basically, this HIPAA coding is regarding keep the patient's healthcare information private. Okay, how you can keep patient's healthcare records safe and secure. Okay, HIPAA teach you or HIPAA educate you on that to keep the patient's health records safe and secure. You can't leak any patient's information any with any other company or any other person. Okay. Covered entities of HIPAA. Covered entities under HIPAA are individuals or institutions or organizations that transmit protected health information electronically in transactions for which the Department of Health and Human Services HHS has published standards. Okay. Covered entities of HIPAA means who are eligible to use the eligible or who are allowed to transmit the patient's health information data. The covered entities are providers, which include hospitals, clinic, nursing homes, doctors, or pharmacies. Okay, they can use patients' health information data and transmit them. Okay, in protected manner. Then health plans, HMOs, private company, government and veterinary insurance, etc. Then clearing houses, which processes and transform data for a healthcare organization. Okay, then associates, which perform functions for HIPAA entity that involves the use or disclosure of PHI, patient's health information. PHI means patient health information. Okay, then subcontractors, which receives, maintains or transmits PHI means patient's health information on the behalf of a business associate. Okay, like we as a medical coder, we also need to use patients private health information, right? So we are also covered under HIPAA. Then Just a minute. High-tech and its impact on HIPAA. Now we'll see what is high-tech. Okay. The Health Information Technology for Economic and Clinical Health Act, or also known as high-tech. High-tech means Health Information Technology for Economic and Clinical Health Act, was enacted as a part of American Recovery and Reinvestment Act of 2009, which is also known as ARRA, American Recovery and Reinvestment Act of 2009. Okay. The High-Tech Act was introduced in 2009 in United States to strengthen HIPAA privacy and access goals. Okay, to strengthen HIPAA privacy and access goal, High-Tech comes in picture. High-Tech Act was introduced in 2009. Okay, HIPAA introduced more than a decade ago in 1996. Okay, in 1996, HIPAA was introduced, where and that HIPAA regulations wasn't written with the explosion of internet and web applications in mind. Okay, at that time in 1996, internet explosion, different web applications are not in use, right? So that HIPAA written without keeping in mind that explosion of internet and web applications. Okay, so the High-Tech Act plugs the technology gap and take responsibility of securing patients' health information on healthcare organizations and related entities with access to patient health information. Okay, to fill the gap, technology gap, the High-Tech Act is introduced. Okay, High-Tech also mandate that organizations notify health plan members or or patients if their files get breached. If their file get breached, the High-Tech also mandate that organization must notify health plan members or patient. Okay. Now we'll see fraud. What is fraud? Fraud is when someone knowingly gives false information that allows someone to get a benefit that is not allowed. Okay, fraud means when someone knowingly gives false information that allows someone to get a benefit that is not allowed. Okay, examples of fraud like double billing. Okay, means submitting multiple claims for the same service is an example of fraud. Again, phantom billing, also meaning billing for a service visit or supplies the patient never received. Okay, which is also example of fraud. Then unbundling, submitting multiple bills for the same service. Remember, I told you about modifiers, right? At that time, I told you that as a medical coder or in the medical bill, we can't assign same CPT code more than once. Okay, and if we need to, we have no choice. We have to use only one CPT code twice or thrice. Okay, or more than one time. Then we have to append proper modifier. Otherwise, the claim will denied or get rejected. Okay, but some person who intention is to make a fraud, they submit multiple bills for the same service. Okay, and that is example of fraud. Then upcoding, billing for a more expensive service than the patient actually received. Okay. Then bogus marketing, convincing people to provide their insurance information number, health insurance identification number and other personal information to bill for non-rendered services, steal their identity and or enrollment them in fake benefit plans. Okay. Bogus marketing means convincing people to provide their health insurance identification number and other personal information to bill for non-render services or steal their identity. Okay, or enroll them in a fake benefit plan. Then next example is identity thief or identity swiping, means using another person's health insurance or allowing another person to use your insurance. Okay, that is also example of fraud. So the fraud is when someone knowingly gives false information that allows someone to get a benefit that is not allowed. This is called fraud. I will see abuse. Abuse is when someone knowingly take actions that result in unnecessary cost or service. Abuse is when someone knowingly take actions that result in unnecessary cost or services. Example of abuse is are incorrect use of medical codes. Okay, use of wrong medical code is example of abuse. If you assign more complicated code, obviously patient it will cost patient higher value. Okay, but that is not correct. That is called abuse. Okay. Charging excessively for services or supplies. Okay. Then billing the brand name instead of generic name of a drug to gain an unfair edge, because generics are 80% to 85% less expensive than the brand name. Okay. Then upcoding is when a provider assigns an inaccurate billing code to a medical procedure or treatment to increase reimbursement. Okay, sometimes what happen, the provider also code directly give you code. Okay, rather than giving whole description of the CPT, they also code the report. And as a medical coder, your job is to audit that report, audit those codes. Okay, and at that in that cases, some provider also assign inaccurate billing code to the medical procedure or treatment to increase reimbursement. That is example of abuse. Then last is unbundling in the coding services. Unbundling takes place when a provider files separate CPT codes for each treatment, despite the fact that a relevant integrated CPT code covering the entire procedure is usable. Means instead of using the combined CPT, okay, in procedure coding, in CPT coding, few procedure have combined code also. Okay, means if there is bilateral knee CPT, knee X-ray was done. Okay, but doctor is what can I say? Doctor or provider files separate CPT for them. Okay, separate CPT for knee, right knee, and separate CPT for left knee. That will cost more. Okay, rather than combined CPT. This is also example of abuse. So abuse is when someone knowingly take actions that result in unnecessary cost or services. Okay. If you are going for medical coding certification exam, you will going to means that exam include at least 5 mark question on this topic. Okay, this is business of medicine, and these questions are straightforward question. Okay, you will get their answer directly in your book. As these exams are open book exams, you will get their answer in book itself. Just you need to go through your ICD, CPT, all the books. Okay, so that at the time of exam you must have to know where you can find your answer. Okay, so don't worry if you didn't understand some part of it, it's okay. Okay, just try to uh, recollect the major, what can I say, full form of those short forms. Okay, like HIPAA, other, the difference between Medicare, Medicaid, and like this. Okay, now we'll see some acronyms. Here you can find all the full forms of the shortcuts. Okay, or you can say acronyms. ABN means Advanced Beneficiary Notice of Non-Coverage. You can get question like this also. ABN means what? What is the full form of ABN? And you get 4 options. You have to choose one option. Okay. So ABN is Advanced Beneficiary Notice of Non-Coverage. Then AMA is American Medical Association. APC means Ambulatory Payment Classifications. ARRA means American Recovery and Reinvestment Act of 2009. American Recovery and Reinvestment Act of 2009. You may get question like this: in which year ARRA Act is published? Okay. Then ASC. ASC is Ambulatory Surgical Centers. Then CF, Conversion Factor, is known as CF. CMS is Centers for Medicare and Medicaid Services. This is commonly used acronym. CMS, Centers for Medicare and Medicaid Services. Then CPC is Certified Professional Coder. CPT is Current Professional Terminology. Okay. Then DRG is nothing but Diagnosis Related Group. This is related to inpatient coding. Okay. Then EHR means Electronic Health Record. This is nothing but EHR. EM or ENM means Evaluation and Management. This is also one type of specialty. Okay, medical coding specialty. GPCA. GPCA means GPCI. GPCI means Geographic Practice Cost Index. HCPCS. HCPCS also known as HICPIC means Healthcare Common Procedure Coding System. Then HHS. HHS means Department of Health and Human Services. Then HIPAA. HIPAA means Health Insurance Portability and Accountability Act of 1996. Please remember this year also, 1996. Okay. Then HITECH. HITECH means Health Information Technology for Economic and Clinical Health. Okay. Then HMO means Health Maintenance Organization. Health Maintenance Organization. Then ICD-10-CM means International Classification of Diseases, 10th Clinical Modification. International Classification of Diseases, 10th Clinical Modification. ICD-10-PCS means International Classification of Diseases, 10th Revision, Procedure Coding System. Okay. PCS means Procedure Coding System. These code sets are used for only for inpatient procedure coding. Okay. Then LCD, local coverage determinations. Then MAC means Medicare Administrative Contractor. Then MP means malpractice. MSDRG means Medicare Severity Diagnosis Related Group. Again, MSDRG also related to inpatient coding. NCD means National Coverage Determinations. Okay. NP means Nurse Practitioner. OIG means Office of Inspector General. Office of Inspector General. And OCR means Office for Civil Rights. Office for Civil Rights. Then PA means Physician Assistant. PE means Physician Expense. Then PFS means Physician Fee Schedule. PHI means Protected Health Information. Protected Health Information. PLI means Professional Liability Insurance. RVU means Relative Value Unit. And RBRVS means Resource Based Relative Value Scale. So these are few acronyms you have to keep it in mind. Okay. And on this chapter you surely get 5 questions in your CPC examination. Okay. So this chapter is very important chapter. Okay. Then lastly, if you have any question, you can ask me. Anyone? No question? Then thank you for your attention.
No, ma'am.
Thank you for your attention and thank you for making this session interactive. If you want to register yourself for medical coding course with our organization, please go on to the given link below www.greatonlinetraining.com and register yourself. Bye bye. Take care. Welcome to Great Online Training. This is day 6 and today we're going to discuss about overview of ICD-10-CM and we'll divide this session in 2 parts. Today we'll cover part 1 and tomorrow we'll cover part 2. Okay. Myself Nikita, I am CBC certified medical coding trainer in Great Online Training and today we're going to discuss about overview of ICD-10-CM. Okay. You know that ICD-10-CM we use for coding diagnosis, diseases, or any condition, abnormal findings. These things will going to code using ICD-10-CM codes, right? And we use book to code ICD-10 is also known as ICD-10-CM book. Okay. Let's see. So today we're going to cover following topics. First, introduction, then guidelines of ICD-10-CM, then section 1 convention, which is first one is the alphabetic index and tabular index, then format and structure of ICD-10 codes, then use of codes for reporting purposes, then what is placeholder character, then seventh character, then abbreviations, different kinds of abbreviation, punctuation, how to use the word and, then other and unspecified codes, how we're going to use, and in which scenario we have to use other or unspecified codes, that we'll see. Then we'll see includes note, inclusion notes, exclude notes, then etiology manifestation conventions, then how to use with term, C and C also term, code also note, okay, default code, like this we'll see in this session. Okay, first of all, introduction. ICD-10 CM is nothing but International Classification of Disease 10th Clinical Modification. International Classification of Disease 10th Clinical Modification, also known as ICD-10 CM, is used as a source for diagnosis codes in United States of America. Okay, this code set reviewed every year. Okay, the code set for the 2024 fiscal year applies to patient discharges and encounters between October 1st October 2023 and September 30th 2024. Okay, after after October 1st 2024 will follow different guidelines, means updated guidelines. Few updations are there, will be there each every year. Okay, and then World Health Organization WHO authorized the publication of the International Classification of Diseases 10th revision, ICD-10 CM. Okay, the US develop a clinical modification for medical diagnosis based on WHO's ICD-10. CMS developed a new procedure coding system, ICD-10 PCS, for inpatient procedures. ICD-10 CM replaces ICD-9 CM Volume 1 and 2, and ICD-10 PCS replaces ICD-9 CM Volume 3. Okay. So, as I told you in previous sessions, earlier it was ICD-9, right? And those books are in volume 1 and 2 for ICD-9 CM codes. Okay, whereas volume 3 was for procedure coding, inpatient procedure coding. Now it is replaced with ICD-10 PCS, whereas volume 1 and 2 ICD-9 replaces with ICD-10 CM book. Okay, and WHO authorized the publication of ICD-10 CM codes. Okay, they update these codes every year in the October month. Center for Medicare and Medicaid Services, which is nothing but CMS, and the International Center for Health Statistics, NCHS, two departments within the US federal government's Department of Health and Human Services, DHHS, provide the following guidelines for coding and reporting using ICD-10 CM. Okay, the guidelines have been approved by the 4 authorizations: the American Hospital Association, AHA, the American Health Information Management Association, which is nothing but AHIMA, then CMS and NCHS. Okay, now we'll see what are those guidelines. Okay, you need to go through these guidelines again and again. You will find this guideline in book itself. Okay, but you have to by heart these guidelines, these basic general guidelines. Okay, because while coding you have to follow those guidelines, and each and every time you will not it is not possible for you to go through these guidelines and check, correct? Because medical coding is productivity based, so you have to manage your time to complete your work, whether it will be your job or it will be in your exams related to medical coding. You have to be quick to find the correct medical code. So that's the reason why you need to go through these guidelines again and again. And once you used to it, you will get by heart these guidelines. Okay. So there are 4 sections in this book. Section 1 includes 3 primary sets of guidelines, which includes conventions, general chapter specific guidelines. Then section 2 includes guidelines for principal diagnosis selection for non-outpatient setting. Non-outpatient means nothing but inpatient. Okay, there are 2 categories, inpatient and outpatient. So non-outpatient means inpatient settings. Okay, section 3 includes guidelines for reporting additional diagnosis in non-outpatient settings. Again, this session is also for inpatient. So section 2 and 3 are for inpatient coding. Okay, if you want to learn inpatient coding, or if you want to go for CCS exam, which are specifically for mostly for inpatient coding, in that time you will going to learn about section 2 and section 3. But as this is the general medical coding introduction, general medical coding guidelines, we're going to discuss about this session 1 and session 4 only. Okay, session 4 includes outpatient coding and reporting. Okay, so in this session we'll going to discuss about session 1 and session 4. Okay, so this is the table of content. I'll show you how ICD-10 CM book looks. Here, this is book by AAPC. Okay, ICD-10 CM expert diagnosis course for provider and facilities, 2023. This is 2023 edition. Okay, you can see here some introductory part. Then you can see the table of content. This is nothing but what is included in this book and on which page you are going to find it, that is mentioned. Okay, and these are guidelines. This will going to discuss today. This is table of content, which says guideline ICD-10 CM official guidelines for coding and reporting. Okay, then guideline tips, then different symbol convention, ICD-10 index, ICD-10 CM index to disease and injuries is on 39 page. Likewise, and then tabular list. We'll see what is alphabetic index, what is tabular index, and all. Okay. So today we're going to discuss about session 1, which consists conventions, general coding guidelines, and chapter specific guidelines. Okay. A part is conventions for ICD-10 CM. Today we can cover only A part, conventions for the ICD-10 CM. The conventions for ICD-10 CM are general rules for use of the classification independent of the guidelines. These conventions are incorporated within the alphabetic index and tabular list of the ICD-10 CM as instructional notes. Okay, so the first one is the alphabetic index and tabular index. What is alphabetic index and what is tabular index? Okay, the alphabetic index, as the name suggests, it is arranged alphabetically. Okay. Alphabetic index consists their corresponding ICD-10 codes also. It lists thousands of main terms alphabetically. Under each of those main terms, there is often a sublist of more detailed terms. For instance, cataract has sublist of 84 terms. Okay. Then the tabular list of ICD-10 codes plus their descriptors is organized alphanumerically from A00.0 to Z99.89. It is divided into chapter based on body parts or condition. Okay. Alphabetical index consists main term which are arranged alphabetically, and tabular list organized alphanumerically from A to Z codes, and it is divided into chapter based on body parts or condition. I'll show you how it looks. Just a minute, I have to go on page 87. Okay, so this is alphabetic index. See. Okay, ICD-10 CM index to diseases and injuries. You can see here what are the terms they included on this page. Okay, it starts with A terms. All the A terms you will going to find under this A. Okay, the vertical yellow line appears at the second and fourth indentations throughout the index. Okay, you can see here this yellow lines, standing lines, right? It means if you can say, we'll see one example, aberrant. So under the aberrant term or condition, aberrant for adrenal gland, you can get this code Q89.1. Then here you get your one code, okay, Q89.01. Then you have to search for this code in tabular list. Likewise, you have to go for your selection of code, ICD-10 codes. Okay. If it is specified that aberrant artery and suppose cerebral artery, then you have to choose Q28.3. But you can't choose directly your code from here. Okay, because it may be incomplete code. You will going to find more instructions about this code, about these codes you will found in alphabetic index in tabular list. Okay, so always choose start choosing your code from alphabetic index, but go and verify that code into tabular index. Now we'll see how tabular index looks. Here it is on 692 number page. This is how tabular index look like. Tabular list, you can see this list is for disease of eye and adnexa. Code ranges from H00 to H59. Okay, you can see here different symbols are there. Each symbol consists different color. Each word consists different color. Okay, there are, you can see more and more colors here, right? Okay, so this is how your tabular index look like. Okay, so after choosing your code into this alphabetic index, you have to go on that code, that particular code. If you want to go on this suppose D61.818, okay, you have to go and verify that code into the tabular index. Okay, we'll see more guidelines regarding this. So this is how alphabetic and tabular index look like. The alphabetic index consists of the following parts: index of diseases and injury, which I showed you right now, then index of external causes of injury, then the table of neoplasm, and then table of drugs and chemicals. Okay, now we'll see format and structure of ICD-10 CM course. The ICD-10 CM tabular list contains categories, subcategories, and codes. Okay, characters for categories, subcategories, and codes may be either a letter or a number. All categories are 3 characters. Categories are of 3 characters. The 3-character category that has no further subdivision is equivalent to a code. For example, B20. B20 is complete code because it is not further divided. Okay, subcategories are either 4 or 5 characters. Codes may be 3, 4, 5, 6, or 7 characters. That is, each level of subdivision after a category is a subcategory. Okay, here is the one example. This is category and this is subcategory. Okay, the first character is always representing the chapter. Okay, here in this example the first character is S. So S is representative of injuries, poisoning, certain other external causes related to single body organ. Okay, S alphabet is representative of these terms or this chapter. Okay, then second level is 86 code. So now S86 is representative of injury of muscle, fascia, and tendon at lower leg. Okay, then we have point. After this point we have subcategory. Okay, few codes consist only category, like B20, that is complete code. B20 is complete code, so which only consists 3 characters. But here this is injury code. Okay, this is example of strain code, which consists 7 characters. Okay, the characters after this point are called subcategory. Okay, first character 0 is for sight, then this one is for severity, then next one is for details. Okay, and last character is for extension. Okay, here the 0 represents strain of Achilles tendon. Okay, site, Achilles tendon is site, and this one represents strain, severity, strain. Okay, then now if you see S86.011, which represents strain of right Achilles tendons. This is detail. Okay, our in this code, this code is specific for right side. Okay, right side Achilles tendon. This one is representative of right side. Okay, then D is for subsequent encounter. Okay, so this full code representative of strain of right-sided Achilles tendon subsequent encounter. Okay, this is the structure of ICD-10 CM code. Use of codes for reporting purposes. For reporting purposes, only codes are permissible, not categories or subcategories, and any applicable 7 character is required. Okay, now we'll see what is placeholder. The ICD-10 CM utilizes a placeholder character X. Okay, X is used for placeholder character. Okay, the X is used as a placeholder at certain codes to allow for further expansion. An example of this is at the poisoning, adverse effect, and underdosing codes categories from T36 to T50. Okay, where a placeholder exists, the X must be used in order for the code to be considered a valid code. Okay, if some code is completed after 7 characters only, and you have not specific character or specific information for 6th or 5th character, but you have to assign 7 character. Okay, in at that time you have to use X as a placeholder. CMS guidelines states that diagnosis codes are to be used and reported at their highest number of characters available, and that 3-character codes should only be used if it is not further subdivided, like B20. Okay, B20 code is not further subdivided. That's the reason why that is complete code. We can use that code B20 directly, because there is no further division of that code. But codes mostly from category T36 to T50, or you can say codes from injury chapter, which consists of fractures and all that, those codes require 7 characters. Okay, for subsequent encounter, for initial encounter, we need to assign particular that alphabetic character. Okay, we'll see that in further slides. Okay, so a code will be considered invalid if it has not been coded to the full number of characters required, including a 7th character if applicable. Okay, we'll see one example. If the diagnosis is unspecified open angle glaucoma severe stage, submit H4010X3, while some glaucoma codes require you to indicate laterality using the 6th character. That's not the case in H40.10. You can see here in this example, they said unspecified open angle glaucoma severe stage. Okay, we'll see this example. H40.10X3. We'll see this. We'll go by glaucoma. Just a minute. Okay, we have to go on this glaucoma, and here you can see different codes. Okay, see here. Here is example. You can see here unspecified open angle glaucoma and severe stage. Okay, this consists this X character, which is used for placeholder, used as a placeholder. Okay, because we have no specific eye here. This code is for unspecified eye. When our provider not specify which eye is affected, that in that case we have to use this code. Okay, the 6th character is for eye, You can see here, this code is for right eye. Okay, here is 1 for right eye, here is 2 for left eye, 3 for bilateral. Okay, but here this is for unspecified eye, because we don't know which eye is affected, but we have to specify the stage. We know which stage is there, so we need 3, we need to assign 3, but we don't know which eye is affected. That's the reason why X is used here. Okay, because we need to add 3 here. So this is the complete code. Understand? Sorry. Now we'll see 7th character. Just I told you, certain ICD-10 CM categories have applicable 7th character. The applicable 7th character is required for all codes within the category or as the notes in the tabular list instruct. The 7th character must always be a 7th character in the data field. Means it's at the 7th number of in that particular code. Okay. If a code that requires 7 character is not 6 characters, okay, like just we saw in one example, glaucoma example, there we didn't have any specification about which eye is affected, so we use X as a placeholder in 6 position, so that we'll use 7 character for stage, right? If a code that requires 7 character is not 6 characters, a placeholder X must be used to fill the empty characters. Okay. For example, O64.3 XX1, which is for obstructed labor due to bro presentation fetus 1. Okay. Then S02.110B type 1 means in this example we don't have any specific information about these 2 characters. Okay, 5th and 6th character. That's the reason why XX is used here as a placeholder to assign the 7th character. Okay, here in this example S02.110B, this is full code, complete code. Okay, and 7th character is B, which is for open fracture. Okay, type 2 occipital condyle fracture, initial encounter for open fracture. Okay, then T17.220D, here D is representative of subsequent encounter. Okay, likewise you have to use 7 character. If that code is not 6 character code, means you have, if when you didn't have specific information to assign 6 character or 5th character, you will going to use X in that place. Okay, because if you if in this code you will not if you want to assign this 1, because without this 1 this code is not completed, this is invalid code. Okay, if you want to use this 1, you have to assign XX 2 times here. If further specific information about 5th and 6th character is not there in that time. Okay, these are the characters used in case of fracture coding. Okay, 7 character. A is for initial encounter, close fracture. If close fractures in initial encounter is there, we'll use A. We'll use B for initial encounter open fracture. We'll use D for subsequent encounter or fracture routine healing. Means if patient come after doing just to check healing process of that fracture, or to change that plaster of the fracture, in that case we use D character in 7th position. Okay, then G is for subsequent encounter, fracture delayed healing. Okay, K is for fracture non-union, P is for fracture malunion, and S is for sequela. Okay, when 7 character is applicable and no 5th and 6th character is applicable, placeholder X must be assigned. Okay, because these fracture codes are fracture codes should be 7 characters only. They require this 7 character. But if you don't have any particular information about 5th and 6th character, at that time you have to use X as a placeholder. Okay, now we'll see abbreviations. NEC. NEC is nothing but not elsewhere classified. Okay, not elsewhere classified. Please, if you want to go for any medical coding interview or test, please go through these guidelines again and again, because interviewer will going to ask you question on these terms. These are most important terms regarding your exam also, and regarding with your interview also. Okay, these questions are asking frequently. NEC is nothing but non-elsewhere classified. This abbreviation in the alphabetic index represent other specified. Now, what is other specified and all? We're going to discuss in further session. So the abbreviation NEC means not elsewhere classified is nothing but other specified. Okay, when a specific code is not available for a condition, the alphabetic index directs the coder to a other specified code in the tabular list. Okay, if there is no specific code is there for any particular condition, in that case the alphabetical index guide you to, or directs you to other specified code. Okay, sometimes it is indicated as NEC. Okay, for example, alphabetic index cataract. Okay, tabular index specified NEC H26 which is code for other specified cataract. I'll show one more example here. If you go for mass, okay, now I want to search code for retroperitoneal mass. Retroperitoneal comes under abdomen, but here under the abdomen there is no code for retroperitoneal, right? In this case I have to go on this specified site. Okay, if I go here, it says other intra-abdominal and pelvic swelling, mass or and lump. Okay, and here is the synonyms: retroperitoneal mass. Okay, likewise you have to choose. So the NEC is used for other specified code, whereas the next one is NOS. NOS is nothing but not otherwise specified. This abbreviation is the equivalent of unspecified. Okay, NEC for other specified, whereas NOS not otherwise specified is for unspecified. NOS is more commonly used and means the provider did not give you a specifics. Okay, This is one example. Tabular list I50.9. Heart failure, which is code for heart failure unspecified. Okay. Biventricular heart failure NOS. Cardiac heart or myocardial failure NOS. Congestive heart disease, congestive heart failure NOS. Okay. Means these codes are unspecified code. You can use this code I50.9 for these following terms, because this is unspecified code. Okay. When your provider not specifies which type of heart failure is there, in that case you have to use this code. We'll see one example again. Again, this mass only. When we search for mass, if your provider only says mass, okay, abdominal mass, in that case you have to go on this code. You can see here, intra-abdominal and pelvis swelling, mass and lump, unspecified site. Okay, this is code for unspecified abdominal mass. If your provider only says mass or abdominal mass, in that case you have to use this unspecified code, because your provider not specified any site of that mass. Okay, previously we saw that is for other specified, because we search code for our provider said that it is the retroperitoneal mass. Okay, means he give us some specific site, but there is no particular code for that site. That's the reason why we use other specified code. But here our provider not stated or not specifies any site, particular site in the abdomen. That's the reason why we choose this unspecified code for abdominal mass. Okay. And in case of NOS, we have to use unspecified. In case of NEC, we have to use other specified. NEC not elsewhere classified is equivalent to other specified, whereas NOS, which is not otherwise specified, is equivalent to unspecified. Clear? Now we'll see punctuations. Brackets. These are used in tabular list to enclose synonyms, alternative wording, or explanatory phrases. Brackets are used in alphabetic index to identify manifestation codes. Okay. For example, B06, rubella. Also, the synonym for rubella is German measles. Is synonym for rubella. That's the reason why they enclose that term into bracket. Whereas J00, which is for acute nasopharyngitis, also known as common cold. Okay, so the synonyms are enclosed in the brackets. Then parentheses. These are used in both the alphabetic index and tabular list to enclose supplementary word that may be present or absent in the statement of a disease or procedure without affecting the code number to which it is assigned. This is the example. Alphabetic index example is diabetes or a diabetic, which contains mellitus, sugar words. Okay. Hemophilia, which contains classical, means that code is applicable for classical hemophilia also, familial hemophilia also, hereditary hemophilia also. Okay, the same code is applied for all these three terms. If it is in tabular list, this is the example of tabular list, parenthesis. I10 code is for essential, also known as primary hypertension. Then K51.011, which is code used for ulcerative, whether it is chronic, we'll use same code, chronic ulcerative code. Okay. Then we have colons. These are used in tabular list after a incomplete term which needs one or more of the modifiers following the colon to make it assignable to a given category. It is used with both includes and exclude notes. See here one example, G73.7, myopathy in diseases classified elsewhere. Includes, you can see here this colon. Okay, myopathy in, again colon. These characters are same in overall the ICD-10 book. Now we'll see and. The word and should be interpreted to mean either and or when it appears in a title. For example, cases of tuberculosis of bones, tuberculosis of joint, and tuberculosis of bones and joints are classified to subcategory A 18.0. Tuberculosis A 18.0 is for tuberculosis of bones and joint, whereas A 18.03 is for tuberculosis of other bones. Okay, and word means either and or. Then we have other and unspecified codes. Other or other specified codes. When a specific code is not available for a condition, the alphabetic index directs the coder to other specified code in the tabular list. Just we saw an example of retroperitoneal mass. Okay. In that case, we use other specified code because there is no specific code for retroperitoneal mass, but we have specific location. That's the reason why we use other specified code in case of retroperitoneal mass. And the second category is unspecified code. Code title unspecified are used when information in the medical record is insufficient to assign a more specific code. For this we saw abdominal mass example, right, where we have no specification about any specific site in the abdomen. Right, we'll see one. This is a flow chart. Does the provider documentation provide specific detail for condition? If answer is no, report the unspecified code, like in abdominal mass. Okay, where we assign only unspecified code. If answer is yes, if our provider specified detail about the condition, like the retroperitoneal mass, our answer is yes. Is there specific code for the specified condition? No, we didn't find a specific code for retroperitoneal, right? Right. That's the reason why we use other specified code. Okay. And if the answer is yes, then report that specific code. We'll see one more example. There are multiple codes for hypothyroidism. If the cause of patient's hypothyroidism is known but is not one of the existing codes, then code E03.8 would be used, which is for other specified. If the type of patient's hypothyroidism is known, code E03.9 would be used. We'll see this hypothyroidism. We have to go on this index. hypothyroidism. And mostly the code you will find next to this main term are unspecified code or default code. Okay, hypothyroidism. If our provider specified that it is neonatal, then we'll choose this code. The post-infectious, then we'll choose this code. Okay, if our provider specifies some condition and we're not going to find a particular code for that or that particular term in this index, in that case we have to choose this specified. You can see here specified NEC, which is for other specified hypothyroidism. Okay, and this is for hypothyroidism unspecified. Okay, NOS. Understand? Now we'll see includes notes. This note appears immediately under a 3-character code title to further define or give examples of the content of the category. Example A02, which is for other salmonella infections, which you will find include note under this code A02, which says infection or foodborne intoxication due to any salmonella species other than S. typhi, Salmonella typhi or Salmonella paratyphi. Okay. Second example is case 25, which is for gastric ulcer, which include erosion acute of stomach, acute erosion of stomach, pylorus ulcer, peptic pylorus ulcer, or peptic stomach ulcer. So these terms are also included in the same code, okay, or some same category. Then inclusion notes. The inclusion notes list of the term is included under some codes. These terms are the conditions for which that code is to be used. The term may be synonymous of code title or in case of the other specified codes. The terms are list of the various conditions assigned to that code. The inclusion terms are not necessarily exhaustive. Additional terms found only in the alphabetic index may also be assigned to a code. Okay. Then we have excludes node. ICD-10 has two types of exclude nodes, exclude 1 and exclude 2. Okay. We'll first see exclude 1. You can see symbol like this, exclude 1. Okay. A type 1 excludes node. A type 1 exclude node is a pure exclude node. It means not coded here. Okay. And exclude 1 node indicates that the code excluded should never be used at the same time as the code above the exclude node. Okay, and exclude 1 is used when two conditions cannot occur together, such as congenital form versus an acquired form of same condition. Okay, you can't use congenital form of this congenital and acquired form of same condition at the same time. Okay, means and on the same patient, same day, same encounter, you are not permissible to use both the code on the same record. Okay, same date of service for same patient, because both codes are excluded each other. Okay, you will going to find exclude 1 node under that code. So exclude 1 is not coded here. The example is E11, type 2 diabetes mellitus. It says exclude 1, gestational diabetes. Okay, we're not going to use this O24.4 code with E11 because this code already says gestational diabetes. Okay, you can't use both the code at the same time on the same patient's record. Or it also exclude post-procedural diabetes mellitus, E13, type 1 diabetes mellitus, because this is type 2. One patient can be present at the same time with two type of condition, like two type of diabetes mellitus, type 1 and type 2. That's the reason why they exclude type 1 from type 2. Okay, so exclude one nodes, which pure exclude node means that the main code and exclude one code will not going to assign at the same time. Then we have a type 2 exclude node, type 2 or exclude 2. Exclude 2 node represents not included here. Exclude word is not coded here, whereas exclude 2 is not included here. An exclude 2 node indicates that the condition excluded is not part of the condition represented by the code, but a patient may have both conditions at the same time. Exclude 1 is purely different from exclude 2. Okay, exclude 1 not coded here, whereas exclude 2 not included here. Okay, opposite to each other. When an exclude 2 node appears under a code, it is acceptable to use both the code and the excluded code together. Okay, when appropriate. You can see an example J37.1, which is for chronic laryngotracheitis. Okay, it says exclude 2 node contains acute laryngotracheitis. Code is J04.2 and acute tracheitis J04.1. The patient has both the condition chronic and acute, we can code both the condition at the same time because it comes under exclude 2 node. Okay, so exclude 2 means not included here, whereas exclude 1 means not coded here. Please keep it in mind, at least this basic difference between exclude 1 and 2. Okay, here is one example. D23, other benign neoplasm of skin. You can see here include node also. These terms are included in this code, in the same code. Means this is the same category code you will going to use if there is a term benign neoplasm of hair follicle, benign neoplasm of sebaceous gland, benign neoplasm of sweat gland, or for all these terms we are going to use the same category D23 because it says includes. Okay, next we have exclude 1. Exclude says benign lipomatous neoplasm of skin. Okay, if you have benign lipomatous neoplasm of skin, you have to choose from this category. Okay, and you can code D23 category code and D17.02, D17.3 category at the same time on same patient, same date of service. Okay, we have exclude 2 melanocytic navy. This code says D22 point further, which you can use at the same time. Okay, so D23 category and D22 category you can use at the same time, same date of service. Okay, because it says exclude 2. Exclude 1 is not coded here, whereas exclude to is included here. No, sorry, not included here, means you can code both the main code also and that exclude to code also at the same time. Okay. Then next one is etiology manifestation. Just a minute. Etiology manifestation conventions: code first, use additional code, and indices classified elsewhere nodes. Okay, certain conditions have both an underlying etiology and multiple body system manifestations due to the underlying etiology. For such conditions, the ICD-10-CM has a coding convention that requires the underlying condition be sequenced first, if applicable, followed by the manifestation. Okay. Wherever such a combination exists, there is a use additional code node at the etiology code and a code first node at the manifestation code. Okay, these instructional note indicate the proper sequencing order of the course. Etiology followed by manifestation. Okay, first we have to assign code for etiology, then we have to code for manifestation. Okay, so these use additional code or code first indicate proper sequencing order of that code. If there is code first node is there, that particular code you have to, you can say here one example, E66, overweight and obesity. You can see two type of nodes here. Code first, obesity complicating pregnancy, childbirth and puerperium if applicable. We have to choose O99.21 as a primary code. Okay, then we're going to code this E66 because it says code first. Okay, and the second note is use additional code. It says to identify the body mass index if known. Okay, if you have a specific body mass index, in case of this overweight and obesity, you have to code Z68 code, category code as additionally. Okay, so this is the example of code first and use additional. Code first says you have to code that particular code at the starting or first listed code, and use additional means you have to additionally add that code. Now we'll see with. The word with or in should be interpreted to mean associated with or due to, where it appears in a code title, the alphabetic index, or an instructional note in the tabular list. The classification presumes a causal relationship between the two conditions linked by those terms in the alphabetic index or tabular index. Okay, next we have C and C also. A C note directs you to a more specific term under which a correct code or more specific code may be found. Example, leaky heart. If you go and search for leaky heart, it says C endocarditis. Okay, then we also have C also note, which instruction indicates additional information is available that may provide an additional diagnostic code. Okay, for example, disease. If you go on disease in the alphabetic index, it says C also syndrome. Okay, you see this example. You can see here a prism. It says C poisoning food. Okay, also it says, you can see here, abscess. Okay, it says with diverticular disease, with bleeding, means with or due to. Okay, abscess with or due to diverticulosis disease, with bleeding, like this C also terms we'll have to use. Next we have code also note. A code also note instructs that two codes may be required to fully describe a condition, but this note does not provide sequencing direction. The sequencing depends on circumstances of the encounter. Okay, for example, E20810 autosomal dominant hypocalcemia. Okay, code also note is there. If applicable, any associated conditions such as calculus of kidney, code is also there, N20.0, chronic kidney disease, N18, respiratory distress, J80, seizure disorder, J40, R56.9. Okay, if you see this code, you will going to find code also note under that particular code. That means if patient also has this following condition, you have to code that conditions also. And the sequencing is depend on reason for encounter. If patient come for calculus of kidney and it also has autosomal dominant hypocalcemia, in that case you have to choose N20 as a primary code and then E20 as a secondary. Okay, if patient comes with autosomal dominant hypocalcemia, that is the main reason, and plus patient also has respiratory distress, in that case you will choose E20 as a primary and J80 as a secondary. Clear? Then we have default codes. A code listed next to a main term in the ICD-10-CM alphabetic index is referred to as a default code. Okay, a default code represents that condition that is most commonly associated with the term or is the unspecified code for the condition. Okay, if the condition is documented in a medical record without any additional information such as acute or chronic, the default code should be used. Okay, for example, appendicitis. It says appendicitis pneumococcal. If that appendicitis is pneumococcal appendicitis, you have to choose K37. If it is retrocecal appendicitis, you have to choose K37 category. Okay, if it is not documented as acute or chronic, because appendicitis can be acute or can be chronic, but if your provider not specified that this condition is acute or chronic, in that case you have to choose this by default code. Here in this case it is K37. Okay, instead of the specific acute or chronic code being reported, the default code would be used, right? Next we have code assignment and clinical criteria. The assignment of a diagnosis code is based on the provider's diagnostic statement that the condition exists. Okay, the provider's statement that the patient has a particular condition is sufficient. The code assignment is not based on clinical criteria used by the provider to establish the diagnosis. If there is conflicting medical record documentation, query the provider. Means to assign the code, you have provider's diagnostic statement that the particular condition is exist. That is enough to assign the code. Okay, if you have any conflicting medical record documentation, query the provider. Okay, lastly we have some symbols. Okay, this N is for newborn, P is for pediatric. Okay, if these symbols are behind any code, it says that particular code is for newborn. If N is there, if P symbol is there, those code is for pediatrics only. If M is there, then those code is for maternity. A is for adult. This is for male sign. Means few codes are only for male. Few codes are only for female. Okay. This sign is for new code. This is for new text. Then revise code title, revise text. This sign is for exclude 1, which is for not coded here. Exclude 2 is for not included here. Then 4th, 5th, 6th, 7th means it says character required. Okay, if it says 4th only, then it means that particular code require 4 character. Okay, if it says 7th symbol like this is present or behind any code, that means that code requires 7th character. Okay, then 7 means extension X alert is there. HSC symbol is there, which is for hospital acquired condition. I'll show you this. You can find this here. The symbols are at each and every page at the end of the each and every page of tabular list. This is tabular list. Here you can get the number range of the codes, and here you can find these symbols. Okay, you can see here. This is not much clear. This exclude 1, exclude 2, this 5th character is there, right? Here you can see this. Use additional code to identify non-magnetic foreign body. Okay, this is for unspecified. Okay, like this you can find your code in the tabular list, and these are the different symbols. You will get this symbol, you came across this symbol behind each and every ICD code. Okay, so this is all about general conventions and coding guidelines of ICD 10CA. Thank you for your attention. Thank you for attending this session. Okay. If you find this session interesting and want to join our medical coding program or medical coding training program, please go on this link www.greatonlinetraining.com and register yourself. Okay. Bye bye. Take care. Welcome to Great Online Training. Myself Nikita. I'm CPC certified medical coding trainer in Great Online Training. This is day 7, and current sessions we are discussing about overview of ICD 10CM. Okay, we are discussing about different coding guidelines regarding ICD 10CM. Right? In previous session we discussed about session 1, which is for conventions, general coding guidelines, and chapter specific guideline. And in previous session we discussed about first part of it, which is conventions. Okay, and this is today we'll discuss about part 2, which include B part of it, session 1's B part, which is general coding guidelines. Okay, if you find these sessions interesting, if you want to learn more about medical coding, please go to the given link below www.greatonlinetraining.com and register yourself. Okay, we'll see what are the topics we're going to cover in this class. We'll see general coding guidelines. This is the session B of part B of session 1 ICD 10 coding guidelines. Okay, In previous session, we discussed about part A, which is for conventions. Okay, in the previous session, we discussed about different kind of symbols, different kind of notes, terms present in the ICD 10 CM book, right? And today we'll see general coding guidelines. So in this session, we discuss about locating a code in ICD 10 CM. How can we locate the code in ICD 10 CM? Level of detail in coding, then code or codes from A00.0 through T88.9 and Z00 and U00 and so on. Okay, then we'll see sign and symptoms. If sign and symptoms are there, how we're going to code about it, code them. Okay, then conditions that are an integral part of a disease process. Okay, then we'll see how we code conditions that are not an integral part of disease process. Multiple coding for single condition, that we'll see. Acute and chronic condition, how we're going to code. How will assign combination code, sequela codes, also known as late effect codes. Again, we'll see impending or threatened condition diagnosis. Okay, reporting same diagnosis code more than once. Okay, then documentation by clinicians other than the patient's provider. Then syndromes, laterality, documentation of complications of care, borderline diagnosis, how to use signs, symptoms, unspecified code, that we're going to see. And lastly, we'll see coding for healthcare encounters in hurricane aftermath. And the last, we see how to find a correct code in 5 simple steps. Okay, so we start with today we're going to discuss about B part of session 1, which is B part is for general coding guidelines. Okay, you might might have thinking, if these guidelines are there in ICD coding book, then why we need to learn about this? Okay, we can go through this guideline whenever we need to use them. You might have thinking like that, right? Because medical coding exams are also open book exam, and even while doing daily medical coding, if you are medical coder, in that time also you go through your what that I can say, go through your books and read those guidelines, right? But if you want to be a successful medical coder or go for coding exams, you must be aware about all these guidelines, about all the symbols, no terms present in the book. Then and then only you can choose correct code easily and quickly, because coding jobs are productivity based. You need to complete your daily target, plus you need to complete your you need to maintain your 95 to 98% accuracy also. Okay, even if you go for medical coding exam, it consists lots of questions, around 150 questions you need to complete in 4 hours. I'm talking about CPC exam. Okay, so though these exams are open book, you need to by heart these guidelines, because you have to manage your time during these exams. Okay, if you waste your time reading these guidelines during exams, you will be not able to complete your paper, or while doing your daily coding job, you are not able to complete your daily productivity target, or it may be possible that you choose wrong code, which will hamper your accuracy. Okay, that's the reason why you need to go through these guidelines again and again. For few times, if you read these guidelines, you will go by heart these guidelines. Okay, don't worry about it. These are easy guidelines. Okay, we'll see what are the different guidelines. First one is locating a code in ICD 10 CM. how you will going to locate the ICD-10 CM code in the book. To select a code that corresponds to a diagnosis, first locate the term in the alphabetic index and then verify the code in the tabular index. Right? Remember we saw how to search for code. I show you how the ICD-10 CM book looks like. Okay, how alphabetic index look like, and then how the tabular list is looking like. I'll show you again here. This is the alphabetic index. You can see here. It start like 8 terms. Okay. Here also you can see at the side of the page. You can see the different terms. Okay, so you can go through and easily find those terms. Then this is tabular index. Give me a minute. It takes some time to go on the particular page. Okay, so this is how tabular list look like. Okay, it shows different colors, yellow color highlighted terms, mostly unspecified codes highlighted with yellow color. Okay, different kind of symbols are there. Means detailed guidelines, you get detailed instructions in the tabular index only. Okay, not in the alphabetic index. Let me see. It is essential to use both the alphabetic index and tabular list when locating and assigning it a code. Okay, the alphabetic index does not always provide the full code. Selection of the full code, including laterality and any applicable seventh character, can only be done in the tabular list. Okay, a dash at the end of the alphabetic index entry indicates that additional characters are required. Okay. Remember the structure of the course in ICD-10. These codes are of 7 characters. Okay, maybe few codes are of 3 characters. Minimum 3 characters are there. This is 3 characters are called category, whereas other 4th, 5th, 6th, 7th are called subcategory codes. Okay, few characters of 3 only consist 3 characters. Okay, first character represents chapter, and it is alphabet starts with alphabet always. Okay, and next two are next one is means second one is numeric, whereas third, fourth, fifth, sixth, seventh alphabet or numeric, anything. Okay, but mostly few codes are 3 digit, whereas other codes are maybe 4, 5, 6 or 7 digit. Okay, 4 digit represents etiology, fifth represents anatomical side, sixth represents severity, and seventh is for extension. Okay, now we'll see level of details in coding. Diagnosis code are to be used and reported at their highest number of characters available and to the highest level of specificity documented in the medical record. Okay, if your provider give you specifications, you need to use all those specification if possible to code that diagnosis. Okay, if code is available for that specification, you need to use that. Code with 3 characters are included in ICD-10 CM as the heading of the category of codes that may be further subdivided by the use of 4th and or 5th character and or 6th character which provide greater detail. As I told you, few codes consist only 3 characters, few consist 4, 5, 6 or 7 characters. Okay, which provide greater detail. ICD-10 CM diagnosis codes are composed of codes with 3, 4, 5, 6 or 7 characters. Code or codes from A00.0 through T99, T88.9, Z00 to Z99.8 and U00 to U85. The appropriate code or codes from A00.0 through U85 must be used to identify diagnosis, symptoms, conditions, problem, complaints, or other reasons for the encounter or visit. Okay. Now we see how to code sign and symptoms. Codes that describe symptoms and signs as opposed to diagnosis are acceptable for reporting purposes when a related definitive diagnosis has not been established by the provider, not been established or confirmed by the provider. If your provider not confirm the why those sign and symptoms or that condition is occurred, okay, if your provider not confirm any disease at the time of that encounter in the medical record, then you have to choose code for those reason for exam which consist sign and symptoms. Okay, you have to code only that sign and symptoms. Fifth one is conditions that are an integral part of a disease process. Sign and symptoms that are associated routinely with a disease process should not be assigned as additional codes unless otherwise instructed by the classification. Okay, for example, patient with gastroenteritis with nausea and vomiting, code only gastroenteritis, because nausea and vomiting are the sign and symptoms of gastroenteritis only. Those nausea and vomiting symptoms produced because of that gastroenteritis only. That's the reason why you need to code only gastroenteritis in this case. Okay, this is the flow chart how you have to go for sign and symptoms or you have to go for the particular disease. Here patient is seen for a symptom, for example chest pain. Okay, then you have to see, does the provider document a definitive diagnosis? If the answer is no, then report the sign and symptom as the diagnosis. Conditions stated as possible, suspected, questionable, rule out, or working diagnosis are not reported as definitive diagnosis. Okay, we are discussing these guidelines about outpatient coding only. Okay, we are not discussing guidelines for inpatient coding. Inpatient guidelines are different than outpatient coding guidelines. These are general coding guidelines. General coding guidelines means these guidelines are for outpatients. Okay, if you want to go for inpatient coding, if you want to go for inpatient coding certification, guidelines are slightly different. They follow different guidelines. Okay, so remember that these guidelines are general guidelines and mostly used for outpatient coding. So here conditions stated as probable, suspected, questionable, rule out, or working diagnosis are not reported as definitive diagnosis. Okay, in that case you need to choose the reason for encounter, which is if there are sign and symptoms, you need to code to sign and symptoms only. Now, if provider document definitive diagnosis, answer is yes. It's the symptoms are integral part of that definitive diagnosis that you need to look for. Okay, If the answer is no, then report the definitive diagnosis and the symptoms. Okay. If answer is yes, means those sign and symptoms are integral part of that diagnosis, that definitive diagnosis only. In that case, you need to code that definitive diagnosis only, like in this example. Okay. If a patient comes with another example, like if patient comes with infection, mostly we the fever is the symptom of any infection, right? So if patient come with fever and doctor gives definitive diagnosis as infection, okay, viral infection. In that case, you will code only that viral infection. Okay, you will not code fever. Conditions that are not an integral part of a disease process. Additional signs and symptoms that may not be associated routinely with a disease process should be coded when present. Example, patient with irritable bowel syndrome with diarrhea, nausea and vomiting. Okay, the patient comes with irritable bowel syndrome plus diarrhea, nausea and vomiting. In that case, you will code irritable bowel syndrome plus nausea and vomiting also, because here diarrhea is symptom of irritable bowel syndrome, but nausea and vomiting are not sign and symptoms of irritable bowel. Okay, that's the reason why we need to code all three: irritable bowel syndrome, nausea and vomiting. Okay. Now next one is multiple coding for a single condition. In addition to etiology manifestation convention that requires two codes to fully describe a single condition that affects multiple body systems, there are other single conditions that also require more than one code. Okay. Use additional code nodes are found in the tabular list to codes that are not part of an etiology manifestation pair where a secondary code is useful to fully describe a condition. Okay, sometimes you need to add the second code additionally. Okay, we need three code. Remember, the example is like sepsis. Okay, severe sepsis. If severe sepsis is there, we need to assign sepsis code, okay, as a primary code, and then we need to add the severe sepsis code, and plus we need to add additionally any organ dysfunction. Okay, use additional code indicate that secondary code should be added if no. For example, for bacterial infection that are not included in chapter 1, a secondary code from category B95, Staphylococcus and Enterococcus as the case a cause of diseases classified elsewhere, or B96, other bacterial agents as the cause of disease classified elsewhere may be required to identify the bacterial organism causing the infection. Okay, means if you go for bacterial infection, you need to add secondary code additionally to specify that particular uh, organism. Okay, infection causing organism. Acute and chronic conditions. If the same condition is described as both acute or subacute and chronic, and separate sub-entries exist in the alphabetic index at the same indentation, both code and sequence the acute or subacute code first. Okay, means if patient has both acute and chronic condition and alphabetic index at the same indentation level, both the codes are present. In that case, you need to code both the condition in which you have to sequence acute condition at the first. Then we'll see combination code. A combination code is a single code used to classify two diagnoses. Okay, combination code is single code used to classify two diagnoses. A diagnosis with an associated secondary process, means also known as manifestation, and a diagnosis with an associated complication. Sometimes you find combination code for it. For example, K57.21. This code is used for diverticulitis of large intestine with perforation and abscess with bleeding. Okay, there is separate code for only diverticulosis, but this is combination code of diverticulitis with perforation and abscess with bleeding. Okay, then E11.341. This code is for type 2 diabetes mellitus with severe non-proliferative diabetic retinopathy with macular edema. Okay, this type of code will going to assign if your provider documented combination of the that particular condition. Then we'll see how to code sequela. Sequela is also known as late effects. What is sequela or late effect? Can anyone tell me? Because this is this question also your interviewer going to ask you. What is sequela or late effect? Tell me, what do you know about sequela? Anything? No? It's okay. Sequela is nothing but long-term effect of any condition, okay, or a condition which is consequence of previous disease or injury is known as sequela or late effect. Okay, it may be appear after few days or few time after that main disease. A sequela is the residual effect after acute phase of an illness or injury has terminated. Okay, there is no time limit on when a sequela code can be used. The residual may be apparent early, such as in cerebral infarction, or it may occur months or years later, such as uh, that due to a previous injury. Okay, coding of sequela generally requires two codes sequence in following order. The condition or nature of the sequela is sequence first, and the sequela code is sequence second. Okay, the current condition or complication or currently the patient suffering from that condition we have to sequence first, and then we have to sequence sequela code for that main condition. Okay, what is the exact reason of that particular condition? For example, scar formation resulting from a burn, deviated septum due to a nasal fracture, and infertility due to tubal occultation or from old tuberculosis. Okay, scar after burn. In case of scar after burn, you need to first code scar, because scar is originating condition. And secondly, you have to code birth sequel of birth. Okay, because reason of that scar is birth. You need to assign sequel of code of birth as a second code. Then we'll see impending or threatened condition. Code any condition described at the time of discharge as impending or threatened as follows. If it did occur, code as confirmed diagnosis. Okay. If it did not occur, refresh the alphabetic index to determine if the condition has a sub-entry term for impending or threatened, and also reference main term entries for impending and for threatened. Okay. If you came across impending or threatened diagnosis in your patient's medical record, okay, in that case, if the diagnosis is confirmed, you need to confirm in the means if provider confirm that diagnosis in impression, then you need to code that particular diagnosis as a confirmed diagnosis. If it did not occur, means if your provider not confirm that this impending or threatened diagnosis is confirmed, in that case you have to refer alphabetic index to determine the condition has sub-entry term for impending or threatened, and also you need to refer that main term entry for impending and for threatened. Okay, because we have few codes under the I term: impending, coronary syndrome, delirium tremors, then myocardial infarction. Okay, then also for threatened we have abortion code, means threatened abortion. We have code for threatened abortion with subsequent abortion. Okay, or we have code for threatened abuse. Okay, or threatened labor. Likewise, you have to go and search for the codes. And then we'll see sorry, reporting same diagnosis code more than once. Each unique ICD-10-CM diagnosis code may be reported only once for an encounter. Okay, this applies to bilateral conditions where when there are no distinct codes identifying laterality or two different conditions classified to the same ICD-10-CM diagnosis code. Okay, each unique ICD-10-CM diagnosis code may be reported only once for an encounter. Okay, even there is the if some bilateral conditions are there and there is no distinct code for specific laterality, in that case also you need to code only once that particular code. Then we'll see documentation by clinicians other than of patients provider. Code assignment is based on the documentation by the patient's provider, that is physician or other qualified health practitioner legally accountable for establishing the patient's diagnosis. There are a few exceptions when code assignment may be based on medical record documentation from clinicians who are not a patient's provider. These exceptions include codes for body mass index, BMI, depth of non-pressure chronic ulcers, pressure ulcer stage, coma scale, NIH stroke scale, laterality codes, blood alcohol level codes. Okay. Then we'll see how to code syndromes. Follow the alphabetic index guidelines when coding syndromes. In the absence of alphabetic index guidance, assign codes for the documented manifestations of the syndrome. Okay, if you not finding particular code for that particular syndrome, in that case you need to assign that documented manifestations. Okay, additional codes for manifestations that are not an integral part of that disease process may also be assigned when the condition does not have unique code. Then we'll see how to code laterality. Some ICD-10-CM codes indicate laterality, specifying whether the condition occurs on the left, right, or is bilateral. Okay, if no bilateral code is provided and the condition is bilateral, assign separate code for right and left. Okay, if the side is not identified in the medical record, assign unspecified code. Then documentation of complications of care. Code assignment is based on provider's documentation of the relationship between the condition and care or procedure unless otherwise instructed by the classification. Okay. Code assignment depend on provider's documentation of relationship between condition and care for procedure. Not all conditions that occur during or following medical care or surgery are classified as complication. If your provider stated that this is complication because of this is a surgery complication or medical care complication, in that case only you will allowed to use the complication code. There must be a cause and effect relationship between the care provided and the condition, and the documentation must support that condition is clinically significant. It is not necessary for the provider to document the term complication. If provider give you cause and effect relationship between care provided and the condition, that is enough to code complication. The complication code is not necessary in that case. Okay, but provider must be document cause and effect relationship between the surgery or care provided and condition. For example, if the condition alters the course of surgery as documented in operative report, then it would be appropriate to report a complication code. And if there is no clarification in the from the documentation is not clear about the relationship between condition and the care or procedure, you need to query the provider. Okay, then we'll see how to code borderline diagnosis. If the provider documents a borderline diagnosis at the time of discharge, the diagnosis is coded as confirmed. Okay, if the provider documents borderline diagnosis at the time of discharge, that diagnosis is coded as confirmed unless the classification provides specific entry. For example, there is a specific entry for borderline diabetes. If you go through diabetes, you will get the code for borderline diabetes, which is nothing but R70.03. Okay, otherwise you have to code that particular diagnosis as a confirmed diagnosis. If a borderline condition has a specific index entry in ICD-10-CM, it should be coded as such, like this diabetes code, borderline diabetes code. How to use sign and symptoms and unspecified codes. Okay, sign and symptoms and unspecified codes have acceptable, even necessary uses. Okay, if a definitive diagnosis has not been established by the end of the encounter, it is appropriate to report codes for sign and symptoms. As we see earlier also, if there is no if our provider confirm the diagnosis and those sign and symptom reason for encounter are mostly sign and symptoms only. Okay, and then doctor did evaluations, did test, procedure, and confirm the diagnosis, the main reason for that sign and symptoms. Okay, in that case, if those sign and symptoms are integral part of that confirmed disease, then you don't need to code that sign and symptom. You need to code that particular diagnosis or disease only. Okay, but if those sign and symptoms are not integral part of that particular disease, in that case you need to first code that confirmed disease. Okay, and then you have to code that non-integral part sign and symptoms also. Okay, and if the provider not give specification about some disease or any condition, in that case you need to choose unspecified code. Like if provider not given more information about which side, right side or left side is affected, in that case you need to choose unspecified. Okay, likewise, when sufficient clinical information isn't known or available about particular health condition to assign a more specific code, it is acceptable to report appropriate unspecified code. For example, a diagnosis of pneumonia has been determined, but not the specific type. Okay, if your provider just give you pneumonia word in the impression, in that case you have to choose unspecified code for pneumonia. Okay, because you don't know which type of pneumonia is there, which is causal organism of that pneumonia and all. That's the reason why you need to choose unspecified pneumonia code. Okay, now you see coding for healthcare encounters in hurricane aftermath. In this, first guideline is use of external cause of morbidity codes. An external cause of morbidity code should be assigned to identify the cause of the injury or injuries incurred as a result of hurricane. Okay. External cause of morbidity codes are never to be recorded as a principal diagnosis or first listed diagnosis in non-inpatient settings. Okay, as these guidelines are outpatient guidelines and general coding guidelines, so here we can't code this external cause code as a primary or principal diagnosis, okay, or first listed diagnosis, because inpatient coding guidelines are different, and these are guidelines for general coding or outpatient coding. Okay, then sequencing of external causes of morbidity codes. Codes for cataclysmic events such as hurricane take priority over all the external cause code except child and adult abuse and terrorism, and should be sequenced before other external cause of injury codes. Okay, if some injury caused because of the hurricane, you need to assign external cause code for hurricane as a not primary, you can say, after that main diagnosis code. When you start coding for external cause codes, in that sequence you need to assign that first external cause code as hurricane. Okay, but exception for child and adult abuse or terrorism. Okay, assign as many external cause of morbidity codes as necessary to fully explain each cause. Okay, sometimes if patient, I can say one example. If one patient fall during dancing uh, in the Zumba class, you can say, okay, and cause some injury. In that case, you need to assign fall code, okay, particular code for external cause code for that fall. First you need to assign injury code, okay, particular injury code. Then you start coding for external cause. In that case you assign first fall code as an external cause. Then you need to assign activity code also, and play activity is dancing, and then you need to assign the location code or place of occurrence code, which is Zumba class. Okay, means you need to assign 3 code in case of this condition or this scenario. Okay, we'll see one more example. If an injury occurs as a result of a building collapse during the hurricane, external cause code for both the hurricane and building collapse should be assigned, with the external cause code for hurricane being being sequenced as the first external cause code, not first listed, first external cause code. Okay, first we need to start our coding from that particular injury or particular condition code, and then when we start coding for external cause code, in that case we need to start with hurricane as a first external cause code. Then we'll see other external causes of morbidity code issues. For injuries that are not a direct result of the hurricane, such as an evacuee that has incurred an injury as a result of motor vehicle accident, assign appropriate external cause of morbidity codes to describe the cause of injury, but do not assign code X37, which is for hurricane. Okay, because here reason for injury is or cause of injury is motor vehicle accident, not hurricane. Okay, in this scenario you need to code motor vehicle as a cause of injury or external cause of injury. Okay, if it is not clear whether the injury was a direct result of the hurricane, assume the injury is due to the hurricane and assign code X37.0, which is for hurricane, as well as other applicable external cause of morbidity codes also. In this first scenario, they our provider is documented that injury is a result of motor vehicle accident. Okay, that's the reason why we need to assign motor vehicle accident external cause for motor vehicle accident. Okay, but in this scenario, if there is no clear documentation about what is the reason or cause for that injury, that's the reason why we use hurricane is a cause of injury. Okay, in addition to code X37.0, which is for hurricane, other possible applicable external cause of morbidity codes include. These codes are like X30, which is for exposure to excessive natural heat. X31 is for exposure to excessive natural cold, or X38 is for flood. Okay, if applicable, you need to assign these codes also. Then we'll see use of Z codes. You need to call these codes as a Z code, not Z codes. Okay, Z codes are also known as other reason for healthcare encounters. Okay, Z codes, other reasons for healthcare encounters. Explain the reason for presenting for healthcare services, including transfers between healthcare facilities, or provide additional information relevant to a patient's encounter. Okay, the ICD-10 official guidelines for coding and reporting identify which codes may be assigned as principal or first listed diagnosis only, secondary diagnosis only, or principal or first listed or secondary. Okay, depending on the circumstances. assign as many codes as necessary to fully explain each healthcare encounter. Okay, these Z codes explain the reason for presenting for healthcare service. Okay, sometimes if the few codes are first listed code, few codes are secondary codes, we need to assign those codes secondary depending on the circumstances. Means if, for example, says if patient came for pre-operative exam, okay, so in that case we need to assign pre-operative code Z code for pre-operative evaluation as a primary and other sign and symptoms as secondary. Okay, possible applicable Z codes include Z59.0, which is for homelessness, then Z59.1, inadequate housing, Z59.5, extreme poverty, Z75.1, person awaiting admission to adequate facility elsewhere. Okay, like this, these are codes you will going to encounter in your, you are going to find in your ICD-10 CM book. Now we'll see this is the last part of this session, how you can find correct code in 5 steps. Okay, ICD how you will going to find ICD-10 CM codes correctly in 5 steps. First step is search the alphabetical index for a diagnosis term. Okay, after identifying the term, note its ICD-10 code. Okay, first you go through first, obviously after reading the medical record, you need to check for first you need to check for reason for encounter. Okay, which mostly consist of conditions like sign and symptoms. Okay, then you need to see impression, if provider confirm any diagnosis or not. Okay, if provider give any particular confirmed diagnosis, you need to go and search code for that diagnosis. Okay, also you need to see whether the sign and symptoms patient comes with are integral part of that particular diagnosis or not. If the sign and symptoms are integral part of that particular diagnosis, you need to code only that particular diagnosis or disease. If not, you need to code that particular disease plus those sign and symptoms also. Okay, so after identifying the term, note its ICD-10 CM code. Okay, when you go through alphabetic index, you're going to find one code right after your main term. Okay, and you need to note down that code. Okay, and then you need to check that code into tabular list. Okay, that's the reason why you need to note that particular ICD-10 code. Here one tip is there, the term you are looking for might not be one of the main terms in the index, but it might be listed under one of those main terms. For example, horseshoe tear of the retina is listed under break retina. We'll see. We'll go by this index only. ICD-10 CM index. We'll see. If you go from tear, if you want to find the code for horseshoe tear, we need to go to tear. Okay, you're in tear. Does it horseshoe present or not? We have to search for it. Okay, you can do Control F and search for horseshoe. Okay, here you can find horseshoe under the retina term. Okay, directly horseshoe is not there, but besides the retina, you can find horseshoe, and it suggests you to see also break retina horseshoe. Okay, if you click on it, it directly go on to the break retina, and you have to choose this horseshoe tear. Okay, so first step is to choose your particular diagnosis and go into the alphabetic index and find code for that particular diagnosis or condition. Okay, disease or condition, and note down that ICD-10 code. Then second step is check the tabular list. Before you use the ICD-10 code that you find in alphabetic index, it is important to check that code in tabular list to see if there are special instructions are there or not. Okay, you can't directly choose any code from alphabetic index. You need to verify that code in tabular list. Otherwise, sometimes it is the same code, sometimes that code requires 6 character, 7 character, or some there are many instructions or there in the tabular list. Okay, or sometimes what happen, remember we learn about the exclude term, include term, or exclude one, exclude two. Those instructions you will going to find in the tabular list only. Okay, that's the reason why you need to check that particular code which you found in alphabetic index. You need to verify that code in tabular list to see if there are special instructions. For example, if you look only at the alphabetic index, you will know that some glaucoma diagnosis codes require a 6 character to represent laterality. Okay, then third step is read the code's instructions. The code's entry in the tabular list provides all the diagnosis code requirements. Okay, for example, a tabular list flags code that can't be submitted for same eye on same day. This kind of instructions they will go give as a exclude one term, exclude two codes. Okay, then next step is add 7th character. For some diagnosis, tabular list instruct you to add a 7th character. Okay, remember the symbols we discussed previously. I'll show you again here in tabular list. Here you can find all those symbols at the end of each page of tabular index. Okay, N is for newborn, P is for pediatric maternity. Here are the 4, 5, 6, 7 character required symbols also. Okay, so this kind of symbols you will going to find in tabular index only. That's the reason why you need to verify your code in tabular index. If it is an injury or trauma, add a 7th character. Use one of the following character. A is to indicate initial encounter, D is for subsequent encounter, and S is for sequela. Okay. For example, a patient present with a complaint of pain in right eye for 2 hours. A corneal abrasion is diagnosed. The code is S05.01, which is for injury of conjunctiva and corneal abrasion without foreign body, right eye. Okay, but that code's entry in the tabular list instruct you to add 7 character from A, D, or S. Okay, as a 7th character. Remember, but this code is 1, 2, 3, 4, 5-digit code only, and we need to add 7th character. Okay, since this code is only 5 character long, use X as a placeholder in the sixth position. Okay, sixth position we need to use X as a placeholder because we don't have any specific information about the sixth character. We need to use X as a placeholder in the sixth position. In the 7th position, add A to indicate initial encounter. If it is initial encounter, we need to add A. If it is follow-up or subsequent encounter, we need to add D. If it is if the patient develop or recurrent erosion as a result of abrasion, in that case, we need to add S as a 7th character, which is for sequela. Okay. So this kind of instruction you will going to find in tabular list only. That's the reason why you need to first choose your code from alphabetic index, then note down that code, and then you need to verify that code for specific instructions in tabular list. Without that, you will not going to assign any code. Okay. Without verifying in tabular list, you should not assign any code. Otherwise, it may be possible that you will choose wrong code or invalid code. Then fifth step is always code to the highest degree of accuracy and completeness. Okay, if there is 4th, 5th, 6th or 7th digit available, you must use it. Lastly, the important tips for coding. The best code is the actual diagnosis. Okay, if you have the confirmed diagnosis in your impression of the report, you need to choose that actual diagnosis or confirmed diagnosis as a primary, obviously following the guidelines. The next best is sign and symptoms. The last reason, the last is a circumstance or V codes or X code or sometimes Z codes also. Okay. Only code established conditions. You have to code only establish or confirm conditions only, not probable, suspected, possible or rule out condition. You are not allowed to code the probable, suspected, possible or rule out conditions. Okay. If you have a particular code for borderline condition, you need to code that borderline condition. So please keep it in mind these important tips while coding or while you go for your any coding exams. Okay. So that's all about it. Thank you all for your attention. If you like this session, if you like to learn more about medical coding, and join our medical coding training sessions, please go on this link given below, www.greatonlinetraining.com, and register yourself. Okay. Bye bye. Take care. Welcome to Great Online Training. Myself, Nikita. I am a CPC certified medical coding trainer in Great Online Training. Today onwards, we're going to discuss about different coding guidelines, ICD coding guidelines, chapter wise. Okay. So from today onwards, we're going to discuss chapter wise ICD coding guidelines, right? And this is the chapter 1. Today we're going to discuss guidelines about chapter 1, which is certain infectious and parasitic diseases. Code ranges between A00 to B99 and U07.1 to U09.9. Okay. you will get all these guidelines in your ICD book. Okay, so but you have to go through these guidelines, because even though these guidelines are already there in your book, ICD book, but each and every time it is not possible for you to go and check each and every guideline, right? While you're doing your medical coding job, or either you are preparing for your medical coding test, means if you are going for a CPC test or a CCS test or any other test, right? Because it will take too much time, because these books are consist lots and lots of pages. Okay, so you can't waste your time in turning the pages of books. That's the reason why you have to go through again and again through these guidelines, right? So we'll start. Just a minute. Okay. So today we're going to cover the following topics: HIV infections, sepsis, severe sepsis and septic shock, then methicillin resistant Staphylococcus aureus, also known as MRSA. Then we'll see Zika virus infections, then coronavirus infections, and lastly question and answers. Okay. So first one is HIV infection. What do you know about HIV infection? Can anyone tell me? What is the meaning of HIV, full form of HIV?
Human immunovirus.
You missed some part. Human immunodeficiency virus. Okay, it's okay. So, and what is difference between HIV and AIDS? Both are same or different? It's okay, I'll tell you. So, HIV is a human immunodeficiency virus. Okay, and HIV virus causes AIDS, which is nothing but acquired immunodeficiency syndrome. Okay, if HIV is not treated, then it will cause AIDS. Okay, this is the difference. HIV is the virus that causes HIV infection. Okay, and the HIV virus damages the immune system by killing CD4 cells. We have CD4 cells in our immune system, right? And the HIV virus kills those CD4 cells and weakens our immune system. And AIDS is the last stage of HIV infection. Okay, you can see here in this test tubes. Okay, years without HIV medicine. If anyone having HIV infection and it's not going treated, then the HIV will increase and causes AIDS, means acquired immunodeficiency syndrome. Okay, so AIDS is the last stage of HIV infection. As HIV infection advances to AIDS, the amount of HIV in body increases and the number of CD4 cells decreases. You can see here. Just give me 1 minute. Okay. So HIV is the virus that causes HIV infection, and AIDS is the last stage of HIV infection, in which HIV infection means amount of HIV virus increases in your body and the number of CD4 cells decreases. Okay, that stage is called AIDS. I will move forward. It is. It is clear about it, difference between HIV and AIDS. or you need more explanation?
Yes.
Okay, good. So HIV attacks CD4 cells, okay, and the amount of HIV virus increases and CD4 cells decreases. That stage is called AIDS, acquired immunodeficiency syndrome, right? There is currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. The possible signs and symptoms include fever, headache, sorry, fever, headache, muscle ache, pain, joint pain, sore throat, painful mouth sores, diarrhea, weight loss, and night sweats. Okay, these are the possible signs and symptoms of HIV. You need to know sign and symptoms of the infections or any diseases, because while coding ICD, if it is confirmed, any disease is confirmed, even though patient come with some sign and symptom, obviously patient mostly come with sign and symptom, then they go through some test, right, and then after it is confirmed that which infection is there or which disease is there. So in that case we have to code the confirmed cases. Means if it is confirmed that HIV infection is there, the symptoms, sign and symptoms are due to HIV, okay, then we have to code only HIV. We will not going to code this sign and symptoms. That's the reason why you have to aware about the sign and symptoms of the infections or diseases. Okay. Now we'll see guidelines for HIV, means human immunodeficiency virus infection. Okay. First guideline is code only confirmed cases. Okay. As I just told you, code only confirmed cases of HIV infection or illness. This is an exception to hospital inpatient guidelines. Okay, the inpatient coding is slightly different from outpatient coding. This training session is about general medical coding. So here we're going to discuss the guidelines about outpatient coding. Okay, if anyone wants to go for inpatient coding, then the training will be different. In the there you have to go through inpatient coding guidelines. Their coding guidelines are different. Okay, so these are uh, outpatient coding guidelines, or you can say general coding guidelines. Okay, so code only confirm cases of HIV illness. Okay, in this context, confirmation does not require documentation of positive serology or culture of HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV related illness is sufficient. Okay, means you, confirmation word is not mandatory in the report. If you have, if your provider says or patient's provider says patient is HIV positive or has HIV related illness, that is sufficient to code HIV infection. Okay, then now we'll see example. The patient admitted with anemia with possible HIV infection. Here the our provider says possible HIV infection. Provider also not confirm that HIV infection is confirmed or not. Okay, he says possible HIV infection. Okay, it is not yet confirmed that HIV is there or not. So they stated as possible HIV infection. So while coding in means outpatient coding or in general coding, we not coded possible conditions. Okay, possible suspected conditions we are not coding. So here our ICD code is will code only anemia. Okay. See here, explanation. Only the anemia is coded in this scenario because it has not been confirmed that an HIV infection is present, right? Our provider says possible HIV infection. That's the reason why we'll only code anemia. Okay. Again, here you can see I have written. This is an exception to guideline session 2H for hospital inpatient coding, because this session 2H is for inpatient coding. Okay, because in inpatient you have to code possible conditions also, because in inpatient they have to go through test. If you are admitted in the hospital, doctor has to test you, right? To confirm the disease or infection if anything is suspected. That's the reason why in inpatient coding we'll have to code possible conditions also. But this training session is regarding general medical coding. That's the reason why you have to keep it in mind that we're not going to code possible conditions. Okay, if you going for CPC exam, okay, CPC exam is related to outpatient coding. Okay, then you have to go through these guidelines only. The same guidelines you have to follow, which are followed for outpatient coding. And if you want to go for inpatient coding and inpatient coding certification, then you have to go for CCS training. Okay, so now it is confirmed that you have to code only confirmed cases. Okay, this is the first guideline of HIV. Okay, we have to code only confirmed cases. If anything is possible, like possible HIV infection or suspected HIV infection, we're not going to code it. Next guideline is selection and sequencing of HIV codes. In this session, first one is patient admitted for HIV related condition. If patient admitted for HIV related condition, the principal diagnosis should be B20. Okay, B20 description of B20 is human immunodeficiency virus disease. Okay, because patient is already admitted for HIV related condition only. That's the reason why we have to assign B20 code. Okay, which is for HIV disease. Okay, means it is confirmed that this patient has HIV. Followed by additional diagnosis code for all reported HIV related conditions. Other conditions, HIV related conditions will code afterwards. Okay, while coding, it is very important that it is a very crucial part to choose principal diagnosis. Principal diagnosis means you code the report, you have to choose many diagnoses, right? So the main cause or the main reason for encounter, that you have to code as a primary means you have to code it first. Remember I told you about sequencing. So while sequencing, you have to code primary only those cases which are confirmed or which are the main reason for encounter. Okay, so here if patient is admitted for an HIV related condition, then our principal diagnosis should be B20, which is nothing but HIV disease, then followed by additional diagnosis codes for all reported HIV related conditions. Okay, an exception to this guideline is if the reason for admission is hemolytic uremic syndrome associated with HIV disease. Assign code D59 or D59.31, which is nothing but infection associated hemolytic uremic syndrome followed by code B20. Okay, this is the one exception for this guideline. We'll see one example. HIV with PCP. Okay, PCP means pneumocystis carini pneumonia. Okay, if patient admitted with HIV with PCP, then we have to code, we have to assign B20 as a principal diagnosis, which is nothing but HIV disease, and then B59, which is for PCP. Okay, because pneumonia due to pneumocystis carini is an HIV related condition, so the HIV diagnosis code is reported first, followed by the code for pneumonia. Any doubt? Okay. Now the second next guideline is patient with HIV disease admitted for unrelated condition. If a patient can you please mute your mic? Okay, so next guideline is patient with HIV disease admitted for unrelated condition. If a patient with HIV disease is admitted for an unrelated condition, such as traumatic injury, okay, the code for the unrelated condition, for example, nature of injury code, okay, should be the principal diagnosis. Other diagnosis would be B20 followed by additional diagnosis code for all reported HIV related conditions. Let's see one example. If patient is admitted for unstable angina, okay, native coronary artery atherosclerosis, okay, and HIV, then so unstable angina, native coronary artery atherosclerosis, it is unrelated to HIV. Okay, so we have to assign I-25.110, which is nothing but atherosclerotic heart disease of native coronary artery with unstable angina pectoris. Just give me 1 minute. Oh. So ICD codes will going to assign are I-25.110, which is nothing but atherosclerotic heart disease of native coronary artery with unstable angina pectoris, and here the second diagnosis is B20, which is HIV disease, because patient admitted for unstable angina and HIV, and unstable angina is not related to HIV. Okay, both the conditions are unrelated to each other, right? That's the reason why we'll assign primary the unstable angina, then B20. Next one is whether the patient is newly diagnosed. Okay, if the patient is newly diagnosed or has had previous admission or encounter for HIV conditions, is irrelevant to sequencing decision. We'll see one example. Newly diagnosed multiple cutaneous Kaposi's sarcoma lesions in previously diagnosed HIV disease. Here we have to assign B20 as a primary or principal code, which is HIV, which is for HIV disease, and then we have to assign C46.0, which is for Kaposi's sarcoma of skin. Because even though HIV was diagnosed on a previous encounter, it is still sequenced first when coded with an HIV related condition. Because Kaposi's sarcoma is an HIV related condition. Okay, that's the reason why we assign B20 as a primary code. Okay, so as of now we learn that we have to code only confirm cases if if our provider mention that possible or suspected HIV, then we'll not going to code that HIV. Okay, we'll code other diagnosis. Then we learn that if any related condition with HIV, if patient admitted with any HIV related condition, then we have to assign first B20 and then other condition, right? If patient is admitted any means any unrelated condition with HIV, okay, then we have to assign that other condition first and then B20 means HIV code. And now this guideline is whether the patient is newly diagnosed. Okay, means if the patient has B20 and means B20 means HIV disease and admitted with some another newly diagnosed condition, then we have to assign B20 as a primary, because if that condition is related to HIV. Okay, like in this example where Kaposi sarcoma, patient is admitted for Kaposi sarcoma of skin, but as Kaposi sarcoma is related to HIV, we have to assign B20 as a primary code and then C46.0 for Kaposi sarcoma as a secondary code, okay, or second diagnosis. Next guideline is asymptomatic human immunodeficiency virus. Those guidelines are about confirmed diagnosis, confirmed HIV diagnosis. Okay, those three guidelines are about. Now here we'll see if patient has a symptomatic human immunodeficiency virus or HIV infection, then which code will going to use, that we'll see. G21 is the code for asymptomatic human immunodeficiency virus infection status. Okay, is to be applied when patient without any documentation of symptoms is listed as being HIV positive or known HIV or HIV test positive or similar terminology. Okay, means if you find in your report or in your question that patient is HIV positive or known HIV or HIV test positive, okay, then you have to append on this number or you have to assign this number, which is Z21, asymptomatic HIV infection status. Okay, do not use this code if the term AIDS or HIV disease is used. Okay, or if the patient is treated for any HIV related illness or is described as having any condition resulting from his or her HIV positive status. Okay, in that case you have to use B20. Okay, as we discussed in previous guidelines, we have to use B20 if AIDS or HIV disease or any HIV related condition is present or HIV positive status given in the report or question, then we'll use B20. This Z21 code is for asymptomatic HIV infection. Okay, I know this is a little bit confusing, but when you go through these guidelines again and again, you're going to buy heart these guidelines. Okay, don't worry about it. We'll see one example. Patient admitted with acute appendicitis, status positive HIV test on atripla with prior symptoms. Okay, in this case, we will use K35.80. Okay, unspecified acute appendicitis. Okay, 35.80 is for unspecified acute appendicitis code because patient is admitted with acute appendicitis. Okay, and status HIV positive test. Okay, so here we'll use Z21, which is for asymptomatic human immunodeficiency virus infection status. Code Z21 is sequenced second since documentation indicate that patient has had a positive HIV test but but has been asymptomatic. Okay, being on medication for HIV is not an indication. The code B20 is used instead of Z21 unless there has been documented that patient has had current or prior symptoms or HIV related complications. Code B20 is not used. Here B20 is not used because there is no any HIV related complication present. Okay, that's the reason why we use Z21 because appendicitis is not an HIV or its related complication. Okay, that's the reason why we assign appendicitis as a primary code and then Z21 as a secondary. Clear? Next guideline is patients with inconclusive HIV serology. Patient with inconclusive HIV serology but no definitive diagnosis or manifestation of the illness may be assigned code R75. R75 description is inconclusive laboratory evidence of HIV. Okay. If it is not confirmed or patient has inconclusive HIV serology, then we'll have to use R75. The next guideline is previously diagnosed HIV related illness. Patient with any known prior diagnosis of an HIV related illness should be coded with B20. Okay. If patient previously also have HIV related illness, then throughout his life we have to use B20 code. Okay, because once you get infected with HIV, it will be for lifetime. So that's the reason why we have to use B20 if patient with any prior diagnosis of HIV related illness. Okay. Once a patient has developed an HIV related illness, patient should always be assigned B20 on every subsequent admission or encounter. Okay. Patients previously diagnosed with any HIV illness B20, any HIV related illness means B20 code, should never be assigned to R75 or Z21, which is for R75 for inconclusive laboratory evidence. You will not going to use because if the patient already diagnosed with HIV illness, there is no use, there is no need to use R75, right? Because that is for inconclusive serology. And Z21 is for asymptomatic HIV infection status. Okay. So if the patient previously diagnosed with any HIV illness, we have to use B20. And if patient has inconclusive serology, we have to use R75. And if patient is asymptomatic for HIV infection status, then we have to use Z21. Next guideline is HIV infection is in pregnancy, childbirth, and the puerperium. During pregnancy, childbirth, or the puerperium, a patient admitted or presenting for a healthcare encounter because of an HIV related illness should receive a principal diagnosis code of O98.7, and this code is not completed O98.7, so it has other characters also, because O series is for pregnancy related diagnosis. Okay, and if patient is pregnant, we have to assign O code as a primary. Okay, means there is separate session, we're going to discuss it in further sessions. While discussing chapter wise, we're going to discuss it about O series codes. If patient is pregnant, we have our principal diagnosis should be O code. Okay, so here also we have different HIV related code for pregnancy. Okay, if HIV related illness should receive a principal diagnosis code O98.7, human immunodeficiency disease complicating pregnancy, childbirth, and puerperium, then we have to use B20 code. Okay, we can't will not directly append on B20 code because this patient is pregnant. Okay, that's the reason why we have to use O98.7 as a primary code, and then additionally we have to use B20 code. Okay, for HIV related illness. Codes from chapter 15 always take sequential priority. Just I have told you, as this patient is pregnant, on a pregnant patient, we have to use chapter 15 codes, means O series codes, which are for pregnancy. The patient with asymptomatic HIV infection status admitted or presenting for healthcare encounter during pregnancy, childbirth, or puerperium should receive code of O98.7 and Z21. So you have to keep it in mind that O98.7 is you have to use if patient with any HIV related condition. Okay, then other guidelines are same as previous guidelines. Okay, if it is confirmed that HIV is there, or HIV disease or HIV related disease illness is there, then you have to use B20, and if it is asymptomatic HIV infection, you have to use Z21. But as a primary code, as this patient is pregnant, if patient is pregnant, you have to use O98.7. O98.7 is code for pregnant patient with HIV disease. Okay. Then next one is encounters for testing for HIV. Okay, if patient is came for only testing of HIV, if patient is being seen to determine his or her HIV status, use code C11.4, which is for encounter for screening for HIV. Okay, if patient is encountered for determining his or her HIV status, we have to use Z11.4. Okay, use additional codes for any associated high risk behavior if applicable. If other diagnoses are there, then we have to use those diagnoses as additional code. Okay, but primary, if patient is encountered for determining his or her HIV status, will use Z11.4 code. Okay, if patient with sign or symptoms is being seen for HIV testing, code the sign and symptoms. An additional counseling code Z71.7, human immunodeficiency virus counseling, may be used if counseling is provided during encounter for the test. Okay, if patient with sign and symptom is being seen for HIV testing. Okay, if patient having some HIV related If anyone have, it's possible that there are many common sign and symptoms of many diseases, right? So if a patient with some sign and symptoms like HIV, okay, and seeing for HIV testing also, okay, and the doctor provided counseling to that patient, then we have to first assign those sign and symptoms, and then additionally we have to use Z71.7 if HIV is not confirmed. In that case I'm talking, okay. If that is confirmed, those guidelines are separate. Those will we saw in previous sessions, right? So if only counseling is provided, then we have to assign sign and symptoms, and then the 71.7, which is for HIV counseling. Then when a patient returns to be informed of his or her HIV test result and the test result is negative, use code Z71.7, which is for counseling, HIV counseling. Okay. See, if one patient done his HIV testing, okay, and then he return back to the provider to show them the reports, to inform them that his test result is negative. So obviously that doctor provides some counseling, right? So we'll use Z71.7 code, which is for HIV counseling. Okay, we can't use Z11.4 or R75 or other codes. We have to use Z71.7. If sorry, if the results are positive, see previous guidelines and assign course as appropriate. Okay. R7 will again repeat. B20, if HIV or HIV disease or AIDS is present in the report, means it is confirmed that the patient has HIV, whether it is previously diagnosed or anything. If he is infected with HIV, once he or she has HIV disease, it will be coded lifetime. Okay, we have to code it on each and every encounter. Okay, with B20 code, which is for HIV disease and then or AIDS. And but the sequencing depend on region for encounter, as we discussed in previous slides, right? Then Z21 is for asymptomatic HIV infection status, for HIV positive or non-HIV. Then R75 is for inconclusive HIV serology but no illness. Okay. Then Z11.4 is for encounter for screening. Okay. And Z71.7 is for HIV counseling. Okay. Use if, even though if patient is with negative test of HIV, we have to use Z71.7. And if patient present with sign and symptom and seen for testing, we have to use Z7 those sign and symptom as a primary, and then Z71.7 as secondary code. And if patient is pregnant and seen for any HIV related illness or with HIV disease or AIDS, we have to use O98.7 as a primary, and then B20 or Z21 code. Correct? Clear? What you have to do, I know this is very much confusing. You will get confused very much, right, about these guidelines. You just have to make a note of this code, just as I have told you. How many codes? I have told you only 6 codes, like B20, Z21, R75, Z11.4, Z71.7, and O98.7. And you have to make a note that which cases you have to use those codes. Okay, you have to by heart those 6 codes only. Okay, now we'll move ahead our next type of infection, which is sepsis, severe sepsis, and septic shock. What do you know about sepsis? Anyone? Anything you know about sepsis? It's okay. Sepsis is life-threatening medical emergency condition. Okay, sepsis happens when an infection you already have triggers a chain reaction throughout your body. Okay, how it happens? We'll see. First, those bacteria comes into your lung. Okay, first those bacteria infect your lungs, the source of infection. Okay, then those bacteria enter into your blood, then it leaking through your blood vessels, and through blood vessels it will infect other organs also, and you will start facing organ dysfunction, and lastly death. So this is very severe disease or medical emergency disease. Sepsis is the body's extreme response to an infection. It is a life-threatening medical emergency. Sepsis happens when an infection you already have triggers a chain reaction throughout your body. Here you can see from lungs to blood vessels, and then they will leak from blood vessels and then goes to other organs, and the other organs start dysfunctioning, and lastly death. So infection that leads to sepsis most often start in the lung, and then after go to urinary tract, skin, or gastrointestinal tract. Okay. Now we'll see there are several stages of sepsis. SIRS. Okay. SIRS, any more than 2 or equal to 2 of following. If the temperature symptoms like temperature is more than 35.5 Celsius, okay, or heart rates are more than 90 beats per minute, or are more than 20 beats per minute, okay, or WBCs are more than 10% bands. Okay, so SIRS gives you these symptoms or these test results. Okay, just give me 1 minute. Okay, so what is meaning of SIRS? SIRS is systemic inflammatory response syndrome. Okay, systemic inflammatory response syndrome. It is one stage of sepsis. Okay. Then we have sepsis, means any two conditions between this SIRS, systemic inflammatory response syndrome, and then confirmed or suspected infection, that is urinary tract infection, PNA, wound, etc. Then we have severe sepsis, in which there is sepsis plus any sign of organ failure, that we call as severe sepsis. And then lastly, septic shock. Okay, septic shock means severe sepsis. What is severe sepsis? Severe sepsis means sepsis plus organ failure. So the septic shock means sepsis plus signs of organ failure, plus extremely low BP that does not respond to fluid replacement. Okay, that is called septic shock. These are different stages of sepsis. Okay, we'll see guidelines for it. Okay, coding for sepsis and severe sepsis. So the first guideline for sepsis is, for the diagnosis of sepsis, assign the appropriate code for the underlying systemic infection. If the type of infection or causal organism is not further specified, assign code A41.9, which is for sepsis unspecified organ. If the organism is not mentioned, okay, if your provider is not mentioned any organism which causes sepsis, then you have to assign A41.9, which is for sepsis unspecified organism. Okay, a code from subcategory R65.2, which is for severe sepsis. Severe sepsis means what? Sepsis with any symptoms of organ failure. It's called severe sepsis. Then we have to use R65.2. This should be assigned, should not be assigned unless severe sepsis or any associated acute organ dysfunction is documented, right? Because severe sepsis is sepsis with any related organ dysfunction. Okay, so if there is no documentation of any sign and symptoms of organ dysfunction or failure, then you will not use severe sepsis code. Okay, for example, gram negative sepsis. If your provider is documented gram negative sepsis, then we have to use A41.50, which is for gram negative sepsis unspecified staphylococcus sepsis. Okay, and second code is A41.2, which is for sepsis due to unspecified staphylococcus. Here we know that this sepsis is due to staphylococcus. Okay, that's the reason why we use 841.2. Okay, in both the examples above, the organism causing the sepsis is identified. Therefore, A41.9 sepsis unspecified organism would not be appropriate, as this code would not capture the highest degree of specificity found in the documentation, because A41.9 is for sepsis unspecified organism. If you have if your provider given you any specified organism, you have to use that particular code only. We'll see here, show you. Go on this ICD-10. If you type here sepsis, you will find this code. See, A41.9. This is for unspecified organism. Here it is mentioned sepsis unspecified or generalized. Okay, this code is for by default code. If you need to assign any unspecified code, you have to choose this code. Okay, which is directly behind the main term. And if your provider is given specific organism, okay, then you have to choose from these categories. Okay, the specific code. There are too many codes present, but if it is not specified any organism name, you have to choose A41.9 only. Clear? Okay. So the next one is negative or inconclusive blood cultures and sepsis. Negative or inconclusive blood cultures do not preclude the diagnosis of sepsis in patients with clinical evidence of the condition. However, the provider should be queried. Okay. If negative or unconclusive blood cultures and sepsis is there, we have to query the provider. Then urosepsis. The term urosepsis is a non-specific term. It is not to be considered synonymous with sepsis. Urosepsis is not sepsis. If you encounter with urosepsis term in your report or in your during your exam, it is not synonymous to sepsis. Keep it in mind. Okay, sepsis and urosepsis is different. It has no default code in the alphabetic index. Okay, should a provider use this term, he or she must be queried for clarification. If you while you doing your job, medical coding job, if you encounter with urosepsis term in any patient's report, then you have to query the provider for clarification. Okay, because there is no code for urosepsis in the alphabetic index. Now next one is sepsis with organ dysfunction. If a patient has sepsis and associated acute organ dysfunction or multiple organ dysfunction, MOD, multiple organ dysfunction, follow the instructions for coding severe sepsis. Okay, we'll see. Here you can see sepsis. Then we'll see here there is no code for urosepsis, right? So if your provider given you urosepsis in patient's report, then you have to query the provider for clarification. Okay, and if you have to code for severe sepsis or if the patient has sepsis and associated acute organ dysfunction or multiple organ dysfunction, follow instruction for coding severe sepsis. Like here you can see severe, under the sepsis you will see severe. Okay, if there is severe with septic shock, you have to go on this code. If you have only severe sepsis or any related organ failure or symptoms of organ failure, then you have to see here. You can see applicable to severe sepsis. Okay. If there is any additional code needed or any principal diagnosis is necessary, then it will be mentioned here. Okay, code first or something. Just a minute. Okay, so next guideline is acute organ dysfunction that is not clearly associated with the sepsis. If the patient has sepsis and an acute organ dysfunction, but the medical record documentation indicates that the organ dysfunction is related to a medical condition other than sepsis, do not assign a code from category R65.2, which is for severe sepsis. Okay, if the patient admitted or patient encounter with acute organ dysfunction, but that dysfunction is not clearly associated with sepsis, then you should not use severe sepsis code, which is R65.2, because to use R65.2, which is for severe sepsis, it must be documented that organ dysfunction or sign and symptoms of dysfunction is related to sepsis. Then and then only you are allowed to use R65.2 code. Okay, An acute organ dysfunction must be associated with the sepsis in order to assign the severe sepsis code. If the documentation is not clear as to whether an organ dysfunction is related to sepsis or another medical condition, query the provider. Okay. For example, sepsis and acute respiratory failure due to COPD exacerbation. Here we'll use A41.9, which is for sepsis unspecified organism, because organism is not mentioned here. Then J44.1, which is for COPD, and then J96.00, which is for acute respiratory failure. Okay, because although acute organ dysfunction is present in the form of acute respiratory failure, severe sepsis R65.2 is not coded in this example, as the acute respiratory failure is attributed to COPD exacerbation rather than sepsis. So the sequencing of these codes would be determined by circumstances of the admission. Okay. Because here in this example, the acute respiratory failure is due to COPD exacerbation. Okay. This is not related to severe sepsis. That's the reason why we're not going to use R65.2 code. Okay. Now we'll see severe sepsis. The coding of severe sepsis requires a minimum of 2 codes. First, a code for underlying systemic infection, followed by a code from subcategory R65.2, which is for severe sepsis. If the causal organism is not documented, assign code A41.9, which is for sepsis. If causal organism is given, then we have to assign for that causal organism. Then additional codes for associated acute organ dysfunction are also required. Due to the complex nature of severe sepsis, some cases may require querying the provider prior to assigning of the code. Okay. Means if any severe coding for when you go for severe sepsis coding, you have to assign at least 2 codes. First code is for infection. If causal organism is not mentioned, then you have to use A41.9, and then you have to use severe sepsis code R65.2. Okay. Then coding for septic shock. Septic shock generally refers to circulatory failure associated with severe sepsis, and therefore it represents a type of acute organ dysfunction. Okay. For cases of septic shock, the code for systemic infection should be sequenced first, followed by code R65.21, which is for severe sepsis with septic shock, or code T81.12, which is for post-procedural septic shock. And then any additional codes for additional other acute organ dysfunction should also be assigned. Okay. So it means if septic shock is present, okay, then we have to code first A41.9. Okay, because if anything related to sepsis, we have to primary code A41.9 for infection, or which is for sepsis code A41.9, sepsis unspecified organism. If organism is specified, then you have to choose accordingly, but you have to code sepsis as a primary. Then we'll choose R65.21, which is for severe sepsis with septic shock. Okay. Or T81.12, which is for post-procedural septic shock. Okay, if septic shock happens after any procedure, then we have to choose T81.12. And then third one is organ failure code, okay, or organ dysfunction code. So this is sequencing for septic shock. First A41.9, then R65.21 or T81.12, and then organ failure code. Clear? Here again, sequencing of severe sepsis. If severe sepsis is present on admission and meets the definition of principal diagnosis, the underlying systemic infection should be assigned as primary diagnosis, followed by the appropriate code from subcategory R65.2 as required by sequencing rules in the tabular list. Okay. If severe sepsis is present on admission, then the underlying systemic infection should be assigned as a primary diagnosis. Means sepsis code assigned as a primary. For unspecified, it is A41.9. If the organ is specified, we have to choose that specific organism code, sepsis code. Okay, but for unspecified, A41.9 and then R65.2. We can't assign R65.2 as a primary, okay, according to guidelines. Then next one is sepsis or severe sepsis with a localized infection. If the reason for admission is sepsis or severe sepsis and a localized infection such as pneumonia or cellulitis, a codes for underlying systemic infection should be assigned first, and the code for the localized infection should be assigned as a secondary diagnosis. Okay, primary as underlying systemic infection code, and the localized infection code should be assigned secondary. If the patient has severe sepsis, a code from subcategory R65.2 should be assigned as a secondary code. Okay, secondary diagnosis. If patient has severe sepsis, if patient had two types of infection, okay, means sepsis or severe sepsis and the localized infection also, such as localized infection such as pneumonia or cellulitis. Okay, in that case, means here reason for admission is sepsis or severe sepsis, and plus that patient has pneumonia or cellulitis, like localized infection. In that case, you have to assign first the underlying systemic infection, means sepsis code. Okay, then if that is severe sepsis, then we have to assign A41.9 first, then R65.2, and then the code for localized infection. Then if the patient is admitted with a localized infection such as pneumonia and sepsis, severe sepsis doesn't develop until after admission, the localized infection should be assigned first, followed by the appropriate sepsis or severe sepsis code. Okay. If the patient is admitted with localized infection, okay, here in this case, if the patient admitted with localized infection such as pneumonia or that cellulitis, okay, and the sepsis or severe sepsis doesn't develop until admission, it develop after admission, then in that case we have to assign first code for localized infection, because patient is admitted for localized infection and then he develop the sepsis or severe sepsis. Okay, that's the reason why we'll use the sepsis code as a secondary. Means it is depend on admission, reason for admission. If patient has two type of infection sepsis plus localized infection. You have to, the sequencing for coding is depend on reason for admission. Okay, if reason is sepsis, then we have to sequence sepsis as a primary. If reason is localized infection, then we have to choose localized infection as a primary code. Clear? Then next guideline is sepsis due to a post-procedural infection. Okay. In this case, first is documentation of causal relationship. As with all post-procedural complications, code assignment is based on the provider's documentation of the relationship between the infection and the procedure. Okay. With all post-procedural complication, code assignment is based on provider's documentation of relationship between infection and procedure. Then sepsis due to post-procedural infection. Okay, for infection following a procedure, a code from T81.40 to T81.43, infection following procedure, or a code from O86.00 to O86.03, infection of obstetric surgical wound, that identifies the site of infection should be coded first, if no. Okay. If infection following procedure, code from T81.40 to T81.43, or for obstetric O86.00 to O86.03. That will go first. Assign an additional code for sepsis following a procedure T81.44, or sepsis following an obstetrical procedure O86.04. Use an additional code to identify infectious agent. Okay. If sepsis is due to post-procedural infection, we have to code the use this T81.44 codes as a primary, or O86.04 code as a primary, and then additionally we have to code infectious agent. Okay. If the patient has severe sepsis, the appropriate code from subcategory R65.2 should also be assigned with the additional codes for any acute renal organ dysfunction. Okay. If the patient has severe sepsis, the appropriate code from subcategory R65.2 should be assigned with additional code. Now we'll see ICD codes for HIV coding. Here I have gathered all the codes to make it easier to digest. Okay, because I know you must be confused learning all the guidelines. Okay, but at least you have to by heart this course for the particular term. Okay, if the term is if the term is HIV disease, okay, HIV disease is confirmed, then, or it is mentioned that AIDS or AIDS related complex, okay, or AIDS related condition, HIV infection, symptomatic. If terms like this are there, then you have to choose code from B20 to B24. Okay, from this code range you have to choose your code. If the patient is asymptomatic HIV infection status, then we have to code Z21. Okay, this code also apply for this other terms like HIV infection, HIV positive, HIV, non-HIV, HIV virus, HIV status, HIV positive, or HIV test positive, HIV infection but asymptomatic. Okay, that time you have to choose Z21. Okay, to code B20 to B24 series, it is compulsory that HIV disease is mentioned, okay, or HIV infection symptomatic. This word are compulsory, or else AIDS. If these terms are not there, the patient is asymptomatic HIV infection status or just HIV test positive like this, then you have to choose G21. Okay. Then if there is laboratory evidence of HIV, this term is mentioned in your report, then R75. Okay. HIV disease complicating pregnancy, you have to choose O98.7, and then B20 or G21 use additionally, okay, as a secondary code. Then encounter for screening for HIV is there. For that G11.4 code is there. Okay, G11.4 is for encounter for screening for HIV. HIV counseling or patients test results are negative for HIV, and then patient come back to show the report the provider, that in that case you have to choose G71.7. okay. Then contact with or exposure to HIV is there. For this G22 G20.6 code you have to use. And for family history of HIV disease, G83.0. Okay, so this is the table for terms and ICD codes of HIV. Okay, different terms for which you can choose these codes. Okay, if you go through this table also, it will be easy for you. Okay, then we'll see. Next one is SIRS, or sepsis, then sepsis, severe sepsis and septic shock. SIRS means systemic inflammatory response syndrome. Okay, systemic inflammatory response syndrome. This is response to the inflammatory response of our body to the any infection or something. Okay, like we have fever or increased body temperature or any rashes or something like that. Okay, when the source of SIRS is an infection, it is called sepsis. When it is called sepsis, when source for systemic inflammatory response syndrome is infection, then infection, at that time it is called sepsis. Okay, it is the body's extreme response to an infection. It is life-threatening medical emergency. Sepsis happens when an infection you already have triggers a chain reaction throughout your body. Okay, chain reaction like this. Mostly they infect your lungs or anything like this. Here infection that lead to sepsis most often start in lung, urinary tract, skin, or gastrointestinal tract. Okay, infection can start from any of these site, and then it will those bacteria goes into your bloodstream, and then they start leaking from your blood vessels, and likewise they then go to your different organs. So after that your organs start dysfunction. Okay, and last stage is organ failure and then death if it is untreated. Severe sepsis occurs when one or more of your body's organ is damaged from this inflammatory response. Okay, means severe sepsis is next step of sepsis. Okay, first sepsis and then severe sepsis. Severe sepsis happens when one or more of your body organ is damaged from this inflammatory response. To assign code for severe sepsis, it is compulsory That means you have to find out the term that any organ dysfunction or organ failure must be present in your patient's report. Then and then only you can assign code for severe sepsis. Okay, because severe sepsis occurs when one or more of your body organ is damaged. Then next step is septic shock. Septic shock is last and most severe stage of sepsis. Causes extremely low blood pressure and organ failure due to sepsis. Organ failure happens during severe sepsis, but when it causes extremely low blood pressure or any disease related to circulatory system, it call as septic shock. Okay. Treatment may include antibiotics, oxygen, and medication. So the first one is SIRS, then sepsis, and then severe sepsis, and then septic shock. Okay. When you go for any medical coding interview, at that time your interviewer going to ask you this type of question. Okay, what is sepsis, what is severe sepsis, what is septic shock, or what is sequencing of coding, like this. So be prepared for it. See here, these are the stages of sepsis: SIRS, then sepsis, then severe sepsis, and then septic shock. SIRS means your body starts showing these symptoms like increased temperature, increased heart rate, like this. Okay, WBC count increase. Then next step is sepsis. When your body shows any two symptoms of SIRS, and then plus confirmed or suspected infection, that is UTI or PNA or wound, etc. Okay. Then comes severe sepsis, where you have sepsis plus signs of organ failure. As I told you before, to code severe sepsis, any sign of organ failure or dysfunction must be there to code severe sepsis. Okay. Then last step is, or last stage is septic shock, in which severe sepsis is there, means sepsis plus any sign of organ failure or dysfunction plus extremely low BP. Okay. So these are the stages of sepsis: SIRS, then sepsis, then severe sepsis, and then septic shock. Next, we'll see coding guidelines for sepsis. For diagnosis of sepsis, assign appropriate code from underlying systemic infection. If the type of infection or causal organism is not specified, assign code A41.9, which is for sepsis unspecified organism. Okay. If organism is given who causes that infection, you have to choose code accordingly. This is the by default code for sepsis. Okay, sepsis unspecified organism, which is nothing but A41.9. A code from subcategory R65.2, which is for severe sepsis, should not be assigned unless severe sepsis or an associated acute organ dysfunction is documented. Right? To code severe sepsis, the term severe sepsis or any associated acute organ dysfunction or failure must be documented. Okay, and code for severe sepsis is R65.2. Okay, R65.2 is not a complete code. R65.20 or 21, this is complete word, but this is subcategory of the severe sepsis. Okay, the next character after 2, that will choose according to condition. Okay, for example, gram negative sepsis. A41.50 is for gram-negative sepsis, unspecified Staphylococcus sepsis. Okay, and A41.2, which is for sepsis due to unspecified Staphylococcus. In both the examples above, organism causing sepsis is identified. Therefore, A41.9 which is for sepsis unspecified organism, would not be appropriate, as this code would not be capture the highest degree of specificity found in the documentation. Okay. Do not use the additional code for severe sepsis unless documented as severe sepsis with acute organ dysfunction. Okay. In this example, they have given gram-negative sepsis. So we know causal organism for the sepsis. That is the reason why we not use A41.9, because A41.9, this code we have to use only when we have not specified organism. Okay. Then negative or inconclusive blood culture and sepsis. Negative or inconclusive blood cultures do not preclude a diagnosis of sepsis in patient with clinical evidence of the condition. However, the provider should be queried. Okay, if negative or inconclusive blood cultures are there, we have to query the provider. Urosepsis. The term urosepsis is a non-specific term. Okay. It has no default code in alphabetic index. Okay. If the provider use this term, he or she must be queried for the clarification. Sepsis with organ dysfunction. If a patient has sepsis and associated acute organ dysfunction or multiple organ dysfunction, which is also known as MOD. MOD, if you come across the term MOD, that means multiple organ dysfunction. Okay, follow the instruction for coding severe sepsis. Okay, you will get coding instruction below each and every code. We'll see here. I'll show you here. Just a minute. We have to go into the index. Okay. Now here we have to choose sepsis. Okay. Here you can see severe sepsis, code for severe sepsis. Severe sepsis. Okay. R65.20. And if you see here directly, R65.2, because this is subcategory of severe sepsis. Okay. If you go on this code, you can see here coding instructions applicable to these terms. Use additional code. Okay. If what type of failure is there, accordingly you have to choose the code from this categories. Okay. If kidney failure N17, respiratory failure J96, likewise. And here they also mention that code first underlying infection. Okay, this different kind of code. We'll go through these guidelines also now, but you can see here sepsis. Okay, so to code severe sepsis, first you have to code sepsis. Code first. You can see here code first A41.9 and this or any other code from this category. Okay. Okay. So next one is acute organ dysfunction that is not clearly associated with the sepsis. If a patient has sepsis and an acute organ dysfunction, but medical record documentation indicates that the acute organ dysfunction is related to medical condition other than sepsis, do not assign code from subcategory R65.2, which is for severe sepsis. Okay, if that acute organ dysfunction is not associated with sepsis, then you should not use R65.2. Okay, an acute organ dysfunction must be associated with the sepsis in order to assign severe sepsis code. Okay, if the documentation is not clear, query the provider. Okay. To code R65.2 severe sepsis, the documentation must be clear that organ dysfunction is due to sepsis. For example, sepsis and acute respiratory failure due to COPD exacerbation. Okay, here we'll choose A41.9, which is for sepsis unspecified organism, then J44.1, which is for COPD with exacerbation, then J96.00, which is for acute respiratory failure. Okay, here, although acute organ dysfunction is present in the form of acute respiratory failure, we should not use severe sepsis code. Okay, because acute respiratory failure is attributed to COPD exacerbation rather than the sepsis. You can see here they mention that acute respiratory failure is due to COPD. They already mentioned it. Okay, so this respiratory failure is not related to sepsis. That's the reason why we'll not use R65.2 in this example. Okay, clear? Next one is severe sepsis. Guidelines for severe sepsis. The coding of severe sepsis require minimum of 2 codes. As I told you earlier, first code for underlying systemic infection from like A41.9, okay, or any other code. If causal organism is specified, then you have to choose accordingly, followed by the code from subcategory R65.2, which is for severe sepsis. If causal organism is not documented, assign A41.9, which is for sepsis unspecified organism, and the additional code for associated acute organ dysfunction is also required. Okay, so our coding must be A41.9, then R65.2, and then additionally we have to code the associated organ dysfunction. Okay, then next one is septic shock. Septic shock generally refers to circulatory failure associated with severe sepsis, and therefore it represents a type of acute organ dysfunction. Okay, for cases of severe septic shock, the code for systemic infection should be sequenced first, followed by code R65.21, which is for severe sepsis with septic shock. Okay, if only severe sepsis is there, then we have to choose R65.20. But here R65.21 because septic shock is there. Okay, or code T81.12, which is for post-procedural septic shock. Any additional codes for other acute organ dysfunction should be assigned as additional code. Okay. Sequencing of severe sepsis. If severe sepsis is present on admission and meet the definition of principal diagnosis, the underlying systemic infection should be assigned as a primary diagnosis, followed by appropriate code from subcategory R65.2. as required by sequencing rule in the tabular list. As I told you earlier, to code severe sepsis, first we need to assign infection code like A41.9 and then we'll code R65.2. Okay, and then any associated organ failure. Next guideline is sepsis or severe sepsis with localized infection. Just a minute. Okay. If the reason for admission is sepsis or severe sepsis and a localized infection such as pneumonia or cellulitis, a code or codes for the underlying systemic infection should be assigned first and the code for localized infection should be assigned as secondary diagnosis. Okay, if the patient has severe sepsis, a code from subcategory R65.2 should be assigned as a secondary diagnosis. Okay, if any patient come with sepsis or severe sepsis plus localized infections such as pneumonia and cellulitis, in that case, first you have to code underlying systemic infection, okay, and then the localized infection. If the patient is admitted with localized infection such as pneumonia and sepsis, severe sepsis doesn't develop until after admission, the localized infection should be assigned first, followed by appropriate sepsis or severe sepsis code. Here in this guideline is for patient is already admitted for localized infection. Right, so treatment is going on for localized infection. In that case, you have to first code localized infection, and then after the patient develops sepsis or severe sepsis, that's the reason why we'll code severe sepsis or sepsis as a secondary diagnosis. Okay, means it depends on reason for admission. Okay, if the reason for admission is sepsis and localized infection, then we have to choose sepsis as a primary. But if the patient is already admitted for localized infection, in that case, we have to choose localized infection as a primary. Okay. Next is sepsis due to post-procedural infection. Documentation of causal relationship. As with all post-procedural complications, code assignment is based on provider's documentation of the relationship between the infection and the procedure. Okay, sepsis due to post-procedural infection. For infections following a procedure, a code from T81.40 to T81.43, which is for infection following a procedure, or a code from O86.00 to O86.03, infection of obstetric surgical wound. Remember, I told you that if patient is pregnant, we have to start our coding. Our primary code must be from this pregnancy chapter, which is started with O letter. Okay, that's the reason why if infection of obstetric surgical wound, we have to choose O86.00 to O86.03. That identifies the site of infection should be coded first, if none. Okay, then assign an additional code for sepsis following a procedure T81.44 or sepsis following an obstetrical procedure O86.04, and then use an additional code to identify the infectious agent, means like A41.9. Okay, so our first code must be if the sepsis due to post-procedural infection, then our first code must be from T81.40 to T81.43. Or if the patient is pregnant, or if it is infection of obstetric surgical wound, the primary code must be from 086.00 to 086.03, and the secondary code from T81.44, which is for sepsis following the procedure, or if it is obstetric then 086.04, and then additional we have to code infectious agent like A41.9. If the patient has severe sepsis, the appropriate code from subcategory R65.2 should be assigned with additional code for any acute organ failure. Other guidelines are same as severe sepsis. Okay, but primary we have to code this two. We have to choose these two codes. Okay. Next guideline is post-procedural infection and post-procedural septic shock. If the post-procedural infection result in septic shock, the ICD-10-CM Chapter 1 guidelines instruct to first code sepsis due to post-procedural infection. Okay, like we just saw in the previous guideline. Okay, followed by code T81.12 post-procedural septic shock. We have separate code for post-procedural septic shock. Okay, we didn't have code for post-procedural severe sepsis. We have code for post-procedural sepsis and post-procedural septic shock. Okay, so if post-procedural septic shock is there, then we have to code those previous two codes, then sepsis, and then post-procedural septic shock code, and then any related organ failure. Okay, we'll see one example. A 52-year-old male is admitted with septic shock due to a post-operative infection of the small intestine following an appendectomy that has caused acute liver failure. In this case, we'll first code T81.43XA, which is for infection following a procedure, organ and space surgical site, initial encounter. Okay, then we have to code T81.44XA, which is for sepsis following a procedure, initial encounter. Then we have to code T41.9, which is for sepsis, unspecified organism. Then T81.12XA, which is for post-procedural septic shock, initial encounter. And then K72.00, which is for acute and subacute hepatic failure without code. If here this patient has severe sepsis, in that case we here instead of T81.12XA we must be coded R65.20. Okay, so this is the summary of all the ICD codes for sepsis. Okay, ICD codes for sepsis coding. If the term sepsis is there, we have to code from A41.9. This is unspecified code for sepsis. If causal organism is specified, then you have to choose accordingly from this category. Okay, but unspecified or default code is A41.9. Then if severe sepsis is there, our primary code must be A41.9, which is for sepsis. Then R65.20. Okay, 20 is for severe sepsis without septic shock. And plus, additionally, we have to code any related acute organ dysfunction. Okay, then if septic shock is there, our primary code should be A41.9, then R65.21. Okay, if septic shock is there, then R65.21. Okay, because this code description is severe sepsis with septic shock, right? And then additionally any related organ dysfunction. Okay. At least you have to by heart this table. This table is very much important. Okay, in case of your medical coding interview, medical coding exam, or daily medical coding. Okay, then we'll see sepsis coding for post-procedural sepsis. Post-procedural sepsis is there. Then we have to code T81.40 to T81.43, which is for infection following a procedure. Or if just give me wait here. So this is table for post-procedural sepsis, severe sepsis, and septic shock. If post-procedural sepsis is there, we have to start our coding from T81.40 to T81.43, which is for infection following a procedure. Okay, or if the obstetric surgical wound is there, or infection of obstetric surgical wound is there, then O86.00 to O86.03. So our first primary code should be from this category only. Okay. Then secondary code must be from T81.44, which is for sepsis following procedure, or if it is obstetric, then O86.04. And then we have to code A41.9. Okay, for sepsis. If it is severe sepsis, then coding changes from here 1, 2, 3, fourth code. Okay, fourth code must be R65.20. If severe sepsis is there, other codes are same. And additionally, we have to code any acute organ dysfunction. Okay, and if post-procedural septic shock is there, then also till A41.9 it is same. It changes from 1, 2, 3, 4. Fourth code must be T81.12XA. Okay, which is for post-procedural septic shock. Okay, here there is if even though patient is pregnant, or it is this infection is related to obstetric wound, there is no need of O code, because we already given or assigned primary and secondary code from O category. Okay, that's the reason why there is only code for post-procedural septic shock, which is common for obstetric wound and normal infection also, normal post-procedural infection also. And lastly, we have to additionally code any acute organ dysfunction. This is clear. This is all about sepsis coding. Okay. Now we'll see our next type of infection, methicillin resistant staphylococcus aureus, MRSA. Methicillin resistant staphylococcus aureus, MRSA. Okay. MRSA stands for methicillin resistant staphylococcus aureus, a type of bacteria. Okay. MRSA skin infections often develop around open sores like cuts, scrapes, or bites, but they also can affect intact skin. Red, swollen, painful bumps appears that sometimes ooze fluid or pus, called an abscess. Some people also get fever. Okay, we'll see guidelines for the selection and sequencing of MRSA. Selection and sequencing of MRSA code. Combination codes for MRSA infection. When a patient is diagnosed with an infection that is due to methicillin-resistant Staphylococcus aureus (MRSA), and that infection has combination code that includes a causal organism, for example, sepsis or pneumonia, assign appropriate combination code for the condition. For example, code A41.02 is for sepsis due to MRSA, or code J15.212 is for pneumonia due to MRSA. Okay, you will find combination code with MRSA. You have to choose accordingly. Okay, next guideline is methicillin susceptible Staphylococcus aureus and MRSA colonization. The condition or state of being colonized or carrying MSSA or MRSA is called colonization or carriage, while an individual person is described as colonized or being a carrier. Okay, means the condition or state of being colonized or carrying MSSA or MRSA is called colonization or carriage. Colonization means that MSSA or MRSA is present on or in the body without necessarily causing illness. Okay, means that patient is carrier of MSSA or MRSA, whether it is symptomatic or asymptomatic. Okay, a positive MRSA colonization test might be documented by the provider as MRSA screen positive or MRSA nasal swab positive. Okay. Basically, here you have to keep it in mind that there are combination codes for MRSA infection, and you have to choose accordingly. Next next type of infection is Zika virus infection. Zika virus disease is an emerging viral disease transmitted through a bite of infected mosquitoes. Okay, if infected mosquito bites you, you may cause Zika virus disease. Okay, symptoms like most of the infected person are asymptomatic or show mild symptoms like fever, rash, conjunctivitis, or body ache, joint pain, like this. Okay, severe form of disease requires hospitalization is uncommon and rare. Okay, there is no vaccine or drug available to prevent or treat Zika virus disease at present. Okay, there is no vaccine for Zika virus. Zika virus infection during pregnancy can cause infants to be born with microcephaly. Microcephaly means with small head, okay, than normal size, and other congenital malformations. Okay, see here. This is the normal size of head, but this is microcephaly head, where size of head is smaller than normal size. Okay. Code only confirmed cases. Code only a confirmed diagnosis of Zika virus. A92.5, which is for Zika virus disease, as documented by the provider. If a provider gives you confirmation about this diagnosis, then and only you have to choose A92.5, which is for Zika virus disease. Okay. In this context, confirmation does not require documentation of type of test performed. The provider's diagnostic test statement that the condition is confirmed is sufficient. If provider is confirmed that this condition is confirmed, then you have to or you are able to choose the A92.5 code. If the provider documents suspected, possible, or probable Zika, do not assign code A92.5. Instead, assign a code which explaining the reason for encounters such as symptoms like fever, rash, or joint pain, or Z20.821 contact with and suspected exposure to Zika virus. Okay, if means if the provider doesn't give you proper confirmation about this disease, if provider documents suspected, possible, or probable Zika virus infection or disease, then you have to choose Z20.821, which is for exposure to Zika virus, or you have to code the associated means reason for encounter, which are mostly symptoms like fever, rash, or joint pain. Clear? Now we'll see coronavirus infection. Coronavirus disease, which is also known as COVID-19. Okay, coronavirus is a family of viruses that can cause illnesses such as common cold, severe acute respiratory syndrome, SARS. That's the reason why it is also known as SARS, SARS-CoV viruses, like this. Okay, and middle is respiratory syndrome, MERS. Okay, many people with COVID-19 have mild to moderate symptoms and can recover on their own. Okay, but many people also die because of COVID-19. You know that this is very dangerous disease. If any for those patients or for those peoples which are at higher risk, which includes older peoples or peoples with existing medical conditions like cardiovascular diseases, diabetes, chronic respiratory diseases, or cancer. Okay, these peoples are at higher risk. Okay, getting COVID-19 vaccine help prevent serious illness and need for hospitalization care due to COVID-19 and death from COVID-19. If you get proper vaccination of COVID-19, the chances of serious illness or need of hospital care or death are less. The common signs and symptoms are like fever, cough, fatigue, loss of taste and smell, diarrhea, headache, rash, conjunctivitis, itches and pain, sore throat, like this. Okay. People infected with coronavirus, including Delta, can also be asymptomatic. They may not show any symptoms. All the people not showing any symptom, right? Some people show fever, cough, some may lose their taste or smell, some have headache, or a few people have no symptoms, means they are asymptomatic. Okay, even though they get infected with coronavirus. That's the main reason this virus get spread. Correct? We'll see guidelines for coding coronavirus infection. Infection due to SARS-CoV-2. Okay. Code only confirm cases. This is the main guideline for each and every disease. That is, you have to code only confirm cases. Okay. Only confirm diagnosis of 2019 novel coronavirus, which is also known as COVID-19, as documented by provider or documentation of positive COVID-19 test result. Okay. For a confirmed diagnosis, assign code U07.1, which is for COVID-19. Then, if the provider documents suspected, possible, probable, or inconclusive COVID-19, do not assign U07.1. Instead, code sign and symptom. This guideline is common for each and every disease. If if the provider give you confirmation about any disease, then only you have to code that particular disease code. Otherwise, you have to go for sign and symptoms. Okay. Then sequencing of codes. When COVID-19 meets the definition of principal diagnosis code U07.1, which is for COVID-19, should be sequenced first, followed by appropriate codes for associated manifestations, except when another guidelines require that certain codes does sequence first. Because few such as obstetric, sepsis, or transplant complication, these types of code requires primary position, or you must code this type of code like I said earlier, obstetric code. If you code for any pregnant patient, your first code must be O code. Okay, in that case, you can't code U07.1 as a primary, right? If sepsis is there, you can't code U07.1 as a primary. You have to go for sepsis as a primary. If transplant complications are there, you have to code that code primary and then U07.1. Otherwise, you have to code U07.1 as a primary. Okay. Then acute respiratory manifestation of COVID-19. When the reason for encounter or admission is a respiratory manifestation of COVID-19, assign code U07.1 as a primary or first listed diagnosis, and assign code for respiratory manifestations as additional codes. Okay. The following conditions are examples of common respiratory manifestations of COVID-19: pneumonia, acute bronchitis, lower respiratory infection, acute respiratory distress syndrome, acute respiratory failure. If you came across these conditions, which are manifestation, and your provider is documented that this certain condition are manifestations of COVID-19, then you have to choose U07.9, which is for COVID-19 as a primary, and then you have to, as a secondary or additionally, you have to code these conditions. Okay. Okay. Next guideline is non-respiratory manifestations of COVID-19. When the reason for encounter or admission is non-respiratory manifestations like viral enteritis of COVID-19, assign code U07.1 as a primary and assign code for those manifestation as additional code. The same guideline for both. If it is respiratory manifestations or non-respiratory manifestations of COVID-19, if your provider given it is related to COVID-19, you have to code U07.1 as a primary, then the additional code for manifestations. Okay. Then exposure to COVID-19. For asymptomatic individuals with actual or suspected exposure to COVID-19, assign code Z20.822, contact with and suspected exposure to COVID-19. For symptomatic individuals with actual or suspected exposure to COVID-19 and infection has been ruled out or test results are inconclusive or unknown, assign code Z20.822, contact with or suspected exposure to COVID-19. Okay. Means even though patient is symptomatic or asymptomatic, exposure to COVID-19 code is Z20.822. Okay. but the sequencing is different because obviously symptomatic individual comes with symptoms like fever or cough, cold, something. Okay, and in that case, you have to primary code those symptoms and then you have to assign Z20.822. But if patient is asymptomatic, this is the primary code Z20.822 because you have no other option, right? Then screening for COVID-19. For screening for COVID-19, including pre-operative testing, assign code Z11.52 is for encounter for screening for COVID-19. Okay, Z11.52 is for screening for COVID-19. Then we have signs and symptoms without definitive diagnosis of COVID-19. For patients presenting with any sign and symptom associated with COVID-19 such as fever, cold, cough, etc., or loss of taste, odor, etc. But a definitive diagnosis has not been established, assign an appropriate code for each presenting sign and symptom. Okay, means if COVID-19 is not confirmed, you should not code COVID-19. You have to go for sign and symptom only. Okay. If a patient with sign and symptom with COVID-19 also has an actual or suspected contact with or exposure to COVID-19, assign Z20.822 contact with exposure or exposure to COVID-19 as additional code. As I told you in earlier guideline, if sign and symptoms are present and means sign and symptom associated with COVID-19 are there and has actual or suspected contact with or exposure to COVID-19, then at that time first we have to go for sign and symptom and then as additionally we have to code Z20.822. Okay. Asymptomatic individuals who test positive for COVID-19. Although the individual is asymptomatic, the individual has tested positive and is considered to have the COVID-19 infection. Okay, means as I told you earlier, some people didn't show any sign and symptoms of COVID-19, but they have infection. Okay, so if any patient who is asymptomatic but their test results are positive for COVID-19, in that case we have to code COVID-19. Okay, personal history of COVID-19. For patient with history of COVID-19, assign code Z86.16, which is for personal history of COVID-19. Then follow-up visits after COVID-19 infection has resolved. A patient who previously has COVID-19 without residual symptoms or condition and are being seen for follow-up evaluation and COVID-19 result are negative. In that case, assign Z094, which is for encounter for follow-up examination after completed treatment for condition other than malignant neoplasm. Plus, additionally, you have to code Z86.16, which is for personal history of COVID-19. Okay. Then next guideline is encounter for antibody testing. For antibody testing encounter that is not being performed to confirm a current COVID-19 infection, nor is a follow-up test after resolution of COVID-19, assign Z01.84, which is for encounter for antibody response examination. If patient come only for antibody testing, okay, in that case you have to use this code Z01.84. Then we have multisystem inflammatory syndrome. Multisystem inflammatory syndrome. For individuals with multisystem inflammatory syndrome (MIS) and COVID-19, assign code U07.1, which is for COVID-19, as a primary, and assign M35.81, which is for multisystem inflammatory syndrome (MIS), as additional code. Okay. If patient has both MIS and COVID-19, your primary code must be COVID-19 code and then MIS code. Okay. If individual with history of COVID-19 and he develop MIS, assign MIS code and then U09.9, which is for post COVID-19 condition unspecified. Okay. If patient has both MIS and COVID-19 in active state, in that case you have to choose COVID-19 code as a primary and then MIS code. But if individual develops MIS, okay, and that patient has history of COVID-19, in that case you have to code MIS code as a primary and then choose U09.9, which is for a post-COVID condition as a second. Okay. In that case, you will not going to choose U07.1, which is for current COVID-19 infection. If an individual with a known or suspected exposure to COVID-19 and no current COVID-19 infection or history of COVID-19 develops MIS, assign codes M35.81 and Z20.822, contact with and exposure to COVID-19. Okay, means if patient suspected exposure to COVID-19 but no current COVID-19 infection or history is there, and he or she develops MIS, in that case our primary code must be MIS code followed by Z20.822. If history is there, in that case we'll code U09.9 as a secondary code. Additional codes should be assigned for any associated complications of MS. Then post-COVID-19 conditions. For sequela of COVID-19 or associated symptoms or conditions that develop following a previous COVID-19 infection, assign a code for the specific symptoms or conditions related to previous COVID-19 infection. If none, and code U09.9, which is for post COVID-19 condition unspecified. Okay. Code U09.9 should not be assigned for manifestation of any active or current COVID-19 infection. Okay, if any manifestation of current or active COVID-19 infection is there, you should not assign U09.9 because U09.9 is for post COVID-19 condition. Okay, if the patient has a condition associated with previous COVID-19 infection and develops a new active or current COVID-19 infection, code U09.9 may be assigned in conjunction with code U07.1, which is for active COVID-19, to identify that person also has a condition associated with previous COVID-19 infection. Okay. Because even though you previously got infected with COVID-19, you can again get infected with COVID-19. In that case, we have to choose our codes accordingly. Okay. Under immunization for COVID-19 status. Okay. Code Z28.310 is used for unvaccinated for COVID-19. which is a sign when patient has not received a COVID-19 vaccine. And code Z28.311, which is for partially vaccinated for COVID-19, which is a sign when patient has been partially vaccinated for COVID-19. If you do only one dose of COVID vaccine, in that case, that means you are partially vaccinated, or that patient is partially vaccinated. In that case, you have to choose Z28.311. Okay, and not if any patient is not at all vaccinated, if he or she didn't receive any dose of vaccination of COVID-19, that case we have to choose Z28.310. Okay, so these are all COVID-19 guidelines. I know these are very much confusing and there are lots of guidelines, but I try to cover up all those codes in this table of ICD codes for COVID-19. Okay, if the term COVID-19 or positive diagnosis of COVID-19 is there, then you have to choose U07.1, which is for COVID-19. An additional diagnosis should be used to report manifestations, okay, of COVID-19. Then, if contact with and or suspected exposure to COVID-19, in that case you have to use Z20.822. If the patient is symptomatic, code sign and symptoms and then code Z20.822. If the patient is asymptomatic, you will directly use Z20.822 as a primary. Okay. For late effects of COVID-19 or post-COVID-19 conditions, you have to choose U09.9. For current infection, first code current symptoms or conditions, then add code U09.9 as secondary diagnosis. Okay. Then for personal history of COVID-19, Z86.116. Then follow-up visits after COVID-19 has resolved without residual symptoms or condition. In that case, we will choose Z09. If encounter for antibody testing, Z01.84 is there. Screening for COVID-19, Z11.52 is there. Unvaccinated for COVID-19, Z28.310 is there. And partially vaccinated for COVID-19, Z28.311. Okay, if you go through this table, if you again and again go through this table, you will get understand and you will buy this course. Okay. Now we'll see some example. We'll solve some examples. Are you ready? Please turn on your mic.
Yes, ma'am.
Yeah. So our first question is, a 19-year-old patient is diagnosed with viral meningitis. What is appropriate ICD-10 RCM code? We'll see. We'll try to find out this code. Okay. By ICD-10 data.com. What we need to look for? Viral meningitis. Okay. Here we have to go onto the index. Okay, and here we have specified that it is viral. Okay, We have to look for viral term. We got one code here. See here, it is mentioned viral meningitis unspecified. So the code is A87.9. So our answer is B. A87.9, which is for viral meningitis. Okay. Then next question is, a patient represents for um, a patient presents for result of HIV testing which were negative. What is appropriate ICD-10 CM code? Can anyone tell me? You didn't need to go through any search.
Z21, ma'am.
Which one? Come again.
G
Z21.
G21. Yes.
No. Read the question carefully. Patient present for result of HIV testing which were negative.
Option, ma'am.
Which one?
G71.7.
Correct. Good. This is code for HIV testing with negative result. Okay. Or just for counseling. Correct. Then we have our next question is, when a patient has a blood test for HIV that is inconclusive, what ICD-10 code is assigned? Options are Z21, Z11.4, B20 or R75 for inconclusive HIV test. If you have that table I showed you at the starting of this session, you will get the answer.
R75, ma'am.
Correct. Very nice. The answer is D, R75, which is for HIV inconclusive serology or blood test. Okay. Next question is, pneumonia due to adenovirus. What is ICD-10 code? B34.0, J12.0, B97.0 or B30.1. Go through ICD10data.com as I show you and then tell me. I'll give you
J12.0, ma'am.
J12.0. Correct. We'll go through once. Okay. Here we have to go on pneumonia, P term, pneumonia, and here you can see adenovirus. Okay, pneumonia due to adenovirus. We got this code J12.0. Okay, so this is our answer J12.0, which is for pneumonia due to adenovirus. Next question is, a patient has a history of MRSA. She has just been diagnosed with pneumonia due to possible Staphylococcus aureus. What ICD codes are reported? J18.9 and what happened here? Come again? You're right. Come again.
Option C, ma'am, J18.9.
J 18.9 and Z 86.14. Okay. So this is the correct answer for history of MRSA. We code Z 86.14 and for pneumonia due to pneumonia J 18.9 because it is due to possible Staphylococcus aureus. It is not confirmed that Staphylococcus aureus is this infection is due to Staphylococcus is confirmed, not confirmed, right? That's the reason why we'll choose only pneumonia code J18.9 plus history code of MRSA. Well done, girls. Good. So these are the answers. Okay. Once again, thank you for your attention and making this session interactive. Thank you. If you find these sessions interesting, if you want to join our medical coding training program, you will go to this given link below www.greatonlinetraining.com and register yourself. Okay, once again, thank you. Bye bye. Take care.
Thank you, ma'am. Bye, ma'am.
Bye bye. Welcome everyone to Great Online Training. This is day 9 and currently we are discussing ICD coding guidelines chapter wise, right? Uh, in previous session we discussed guidelines about chapter 1 and today we're going to discuss guidelines of chapter 2 which is of neoplasm and code ranges from C00 to D49. Okay, myself Nikita. I am a CPC certified medical coding trainer in Great Online Training. If you find this training session interesting, please go to the given link below, which is www.greatonlinetraining.com and register yourself. Okay, so let's start. In this session, we're going to discuss about the following topics like neoplasm and types of neoplasm, then different terminologies used in neoplasm diagnosis or neoplasm coding. So today we'll discuss about neoplasm and types of neoplasm. Then we'll discuss about different terminologies used regarding neoplasm. Then we'll see ICD coding guidelines like first guideline is for admission or encounter for treatment of primary site. If this has happened, then which type of code will we need to choose. Okay, then treatment for secondary site, then coding and sequencing of complications, then uh, primary malignancy previously exists, then admission encounter involving chemotherapy, immunotherapy and radiation therapy, then admission encounter to determine extent of malignancy. Okay, then signs, symptoms and abnormal finding listing in chapter 18 associated with neoplasm are there. Then which type of code or how we're going to code that report, that we're going to see. Again we'll see if encounter for pain control management, then I will going to code it. Then malignancy in two or more non-contagious sites is there, then I will code. Then disseminated malignant neoplasm unspecified, then malignant neoplasm without specification of site, if it is there, which code we're going to use, that we'll see. And lastly we'll see sequencing of neoplasm codes, and then after we'll solve some questions. Okay, so let's start. What do you know about neoplasm? Can anyone tell me anything you know about neoplasm? You can share. what is neoplasm, or neoplasm and cancer is same or different, or if you know any type of neoplasm that you can share. At least you can tell me what is cancer or what is neoplasm.
Ma'am, it's a
It's a
tumor.
tumor. Okay. And is neoplasm and cancer is same or different? Not sure. It's okay.
Same, ma'am.
Yeah. I'll tell you. Don't worry. Okay. So a neoplasm is the abnormal tissue growth due to uncontrolled division of cells that can be benign or malignant. Benign means non-cancerous, whereas malignant is cancerous. So basically, is neoplasm and cancer is not same. Okay, both the terms are different because neoplasm can be benign, means non-cancerous growth, or can be malignant, means cancerous. Okay, all the neoplasms are not cancerous. Clear? Is it clear? Because neoplasms are of two type. One is of benign type, which is non-cancerous, and second one is malignant, which is cancerous. Okay, or can be precancerous tumors. Okay, so these are the types of neoplasm. It is neoplasm is nothing but abnormal tissue growth due to uncontrolled division of cells. Okay, you can see here in this diagram, cancer cells dividing tremendously while normal cells are in normal shape and dividing normally, right? Then example of benign neoplasms are like skin tags, skin moles, or uterine fibroids and cysts. These are non means not creating much problem, right? But sometimes we need to remove them also. Those are not spreading to other organs, but uh, they cause some problem like uterine fibroid. They cause bleeding in women. Because of that, they need to remove it, right? But they are not life threatening or not too much dangerous like malignant neoplasms. Okay, so examples of malignant neoplasms are like lung cancer, breast cancer, or any skin cancer, or any type of cancer is the example of malignant neoplasm. Okay, examples of liquid neoplasms are leukemia and lymphoma. Okay, which is cancerous is called malignant neoplasm, and non-cancerous neoplasms are benign neoplasm like skin tags, skin moles, fibroids, and cysts. This is clear. So neoplasm and cancer are not same. Few neoplasms are benign, which are non-cancerous, whereas other are malignant, which are cancerous or precancerous tumor. Okay, so there are three types of neoplasm: benign, precancerous, and malignant. You can see here benign tumor. Benign tumor is under the skin. Okay, it is not spreading anywhere, but malignant tumor is spreading. Okay, to other organs. Okay, these tumor cells are spreading to other organs. So benign neoplasms grow slowly and can't spread to another tissues like skin, for example, skin tags, skin moles, fibroid, and cysts. Precancerous neoplasm is another type of neoplasm. These are growths that have not yet spread but have potential to become cancerous. Okay, precancerous neoplasms are can become they have potential to become cancerous but not yet spread. That's the reason why they call it as precancerous neoplasms. And the third type is metastatic neoplasm. This is a cancerous growth. Metastatic neoplasm means cancerous growth. Malignant neoplasm can grow in any body part, and metastatize means it can be spread to any other part of the body. For example, carcinomas, sarcomas, myelomas, leukemia, lymphomas. Carcinomas making about 90% of all cancer cases. They are originated in your epithelial tissues, such as skin or lining of your organs. Okay, these are called carcinomas. Then sarcomas are begins in your connective tissues like your bones, cartilage, muscles, tendons, and fat. Whereas myelomas, which are also known as multiple myelomas, forms in plasma cells, means your immune cells of your bone marrow. Okay, leukemias are also known as blood cancers. Correct? Leukemias are also known as blood cancers, and it is cancer of bone marrow because blood forms in bone marrow. So it is cancer of bone marrow. And the next type is okay. So next type is lymphomas. Lymphomas develops in glands or nodes of your lymphatic system. Okay, so carcinomas are normal cancers. Okay, mostly 90% cancers are carcinomas, develop under epithelial tissues, whereas sarcomas are connective tissue cancer. Okay, myelomas are like multiple myelomas form in plasma cells, means your human cells of immune cells of bone marrow. Then leukemias are also known as blood cancers, which is nothing but cancer of bone marrow. And lymphomas are developed in glands or nodes of your lymphatic system. Clear? So this is three type of neoplasms: benign neoplasm, which are non-cancerous; precancerous neoplasm, which are not yet spread but have potential to become cancerous. Okay, and third is metastatic neoplasm, which is cancerous and can be spread to another organ. Now we'll see terminologies regarding cancer or neoplasm. Primary neoplasm or primary cancer or primary malignant neoplasm means primary means related to where from where it is originated. Okay, then secondary means where it spread to which organ. It is called metastasis. Okay, metastasis to secondary site is called secondary neoplasm. Okay, then in situ means it is early stage of cancer before spreading. Okay, early stage of cancer before spreading is called in situ. Benign means not yet spread. Okay, or non-cancerous. Uncertain behavior means mass is neither benign or malignant. Okay, uncertain behavior means the behavior of that mass is not yet identified, means it is benign or malignant, that not yet identified. Then unspecified behavior means provider has not or cannot determine the behavior. Okay, here uncertain behavior means behavior can't be identified. Okay, yet Whereas unspecified behavior means provider has not or cannot determine the behavior. You can see here in diagram. Primary tumor, the cell detach from the tumor and then invasion happens and it transport through blood vessels or blood vessel and extravasation is there, then micrometastasis, then colonization, and then macrometastasis happen. Okay, and it forms secondary tumor. It is clear? Okay, now we'll start our ICD coding guidelines for neoplasm chapter. Okay, this chapter contains the codes for most benign and all malignant neoplasm. Okay, mostly all the benign and malignant neoplasms covered in this chapter. Okay, code ranges from C to D, right? Certain benign neoplasms such as prostatic adenomas may be found in the specific body system chapters. Okay, because few codes like prostatic adenomas you will find in specific chapters, right? To properly code a neoplasm, it is necessary to determine from the record if the neoplasm is benign, in situ, malignant, or of uncertain histologic behavior. Okay, if malignant, any secondary metastatic sites should also be determined. Okay, obviously, if it is malignant, it must be there must be first something primary site is there and secondary site is also there. So you have to search for it in your reports, in your patient's report. The table of neoplasm should be used to identify the correct topography code. In some cases, such as malignant melanoma and certain neuroendocrine tumors, the morphology means histology is included in category and codes. Okay, to search for neoplasm to make it easier, we have or these codes are arranged in table of neoplasm. Okay, I'll show you how it is arranged. I can show you here. Here, icd10data.com. Here you can see in index ICD-10 CM index, external cause index, table of drug, and lastly table of neoplasm. If you click here, okay, we'll see this index again. Now you can see here name is change, table of neoplasm. Okay, now here you have to search for your site, specific site. If we need to search code for breast cancer, then we'll go on B and type here breast. Okay, see here you can find breast neoplasm, and these are the types. Okay, different types. Neoplasm codes are divided into 6 categories: malignant primary, malignant secondary, okay, then cancer in situ, then benign, then uncertain behavior, and lastly unspecified behavior. Okay, like this table is divided. Okay, we'll see next guideline. Primary malignant neoplasm overlapping site boundaries. Overlapping implies that the sites involved are contiguous. Contiguous means the sites are next to each other. Okay. A neoplasm that overlaps contiguous sites and whose point of origin cannot be determined should be classified to the subcategory point 8. Okay. means point 8 is designated to overlapping lesion. Okay, if any code consists point 8 in subcategory, it means overlapping lesion, unless the combination is specifically indexed elsewhere. For example, overlapping tongue primary carcinoma of the tip and ventral surface of the tongue. Okay, here you can see overlapping tongue primary carcinoma of the tip and ventral surface of the tongue. Means these are two different sides, okay, of the tongue. It is not known which of the site the tumor originated. Okay, we don't know in this example. We don't know about the origination of the tumor, whether it is tongue tip or ventral surface. Okay, we don't know the origin of the tumor. That's the reason why we'll assign C02.8 code, which is for malignant neoplasm of overlapping lesion of tongue. Okay, if our provider is specifically mentioned that it is originated from tongue tip, okay, or originated from ventral surface, then we'll code accordingly. That site as a primary. Okay, for multiple neoplasms of the same site that are not contagious, such as tumors in different quadrants of the same breast. Okay, if tumors in different quadrants of the same breast, means in the right breast, if two quadrants have tumors, then code for each side should be assigned. Okay, the next guideline is malignant neoplasm of ectopic tissue. Malignant neoplasm of ectopic tissue should be coded to the site of origin documented. For example, ectopic pancreatic malignant neoplasm is coded to unspecified malignant neoplasm of pancreas, which is nothing but C25.9. Don't worry about it. You don't need to by heart these codes. Okay, you have to learn how to search these codes. Okay, or how to give proper sequencing or select proper code for that scenario, okay, or for that condition, because these codes can be changed in any year. These codes are updated every year. That's the reason why you don't need to by heart any code. You just know how to search and in which category you will going to find this code. Okay. So the first guideline is admission or encounter for treatment of primary site. If treatment is directed at the primary site, designate the primary malignancy as principal or first listed diagnosis. Okay, means if treatment directed towards a primary site, you have to code that primary cancer as a principal diagnosis. If administration of chemotherapy, immunotherapy, or external beam radiation therapy is chiefly responsible for occasion of admission or encounter, okay, means if patient is came to the hospital just for chemotherapy, immunotherapy, or external beam radiation therapy, means therapy of cancer. In that case, you have to assign appropriate Z51 point. We have few characters. Those codes we have to use as a first listed or principal diagnosis. Principal or first listed diagnosis means you have to give that code or assign that code as a primary. Okay, while coding there there is number for diagnosis. Okay, so at the first number you have to give this code. Okay, that means first listed on principal diagnosis. Okay, so Z51 point, accordingly you have to choose the code, but Z51 is common, and other characters changes according to chemotherapy, immunotherapy, and external beam radiation therapy. So if admission is for cancer therapy, you have to choose Z51 code for as a primary service. Then admission encounter for treatment of secondary site. When a patient is admitted because of primary neoplasm with metastasis and the treatment is directed towards secondary site only. Okay, means patient has primary neoplasm with metastasis. That primary neoplasm spread somewhere else and treatment is directed towards that secondary site only. In that case, you have to code that secondary neoplasm as primary diagnosis. Okay, even though primary malignancy is still present. Okay, because treatment is for secondary neoplasm. Means basically in these two guidelines, they want to say that uh, your preference or sequencing preference or primary diagnosis must be depend on the treatment, okay, or reason for encounter. If a reason for encounter is primary site of cancer, then you have to code primary site as a principal diagnosis. If reason for encounter is cancer therapy, then you have to code therapy code, which is nothing but Z51 codes. These are primary codes. If it is encounter for treatment of secondary site, then you have to code secondary neoplasm as a principal diagnosis. Okay. Next one is coding and sequencing of complications. Complications associated with malignancy or with therapy thereof are subject to following guidelines. Okay, the guidelines are like, if anemia associated with malignancy, okay, anemia associated with malignancy, the appropriate code for malignancy is sequence as a principal diagnosis followed by appropriate code for anemia. Okay, if because this anemia is associated with malignancy. Okay, that's the reason why our principal code is that malignancy code, that's cancer code, followed by D63.0, which is for anemia in neoplastic disease. We have to choose this code D63.0 because this anemia is associated with neoplastic disease. You can't choose other anemia code. Okay, but our primary or principal diagnosis is cancer followed by D63.0. Next, anemia associated with chemotherapy, immunotherapy, and radiation therapy, means cancer therapy. When encounter is for management of anemia associated with an adverse effects of administrations of chemotherapy or immunotherapy, and the only treatment is for anemia. Okay, here if the treatment is for anemia, the anemia code is sequenced first, followed by appropriate code for neoplasm and adverse effects. Okay, when anemia is associated with cancer therapy, in that case you have to code anemia as a primary, then that neoplasm, and then adverse effect, which is code used for adverse effect is T45.1x5. Okay, and so on. The characters, other characters are also required, dash means. Okay, this description is adverse effect of anti-neoplastic and immunosuppressive drugs. Then third guideline is management of dehydration due to malignancy. Okay. If encounter is for management of dehydration due to malignancy and only dehydration is being treated, okay, through intravenous rehydration, the dehydration is sequenced first, followed by malignancy code. Okay. Next is treatment of a complication resulting from surgical procedure. When treatment for complication resulting from surgical procedure, designate the complication as principal diagnosis if treatment is directed at resolving that complication. Next guideline is primary malignancy previously excised. When primary malignancy has been previously excised or eradicated from its site and there is no further treatment directed to that site and there is no evidence of any existing primary malignancy at that particular site, a code from category Z85, which is for personal history of malignant neoplasm, should be used to indicate the former site of the malignancy. Okay. If that previously excised or that primary malignancy has been previously excised or eradicated from its site and there is no evidence of primary malignancy at that particular site, in that case only we can use history code. Okay, personal history code, which is from category Z85. Any mention of extension, invasion, or metastasis to another site is coded as secondary malignant neoplasm to that site. Okay, if if any mention of extension, invasion, or metastasis to another site is present in that report, then we have to code it as secondary malignant neoplasm. Okay. The secondary site must be principal diagnosis followed by Z85 code as a secondary. Clear? Means if primary malignancy is excised or completely eradicated from that site and there is no evidence of primary malignancy at that particular site, we have to use the code history code. Okay, but that cancer already gets spread to another site, we have to code that cancer as secondary malignant neoplasm, plus we'll also have to give history code because there is no evidence of the primary malignancy. Next guideline is admission encounters involving chemotherapy, immunotherapy, and radiation therapy. First one is episode of care involves surgical removal of neoplasm. When care involves surgical removal of neoplasm, primary or secondary site followed by adjunct chemotherapy or radiation treatment during the same episode of care, the code for the neoplasm should be assigned as principal or first listed diagnosis. Okay. Okay. Next, patients encounter solely for administration of cancer-related therapy. Okay, in that case, we'll use Z51.0, which is for radiation therapy, Z51.11, which is for chemotherapy, then Z51.12, which is for immunotherapy. Okay, this any one code from this, or if needed, if patient receive more than one of these therapies during the same admission, If a patient receives more than one of these therapies during same admission, okay, we can choose more than one code also as first listed or principal diagnosis, right? Third one is patient admitted for radiation therapy, chemotherapy or immunotherapy and develops complication. When patient is admitted for purpose of external beam radiation therapy, immunotherapy or chemotherapy and develops complications such as uncontrolled nausea, vomiting or dehydration, the principal or first listed diagnosis is G51. Okay, G51 series followed by any course for complications. Okay, if patient admitted for cancer related therapy and develops complication, in that case we'll code G51 category code as a primary followed by complication code. Then we'll see admission encounter to determine extent of malignancy. Okay, when the reason for admission or encounter is to determine extent of malignancy, such as paracentesis or thoracentesis, the primary malignancy or appropriate metastatic site is designated as principal or first listed diagnosis. Okay, the patient came for determining the extent of malignancy through the procedures such as paracentesis or thoracentesis. Our first listed diagnosis is that particular malignancy site. Symptoms, signs, and abnormal finding listed in chapter 18 associated with neoplasm. Chapter 18 is of sign and symptoms and abnormal finding chapter. Okay, if these sign and symptoms are related with neoplasm, in that case an existing primary or secondary site malignancy cannot be used to replace the malignancy as principal or first listed diagnosis, regardless of number of admission or encounter for the treatment. Okay. Next is admission and encounter for pain control and management. Okay. When pain control or pain management is reason for admission, okay, the underlying cause of pain should be reported as additional diagnosis. If no, pain control means like a patient with displaced intervertebral disc, nerve impingement, and severe back pain present for injection of steroid into spinal canal. In that case, underlying cause of pain should be reported as additional diagnosis. Next guideline is malignancy in two or more non-contiguous sites. A patient may have more than one malignant tumor in the same organ. Okay, patient may have more than one malignant tumor in the same site or same organ. These tumors may represent different primaries or metastatic disease depending on the site. Should the documentation be unclear, the provider should be queried as to status of each tumor so that correct code can be assigned. Okay, if more than one malignant tumor present in the same organ and you have different type of them, then and there is no clear documentation about it, which is primary, which is metastatic. Okay, in that case you have to query the provider. Disseminated malignant neoplasm unspecified, code C80.0. Disseminated malignant neoplasm unspecified is used for only in those cases where the patient has advanced metastatic disease and no known primary or secondary sites are specified. Okay, if patient has advanced metastatic disease, means there is no documentation of any primary or secondary site in the report, but patient has advanced metastatic disease. In that case, you have to choose C80.0 code, which is for disseminated malignant neoplasm unspecified site. It should not be used in place of assigning codes for primary site and all known secondary sites. If you know code means known primary side or secondary side, in that case you no need to use this C80.0 code. Next is malignant neoplasm without specification of site. Code C80.1, which is for malignant or primary neoplasm unspecified, which is equivalent to cancer unspecified. This code should only be used when no determination can be made as the primary site of malignancy. Okay, if there is no documentation of primary malignancy site, in that case you have to code C80.1, which is for unspecified cancer. Then we'll see sequencing of neoplasm codes. Okay. Encounter for treatment of primary malignancy. As we learned earlier, if treatment is for primary malignancy, we have to code that primary malignant neoplasm as a principal diagnosis followed by metastatic site. Encounter for treatment of secondary malignancy. If treatment is for secondary malignancy, we have to code that metastatic site as a principal diagnosis along with primary malignancy as additional code. Means it depends on treatment or reason for encounter. Okay. If reason for encounter is primary malignancy, treatment for primary malignancy, we have to code primary malignancy cancer as principal diagnosis. If treatment is for secondary malignancy, we have to code secondary malignant site as a principal diagnosis. Malignant neoplasm in pregnant patient. When pregnant patient has malignant neoplasm, a code from category O9A.1 and so on, which is for malignant neoplasm complicating pregnancy, childbirth, and the puerperium, should be sequenced first. Because as I told you earlier, for pregnant patient, we have to start our coding from O codes. Okay, our primary code from the O category. Okay, or this obstetric category. So there is code for neoplasm complicating pregnancy, which is O9A.1 series. Okay, this code should be sequenced first, followed by appropriate code from this neoplasm chapter to indicate type of neoplasm. Clear? Then next one is encounter for complication associated with neoplasm. When encounter is for management of complication associated with neoplasm, such as dehydration, and treatment is only for complication, in that case complication is coded first, followed by neoplasm code. Then complication from surgical procedure for treatment of a neoplasm. When an encounter is for treatment of complication resulting from a surgical procedure performed for treatment of a neoplasm, designate complication as primary or principal diagnosis. And pathological fracture due to neoplasm. When encounter is for pathological fracture due to neoplasm, and the focus of treatment is fracture. In that case, code from subcategory M84.5, which is for pathological fracture in neoplastic disease, should be sequenced first, followed by neoplasm code. Okay, if patient come with pathological fracture due to neoplasm and treatment is for that fracture only, in that case we have to code M84.5, which is for pathological fracture in neoplastic disease, as a first listed diagnosis, followed by neoplasm code. Okay, and if the focus of treatment is neoplasm with associated pathological fracture, neoplasm code should be sequenced first, followed by M84.5, which is for pathological fracture in neoplastic disease. Means again, sequencing is depend on region for encounter. Okay, but you have to keep it in mind this code, that M84.5, which is for pathological fracture in neoplastic disease. Then current malignancy versus personal history of malignancy. When primary malignancy has been excised, but further treatment such as additional surgery for malignancy, radiation therapy, or chemotherapy is directed to that site, the primary malignancy code should be used until treatment is completed. As we see in early previous guidelines also, if there is presence of that primary malignancy site, okay, in that case, or if treatment is going on for that primary malignancy site, we have to use primary malignancy code for that site. Okay, when primary malignancy has been previously excised or eradicated from its sites, there is no further treatment of the malignancy directed to that site, and there is no evidence of any existing primary malignancy at that site, a code from category Z85, which is for personal history of malignant neoplasm, should be used to indicate former site of malignancy. Okay, means if there is no evidence of that previously excised primary malignancy, we have to use Z85 code, which is for personal history. And if there is treatment going on for that particular primary malignancy site, we have to code primary malignancy code only. We can code that scenario as history. Next is leukemia, multiple myeloma, and malignant plasma cell neoplasms in remission versus personal history. Okay, the category for leukemia and category C90, multiple myeloma and malignant plasma cell neoplasms, have codes indicating whether or not the leukemia has achieved remission. Okay, there are also codes Z85.6, personal history of leukemia, Z85.79, personal history of other malignant neoplasm of lymphoid, hematopoietic, and related tissues. If the documentation is unclear as to whether leukemia has achieved remission, the provider should be queried. Okay. The next guideline is malignant neoplasm associated with transplanted organ. If malignant neoplasm of transplanted organ, it is coded as transplant complication. Okay. Assign code from category T86, which is for complications of transplanted organs and tissue, followed by code C80.2, which is for malignant neoplasm associated with transplanted organ. Okay, and plus use additional codes for specific malignancy. Correct? If malignant neoplasm associated with transplanted organ, first you need to code from category T86, which is for complication of transplanted organ, and then secondary code must be from C80.2, which is for malignant neoplasm associated with transplanted organ, and then additional code for specific malignancy. Next one is breast implant associated anaplastic large cell lymphoma. Okay, breast implants associated anaplastic large cell lymphoma, also known as BIAALCL. BIAALCL means breast implant associated anaplastic large cell lymphoma. BIAALCL is a type of lymphoma that can develop around breast implants. Okay, assign code C84.7A, anaplastic large cell lymphoma, ALK negative breast for BIAALCL. Do not assign a complication code from chapter 19. Okay, if breast implant associated anaplastic large cell lymphoma is there, assign code C84.7A. Next is secondary malignant neoplasm of lymphoid tissue. See here, this is the primary tumor, which is primary site. From here metastasis happen to lymph node, and this cancerous cell disseminated of tolerance metastasis to distant tissues. Okay, when malignant neoplasm of lymphoid tissue metastasis beyond the lymphoid node, a code from category C81 to C85 with a final character 9 should be assigned, identifying extranodal and solid organ sites. Okay, rather than a code for secondary neoplasm for affected solid organ. Okay, for example, for metastasis of B cell lymphoma to lung, brain, and left adrenal gland, assign code C83.39. Fourth character or final character, fifth character or final character must be 9, which is indicative of extranodal and solid organ site. Okay, diffuse large B cell lymphoma, extranodal and solid organ sites. Okay, because this lymphoma is spread to another distant organs. Correct? Now we'll see questions. Please open your icd10cmdata.com and try to find out the answers. Our first question is, a patient is seen for a malignant neoplasm of sigmoid colon. Try to search code and tell me. Then we will find. You have to search into neoplasm table of neoplasm.
Ma'am, answer is option C, ma'am.
Let's see. See 18.5. Okay, we'll check. Anyone? Any other answer? What? Okay, we'll find. I'm sorry.
Ma'am,
Yes, tell me. No worries, we'll find it.
10.7, ma'am.
7. We'll find out it. Okay. We have to go on index and then table of neoplasm. Then we have to search for colon. Okay. Sigmoid colon is there. That's the reason why we have to search for colon. See here. Code is C18.9 because it is malignant neoplasm. Cancer of colon. Okay. Malignant tumor of colon. Clear? So our answer is A. C18.9. Not 7 or not 0.5. C18.9 is correct answer for malignant neoplasm of sigmoid colon. Next question is, patient present with lump on his left thigh. It has been present for several months and is not painful. Exam reveals a lipoma. Means you have to go and search code for lipoma of left thigh. Try to find out the code and tell me. Done? Any answer? We have to
D,
go.
ma'am.
Yes, tell me.
D, ma'am.
Okay, we'll search. We have to go on to normal index. Okay, because we have to search code for lipoma. Then L term. Here we have to type it down, lipoma. Then into the lipoma, we have to search for particular site. We can see here site classification, arms, connective tissues. Then we have here, do we have thigh? No. So we have to search for leg. We have leg. Okay. We have to click on this code, and in here we can find left leg. Okay, because we have lipoma of left thigh, right? So it is D 17.24. That is the correct answer. Very good. You can see here lipoma of left lower limb. Okay, or left leg. So our answer is D. D 17.24. Lipoma of left thigh. Because as there is no specific code for thigh, we have to choose leg code. Okay. If there is a code for thigh, we will go for that code only. Right. Next question is, patient with carcinoma of the tip of the tongue extending to involve a ventral surface. Carcinoma of the tip of the tongue extending to involve ventral surface of the tongue. For this question, you have to go through table of neoplasm. Any answer? You have to search for tongue. But in tongue also we have specific site, tip of the tongue. This is little but tricky question because options are almost same also.
Option B.
Option B. Okay. Any other answer? Okay, we'll search for it. For this question, we have to go on to table of neoplasm again. Then what is happening? Okay, and we have to search for tongue. Okay, we have here C02.9 code. We go on this code, but here it says malignant neoplasm of tongue unspecified. Okay, means site is not specified here, but we have a specific site. Okay, so first we need to search whether we have code for that particular site or location. Okay, for that reason we need to go on this C02 C02. You have to click on this, and here again greater level of detail because this code is not complete code. You can see here red symbol, right? So this is non-billable or non-specific code. We have to go on this greater level of details to search our code. Now you can see here different codes under C02. C02.0 is for dorsal surface, then 0.1 is for border of the tongue, then one ventral surface, and so on. Okay. In our question we have tip of the tongue. Tip of the tongue comes under border of the tongue, right? That's the reason why we'll choose this code. This is the appropriate code. You see, malignant neoplasm of border of tongue. You can see here, applicable to malignant neoplasm of tip of the tongue. Right? Understand? First you need to try to search for specific code because here we have term tip of the tongue. So we can't directly choose unspecified code. First we need to search for is there any specific code for that particular site or location. Okay, and we have that code. That's the reason why we append on this code C02.1. Okay, so our answer is C02.1. Next question is, a patient is in her second trimester and was found to have follicular thyroid cancer. Here, don't take tension about this O codes or Z codes. Just tell me answer for C code, means cancer code. Again, to find this follicular thyroid cancer, you have to go through neoplasm table. Just tell me code for cancer only. You have only two options for that cancer code, C73 or C75.9. Because in these two options we have C75.9,
C, ma'am.
C, O9A.113, Z3A02 and C75.9. Means you want to say follicular thyroid cancer code is C75.9. Correct? We'll find out it.
Yes, ma'am.
Okay. Again, we have to go on this table and go for search for thyroid. Here, C73. Cancer for thyroid. Cancer for follicular thyroid. Okay. So this is wrong. C option is wrong option. Again, you can. How can you rule out the options? I'll tell you. In this case, first you have to search for. There is no need to go anywhere. Okay, to search the code at the first time, because this question has obstetric code. Okay, and in obstetric codes the last digit is representing of trimester. So here second trimester is there, so we need 2 as a last character, okay, of this O code. So we have only these two options. Correct? So these two options are wrong. That is confirmed. But our in these two options also we have two types of thyroid cancer codes, C73 and C75.9. So we have only two options, A and B. If you find if the cancer code, will get C73. Okay. So our correct answer is A, O9A.112. 2 is representative of the second trimester, then Z3A.00 and then C73, because follicular thyroid cancer is C73. Okay. While going for any exam, this medical coding exam, you'll get same type of question. Okay, you have four options, multiple choice questions are there, and you have 4 options. So you need to know how to rule out the answers so that it will be easy to find the correct answer. Okay. Next question is, patient with viral hepatitis C and continued alcohol use is diagnosed with malignant primary neoplasm of the liver. Just tell the code for malignant primary neoplasm of liver. Again, you need to go through table of neoplasm only. But try to find out
D, ma'am.
D.
Hmm.
Which you want to say C22.9 is correct code. Okay, we'll see. We have to go here and I'm sorry, we have to find for liver, right? Okay, in liver we'll find malignant primary C22.9. But if you read the description, it says malignant neoplasm of liver not specified as primary or secondary, right? But in our question, it is mentioned that malignant primary neoplasm of liver, right? So again, like we do in previous question, you have to go on this C22 category, greater level of details, and here we have to search for specific code. Here you can see C22.8, which is for malignant neoplasm of liver primary. Okay, so this is code for primary malignant neoplasm of liver. This is specific code. C22.9 not specified as primary or secondary. Okay, but C22.8 is specified for primary site. Malignant neoplasm of liver primary specified. Here also you can see primary malignant neoplasm of liver. Again here B19.20 is for viral hepatitis C and F10.99 is for alcohol use. Okay, like this you have to solve your questions. Once again, thank you for your attention. Thank you for making this session interactive, and have a good day. If you like this session, if you like to learn medical coding with me, and if you want to learn more about medical coding and medical coding guidelines, please go on the given link below, www.greatonlinetraining.com, and register yourself. Bye bye. Take care.